Good morning, everyone. Am I audible?
Good morning, ma'am. Yes, ma'am, you are audible.
Okay, sir. We'll start in just 1 or 2 minutes.
Yes, ma'am. Good morning, Dharmani, sir. Sir, good morning.
Good morning, sir.
ಚೆನ್ನಾಗಿದ್ದೀರಾ ಸರ್?
ಚೆನ್ನಾಗಿದೆ ಸರ್. Raghu, good morning.
Namaste, sir. Good morning.
So, shall we
Good morning to everybody.
Namaste, sir.
Namaskar.
Okay,
Good
sir.
morning.
Good morning, Sahil sir. Good morning, Ramana sir.
Good morning, sir. Good morning to everybody.
Good morning, sir. Good morning to all.
Namaste.
This meeting is being recorded.
Sir, ಸ್ವಲ್ಪ cotton ಕೊಡಿ. Clean the camera.
Good morning, everyone. I warmly welcome all of you for this session 4 of the pre-conference virtual presentations organized on the occasion of International Conference on Ayurveda and Integrative Approaches to Obesity and Metabolic Syndrome, scheduled to be held on 1st and 2nd December 2025. We have the judges for today. It is my honor to introduce Dr. Ramesh Kumar KL, who is currently serving as the Associate Professor in the Translational Research Division at the All India Institute of Ayurveda, Ministry of Ayush, New Delhi. He has over 10 years of academic experience as an assistant professor in various reputed institutions and has also served as research officer at CPRS, contributing to scientific advancement through national research initiatives. Before joining All India Institute, he has worked as assistant professor in Samhita and Siddhanta at JMC Mysore under the Karnataka Public Service Commission. Sir is actively involved in academic leadership and scholarly activities. He is a member of Board of Studies at RGHS, Bangalore, a member of the editorial board of Journal of Indian Medical Heritage, and a contributor to content development and validation for PG electives at NCISM. He also serves as the reviewer of several reputed journals in the field of Ayurveda. We are privileged to welcome Dr. Ramesh Kumar as a distinguished judge for today's session. I would also like to welcome Dr. Bairesh A, who is a postgraduate earlier and a postgraduate diploma in hospital and health management assessor of NABH and is currently heading the prestigious Adichunchandiri Ayurveda Medical College at Mangalore as principal. Dr. Bairesh is also the consulting physician at Ayurveda Hospital, the first NABH accredited hospital, Ayurveda hospital in India. He is actively involved in drafting and revising the NABH Ayurveda Accreditation Standard Second Edition. He has published articles in Kannada and English in newspapers, magazines, and peer-reviewed journals. He has delivered talks in radio and television on health-related topics. He has delivered lectures in various seminars and symposiums and has trained doctors in workshops on Ayurveda Pancharma procedures. He has been a trainer for NABH assessor and has conducted a POI for NABH standards. He has guided more than 20 postgraduate students and is a member of ethical committee of leading research institutes. He is the recipient of Gold Medal and Dabar Ayurveda Award for securing highest marks in BAMS. He is actively involved in documenting traditional healing practices under RRC, UDPI and FRLHT. He has been an organizing committee member for various state and national level seminars. He is also the associate editor of Ayurveda line, a biannual on the Ayurvedic medicaments. We are privileged to welcome you, Dr. Bairesh sir, as a distinguished judge for today's event.
Thank you, ma'am.
We also have Dr. S.S. Dormani sir, our own faculty, who is currently serving as research officer Ayurveda at CCRS, Cary, Bangalore. Sir has joined CCRS in 2006 and has been actively involved in the national level clinical research initiatives. He has served in research institutes at Jammu and Kashmir and Kerala as Panchkarma expert. As principal investigator and co-investigator, he has handled nearly 20 intramural research projects, collaborative and outreach projects. He also served as chairman of the Institutional Ethical Committee at Sri Kalabhairaveshwara Institute of Ayurvedic Sciences, Bengaluru. Sir has published over 47 scientific research papers in national and international journals, is a reviewer and advisory board member of reputed publications, and has guided more than 28 postgraduate dissertations. We are honored to have Dr. S. Dormani sir as one of the distinguished judges for today's event. Thank you all for joining us. And now we'll begin with the presentations. A brief instruction to all the candidates. Participants are strictly instructed to adhere to the allotted time, which will be considered as one of the evaluation criteria. Please keep your camera on throughout your presentation. Ensure that you are in a location with a stable network and reliable internet connectivity. Those who are not presenting are kindly requested to keep your microphones muted. With this brief thing, we will start with first presentation for today. Abstract number 40, Dr. Niranjana Gopal K. The title is Molecular Basis of Fenugreek as a Nutraceutical for Testing Diabetic Neuropathy. Dr. Niranjana Gopal, are you there?
Yes, ma'am. Good morning, ma'am. Am I audible, ma'am?
Yes.
Can I start my presentation? Should I share my screen?
Yes, you can share your presentation. Judges, hope you are ready. Can we start?
Ma'am,
Yes, ma'am.
the host can only share the presentation.
We'll do it for 1 second. Present now? Are you able to do it?
Yes, ma'am. Ma'am, is it visible, ma'am?
So it is visible. Full screen, do it full screen. And
Is it okay, ma'am?
Make it.
no, make it full screen. It is still in the side. Can you click on those 3 dots below? Below your PPT?
Yeah.
Yeah.
Hide present.
And
Hide present.
hide present. Presenter view.
Is it now clear, ma'am?
Yes, yes. Yes, you can present now.
Okay, one second. I just change this tab to. Okay. Good morning. I'm Dr. Niranjana Gopal, postdoctoral fellow from India University Biomedical Research Center and Super Specialty Hospital, Kottayam. Today, I am going to present the topic which connects the traditional Ayurveda medicine with the precision of concept of molecular medicine. That is molecular basis of fenugreek as a nutraceutical for treating diabetic neuropathy. So, diabetic peripheral neuropathy is one of the major complications of diabetes. And globally, 1/3 of the people with the diabetes is occurring diabetic peripheral neuropathy or DPN. And its prevalence is high. Why? Because the treatment only focused on the symptomatic relief, not the underlying pathology. So, its prevalence is very high. When it coming to Ayurveda, the Prameha Upadrava, it is considered as the Prameha Upadrava, where the Vada is the main culprit in forming that. So, there are various traditional preparations to treat Prameha or Prameha Upadrava in our classes. But here, I am taking the candidate fenugreek. Fenugreek is widely used from the traditional Ayurveda system and it shows a good effect in glycemic control and as well as in metabolomic profile. And there is a critical gap. What is that? When we look into the scientific evidence of fenugreek with diabetic peripheral neuropathy, it's very much lacking. So there is no consolidated Ayurveda evidence-based data which showing fenugreek in diabetic peripheral neuropathy. So that areas me to do a white space analysis. From white space analysis, we understand what we have and what we're missing. From that, we found there are various studies showing that fenugreek in diabetes and not any study showing diabetic peripheral neuropathy with fenugreek or as a nutraceutical. Here, the green axis shows the manuscript we refer and the blue are the reviewers and the x-axis shows the number of keywords we use. From this, we found that there is a lacking of proteomics-based data on diabetic peripheral neuropathy with the action of fenugreek. From that thought, we found a logistical evidence-based data or proposing a study which shows we will administer fenugreek in DPN patients or subjects and we will understand or look into the proteomic profiling before and after administration of fenugreek. From that, we can understand how this fenugreek will act on the diabetic peripheral neuropathy linked proteins. And from that, we will get a clear-cut idea of how the molecular mechanism of fenugreek is acting on diabetic peripheral neuropathy. So, let's understand the fenugreek in detail. Here, the left side shows the Rasaguna Virya Vibhaga of fenugreek and the right side shows the phytochemical profile, including the major constituents as trigonelline, digoxin, 4-hydroxy isoleucine, and quercetin. Before understanding the effect of a drug in a disease, we should understand the cellular mechanism or metabolism, how it is happening. The main culprit, we all know that it is increase in glucose. So, increase in glucose further lead to increase in sorbitol, increase in acetylcholine A, and also increase in ACE, which in turn lead to the inflammation, mitochondrial dysfunction, apoptosis, cytoskeletal damage. This all leading to myelin loss and axonal degeneration, which leading to DPN. Now, let's discuss how this fenugreek is acting on the cellular mechanism. When looking to the Ayurveda concept, firstly, the Rasa. Rasa is Tikta Kashaya. The Tikta Kashaya will help in Amapajana, Srodhorodhana, and Aknidipana. When looking into the scientific concept, we can found that it will help to reduce hypoglycemia, reduce ages, and help in detoxification, and also increase the metabolism. That in turn showing it effect in DPN in molecular basis. When coming to Guna, it is Legosnigtha. So it will also help in improve the metabolism, reduce the dryness, improve the nerve lubrication and conductivity. And also coming to Virya and Vibhaga, it is Ushna Virya and Kadu Vibhaga. So this both will directly act on pacifying the Vada, the main culprit of DPN. And when looking to scientific insight, it will enhance the circulation, enhance the metabolism, enhance the neural circulation and conductivity too. So in total or in general, we can say that fenugreek and through Ayurveda lens have a great effect in DPN in molecular basis. Let's look into the modern science or modern aspects. The major constituents are I already mentioned. When coming to trigonelline help in signaling, regulate the signaling pathway and controlling of GPL1R. Then digoxin will help in reducing the axonal degeneration and myelin loss, where quercetin will help in reduce oxidative stress, which is one of the major part of occurring DPN. And last one is 4-hydroxyisoleucine, which help in reducing the neurotoxicity and help in neuroprotection. These all are generally showing how the fenugreek in both modern and Ayurveda help in regulating DPN. These are some of the Ayurveda classical preparation which used to treat diabetes, and some of the scientific insights also I am mentioning here. And I would like to simply conclude that the fenugreek has a great effect in diabetes in both Ayurveda as well as in modern aspect. It's not just a drug, it will help to understand the diabetes and also its action in molecular pathways. And here I am putting forward an effort to understand, integrate how Ayurveda is well versed in an evidence-based data, and we can give a good scientific validation with our old traditional drugs. Here I am taking methi or fenugreek. So I just concluding and that my presentation and acknowledging my financial support, CCRA, and my university in the University Biomedical Research Center and the authors for the review paper. Thank you.
Thank you, Dr. Niranjana. Judges, any questions?
Could you please explain where this study was conducted and other details about it?
So it's a study proposal that I would like to do in further. Now I am working on proteomics on diabetic peripheral neuropathy and Prakriti under CCRA. So it will be a next step where I can put forward a study on fenugreek and diabetic peripheral neuropathy. This is a review paper where I searched certain reviews and I found this much data. So this is the actual initial stage of literature review.
You respond to like focus on only academic studies, or you would you are planning to take it to the next level? Do you have any like plans for in vivo models, or any further directly want to you're thinking about clinical?
So I'm interested in doing clinical study because the action of fenugreek in diabetes is already animal studies are there, and fenugreek will firstly give a good symptomatic relief in the initial stages. So I would like to do a proteomic profiling in clinical samples, administering fenugreek as a nutraceutical as a capsule or 3 to 4 grams of powder. So I wish to do a clinical study, but after completing my diabetic peripheral neuropathy and proteomic profiling, let's understand the proteins, and then I will put forward whether I should go with an in vivo. Maybe I will do both. I like to do both.
Yeah, that's right. You're right. Through the proteomic study, you could be able to target, identify the exact protein and the candidate molecule, which can have the affinity towards, the binding and whatever the clinical outcome that we may expect in the preclinical screening, like molecular docking or in this way.
Yes.
But when we want to actually take this formulation into clinical, and then the fundamental the concept what we are talking about, the protein and the target. So that is practically like how you have planned to retain or to achieve the objectives of its efficacy in clinical. Are you going for any characterization? Or do you have any plan to improvise the formulations for better efficacy, or you want to just go with only fenugreek isolated molecule? You want to how do you do?
So primarily, I'm focusing on fenugreek as a drug. It's not other drug is incorporating. I would like to do a fenugreek, only fenugreek, its molecular pathway. And firstly, now I am currently working on an in silico study, how fenugreek can act on diabetes. And in silico study is going through. After that, I'm looking only fenugreek with which will be administered in clinical samples. Now I already mentioned that I am working in a diabetic peripheral neuropathy proteomic study. So at the end of my study, I will get certain protein markers which are directly acting on diabetic peripheral neuropathy. So I will be using that as a preliminary data for my further fenugreek study in diabetic peripheral neuropathy. So I will understand what are the proteins or what are the metabolism or the metabolic pathway which affect on diabetic peripheral neuropathy.
Yeah.
Currently,
So I just want to make the thing very clearly. In silico modeling, we would be able to identify some molecular pathways as well as the target protein.
Yes.
But when we actually do it in clinical trials, and what we actually expect in silico profiling is not actually going to possible in clinical trials, where because in real time clinical experimentations, there are many factors that influences the clinical outcome. So, is it going to be only identifying a candidate molecule, or if you want to really take it to the clinical trial, then practically you are using the whole fenugreek into the clinical intervention. So probably what you are expecting through in silico, that may be promising, but in clinical trial you would not be able to actually find the clinical outcome. So this is the case what we are observing most of the clinical trials, even with the when we follow the in silico model into the clinical trials. So how are you going to overcome, or are you going to have a different set of objectives for clinical trials with this lead?
Okay, so in clinical trial, my first objective will be administration of fenugreek in clinical subject and understand its proteomic profile. So we can understand what are the proteins are changed or influenced by fenugreek, which are linking to diabetic peripheral neuropathy. That itself shows a molecular evidence based data on action of fenugreek in molecular level itself.
Yes. So in that case, you may have to limit your objectives only to the proteomics. It is as good as like FIH trials or the phase 1 trials to know the mechanism of the drug with regard to the the pathways. So not expecting the clinical outcome.
Okay.
No, it may be possible, but in clinical trials, probably what the objectives we expect to achieve in terms of the overall improvement of the disease condition, that may not be able to achieve it in practical reality. Yes.
Yes, sir. Thank you, sir. Thank you for the session and valuable knowledge. I will look forward on to that when I put forward my study. I will surely look on that, sir.
Thank you, Dr. Niranjana. You can, if no questions from other judges, can we move to the next presentation? Yes,
Thank you all.
thank you. Next presentation is by Dr. P. Leela Prashanti. The topic is an integrated Panchakarma approach in the management of dyslipidemia, a case series. Dr. Leela, are you there?
Yes, ma'am.
Yes.
Shall I start now?
Yes.
A very good morning to everyone. Myself, Dr. Leela Prashanti, second year PG Scholar, Department of Panchakarma. Today, I will be presenting my topic that is an integrated Panchakarma approach in the management of dyslipidemia. It's a case series and it was under the guidance of Dr. V. Lakshmana Prasad, sir, Professor, Department of Panchakarma. Coming to the definition, the dyslipidemia is a disorder of lipid or lipoprotein metabolism characterized by elevated levels of total cholesterol, LDL, HDL, and VLDL and triglycerides in the blood. This slide shows the lipid values, that is total cholesterol less than 200 mg is normal, borderline 200 to 239, and high risk more than 240. And HDL 40 to 60 is acceptable range, and less than 40 and more than 60 are considered as high risk. And LDL less than 100 mg is normal, and 130 to 159 is borderline, and more than 160 is high risk. And LDL less than, and triglycerides less than 150 mg is mg per dl is normal range, and borderline 150 to 199 mg per dl, and high risk 200 mg per dl. And VLDL is 2 to 30 mg per dl is normal range, and more than 30 mg per dl is high risk. And according to Ayurveda, there is no direct reference for dyslipidemia, but we can be correlated with Medorogas, and causative factors is classified as Aharaja conditions like intake of Madhura, Snigdha, Guru, Pichala, Guda, Aharas, and Vihara like Chesta, Dveshi, Diva, Swapna, Abhyayamat, and Manasika causative factors like Shoka, Krodha, etc. And Sharirika may be Bija doshas or any familial hereditary causes. And clinical findings classified as Medo Pradoshaja Vikaras like Granthi, Premeha, Atistaulia conditions, and Astanindita Purishas and Premeha Purvarupas. Need of Ayurvedic intervention in the management of dyslipidemia because of a prevalence rate is globally more in urban area than a rural area. Prevalence depends on the place, gender, and lifestyle, and risk factors like non-modifiable factors like family history, modifiable factors like sedentary lifestyle, alcohol consumption, high intake of fats, and medical conditions like metabolic syndrome, diabetic mellitus, and drugs like thiazides, cyclosporins, and corticosteroids. And dyslipidemia is one of the major leading cause for the metabolic, systemic, and endocrinal diseases, and like atherosclerotic cardiovascular diseases and stroke. A long-term dependence on medications like statins, bile acid derivatives, and any fibrates, and its adverse effects limits the effectiveness of the modern management. But Ayurveda aims to correct the underlying metabolic derangements. Ayurveda offers a holistic and individualized approach to Ahara, Vihara, Aushadha, and Panchakarma. Here, after reviewing all the classics and articles, Panchakarma shows a significant improvement in the management of dyslipidemia. And Samshodhana is one of the line of treatment for Santarpanajanya Vyadhis and Bahadosha Avastha. And here, our objective is to evaluate the efficacy of Snehapana followed by Virechana Karma in the management of dyslipidemia because Agni is a major positive factor and it is a main role for the pathogenesis of the Medo Roga. So our treatment protocol is Deepana Pachana with Chitrikadi Vati for 3 days and Snehapana with Muchita Tilataila for 3 to 7 days and Abhyangana and Nadishvedam for 3 days and Virechana Karma with the Chuna for 1 day and Samsajjana Krama according to the Shuddhi. And assessment parameter lipid profile before and after. And this slide shows the before and after lipid profile results and total cholesterol before 227.2 mg per dl and after Virechana Karma it is 203.6 mg per dl and coming to triglycerides before it is 219.6 and after Virechana Karma it comes to 175 mg per dl and before HDL 41.2 and after it was 41.8 and LDL before 142.2 mg per dl and after treatment it was 125 mg per dl. And coming to VLDL, it's 43.8 before and after VLDL. The discussion part, Deepana Pachana with Chitrikadi Vati improved Agni and reduced Ama, helping better digestion and metabolic preparation for further therapy. And Snehapana with Muchita Tilataila enhanced internal oleation, corrected Datvagni and supported mobilization of stored lipids through its antioxidant and hypolipidemic actions. And Abhyangana and Nadishvada liquefied and mobilized vitiated doshas while improving circulation and lymphatic flow, preparing the body for effective elimination. And Virechana facilitates excretion of Pitta, Kapha and Medo Drishti, enhances the bile flow and hepatic clearance, resulting in better lipid metabolism. And Samsajjana Krama restored Agni and stabilized the digestion, supportive healing and recovery and balanced metabolism. In conclusion, Snehapana with Muchita Tilataila followed by Virechana Karma with Trivrit Churna is effective in the management of a selective range of dyslipidemic conditions. Here we consider the borderline of lipid profile range, and this highlights the Ayurveda's role as an integrative approach for dyslipidemia. Thank you for giving me this opportunity.
Thank you, Dr. Leela. Over to Judge.
Dr. Leela?
Yes, sir.
Yes, ma'am. See, study with a small sample size is good.
Yes.
Approach
Yes,
is
sir.
good.
Yes,
But being a PG scholar, you have to understand one. When you say that Prameha is Santarpanotta, you have two
yes.
types of Prameha. One is Stula, Krisha. So probably you
Yes.
can specify that you had done this study on a Stula Pramehi or Santarpanotta Prameha.
Yes, sir.
There the
Yes, sir.
entire idea will be doing Apatarpana.
Yes, sir.
And probably the Virechana Dravya, what you have selected, could be a Ruksha Virechana rather than Trivrata.
Oh, yes, sir.
So something like this, like attempt is good, but if you can
Yes.
fine tune, because good
Yes.
for a PG scholar to think on these lines. See,
Yes,
ma,
sir.
going further, if you can correct that, it will be good.
Okay, sir. Okay, sir. I will go through this. Thank you, sir.
no more questions. We'll go for the next presentation. Thank you, Dr. Leela.
Thank
I request others to kindly mute your mic when somebody is presenting. Next presentation will be Dr. Sri Ranjini. Topic is Ayurvedic protocol in the management of diabetic dyslipidemia, addressing gut dysbiosis and metabolic imbalance. Case report.
Am I audible, ma'am?
Yes. You can share your presentation.
Is my screen visible, ma'am?
No, the previous presentation has to be removed. Dr. Leela, if you can unshare your screen. Yes. Please do that.
Good morning, respected judges. Today I'm here to present on the topic Ayurvedic protocol in the management of diabetic dyslipidemia, addressing dysbiosis and metabolic imbalance. It is a case report. So there is a prevalence of diabetic dyslipidemia and about 56% to 80% of type 2 diabetes patients. And diabetic dyslipidemia is characterized by elevated triglycerides, total cholesterol, LDL, and reduced HDL. Due to the alterations in the gut microbiota composition, which influence the bile acid circulation and short-chain fatty acids, and also the inflammatory mediators.
Excuse me, there is an echo. Can you please off one other device if you're on two devices?
Sorry, ma'am.
There are two, there is echo going on. If you have on two devices, please off one of them.
Okay, ma'am. This is a case study of diabetic dyslipidemia, highlighting the effectiveness of comprehensive Ayurvedic approach, targeting Agnimandyam, and Kapha-Meda Dushti. So coming to the presentation, here is a 42-year-old male patient who has gradual increase in body weight, who is presented with complaints of fatigue and hello, ma'am. Presented with complaints of fatigue, heaviness of body, and also loss of appetite, excessive thirst, sweating, increased frequency of micturition, external dyspnea for past 1 year. He has a mixed diet with poor appetite, regular bowel, and with increased micturition, especially nocturnal micturition. Patient's prakriti is Kapha Pittaja with mikriti of Kapha Vata Dushti, Rasa Meda Dushti, and the patient's Ahara Shakti and Jalana Shakti is also Avara. And as already mentioned, the Mutra is Prabhuta in nature. The patient, on examination, his general inspection, he has central obesity with abdominal fat deposition, and there is also a mild pigmentation over the neck folds, which can be premonitory symptom for acanthosis nigricans also. The patient's weight is 82 kgs, the BMI is 28.5, which is the overweight according to the WHO classification. The hip-waist ratio is 0.92, the waist height ratio is 0.56. And in the previous investigation, which we have taken before the treatment, the fasting blood sugar is 220, postprandial is 385, total cholesterol is 290, triglyceride is 335, HDL is 30, and LDL is 159.9. So, based on the symptoms and also on the investigation, the diagnosis was made as diabetic dyslipidemia, which can be correlated to Medo Rogam in Ayurveda. The treatment, the therapeutic intervention initially started with Deepana Pachana with Panchakola Churnam, 5 grams morning and evening after food. And it was later it was proceeded with Kadara Kadiradi Kashayam and Varanadi Kashayam, 7.5 ml each, twice daily before food, along with Chandraprabha Vati 101. Then Navaka Gugulu 202 was also given, and Lashana Shirapakam was given 50 ml at bedtime, not only as it is Medoharam, but also for as Hridyam and Rasayanam it was given. And the Panchakarma procedures, Udvartanam was done with Kola Kolatadi Churnam for the first 3 days. Then Sadhyo Virechanam was given with Gandharvastadi Air and Thailam. Then Churna Pinda Svedam was started with Triphala Churnam and Kolatadi Churnam, which was proceeded for 7 days. Along with it, Lekana Vasti was also given with Pipalyadi Anuvasana Thailam, Gomutram, and Triphala Kashayam. So this is the after treatment and follow-up result. After treatment, the FBS has come to 154, postprandial 240, total cholesterol 119, triglyceride 208, HDL 39, and LDL 98. And then follow up, it is the fasting blood sugar is 134, postprandial 190, total cholesterol 121, triglyceride 176, HDL 40, and LDL 78. And the patient has lost weight from 80 to 75.1, and in follow-up 71.1 kg. So coming to the probable mode of action, Panchakola Churnam was initially given for Deepana Pachana purpose. Since it is Katurasa Ushnavidya Tikshna Guna, it can exhibit a selective antimicrobial and also a carminative action. It will reduce the overgrowth of the pathogenic liposaccharide, which produces the gut bacteria. Coming to Kada Kadaradi Kashayam and Varanadi Kashayam, both the Kashayam, it is Katu Tiktarasa, Ushnavirya, and it is Kafamedo in nature. It also contains chemical constituents like epicatechin, luteol, which will enhance the hepatic lipid metabolism, which will improve the insulin sensitivity. Coming to Navaka Gugulu, it also contains Katatiktarasa, Ushnavirya, Lekana Medohara properties. It will act via the farnesoid X receptor antagonism and will enhance the cholesterol catabolism. And coming to Chandrababavati, it is also Rasayana and it helps in insulin sensitivity. Lashuna Shirapakam, as already mentioned, it is given not only to improve the digestion or metabolism, but also for cardioprotective effect. Coming to the proper mode of action of the therapeutic procedures, Udvartanam is done initially due to its Ruksha Ushna Guna of the Kolakoratadi Churnam for Ama Pachana and Lekana purpose also to help to correct the Kaphameda Dushti. It enhances microcirculation and also improves the lymphatic drainage and reduces adipose congestion. Coming to Sadhya Virechana, it is done to eliminate the Medavaha Sroto Dushti and also to expel the accumulated AMA and endotoxin that produce the pathogenic liposaccharide producing gut flora, and it will also enhance the short chain fatty acid producing gut microbiota. And coming to Churnapinda Svedam, Churnapinda Svedam was chosen here because the patient also complained of joint pain, and it also promotes vasodilation and enhances Medha Vilayana. And coming to Lekana Vasti was given with the Katu Tikta Kashaya, Lavana Rasa, Ruksha Tikshna, Lakuguna, and there's also Ushna Vidya and Katu Vipaka in nature. So it helps in bile secretion, improves the gut motility, enhances hepatic detoxification also, and it also helps in suppression of the pathogenic gut flora, supporting the short chain fatty acids. So coming to the conclusion, in this case report, it not only targeted on Agni Mandya, Ama and Kaphameda Dushti, but also the underlying pathology of diabetic dyslipidemia, that is the gut dysbiosis, by reducing the pathogenic liposaccharide. And in the result, we have seen that there is a significant result in the lipid profile and also in the diabetic profile and the waist-hip ratio and waist-height ratio. So these are the references. Thank you.
Dr. Sriranjini, you have presented almost with all checklists of care guidelines. But I did not see the patient perspective on informed consent. You did not show in the as per the checklist care.
Sorry, sir, I couldn't upload that.
Yeah.
I'll make sure I do it in the further presentation, sir.
Dr. Sriranjini, this is a single case study, right?
Yes, sir. It's a case
Okay,
report.
ma'am. Now, how do you say that your Sadhyo Virechana can act at the level of Medovahashrutas?
Sir, there is Baddha Medus and also involvement of Kapha and Pitta in the pathogenesis of Medorogam, sir. So,
No, agreed with the
Virechana is also
Samprapti
done
there,
here.
ma'am.
Sorry, sir?
No, agreed with your Samprapti. Where the concern is, you'll have to understand the limitation of Sadhyo Virechana.
Yes, sir.
When you want to go with Sadhyo Virechana, only the doshas in the koshta can be eliminated out. Suppose you put it as like before giving a Lekanavasti, you want to clear the gut. So thereby you give Sadhya Virechana accepted. After Udvartana, Rukshana is there in the body. Without doing Arohana Smeyapana, getting the doshas from Shaka to Koshta, you can't claim Medovaha Shroto Dushti after your Sadhya Virechana. There are some limitations for your Sadhya Virechana.
Yes, sir.
So after your Sadhya Virechana, again you have gone for Churna Pindasveda, which is again a Rukshana. You told that it was because of the pain in joints.
Yes, yes.
So when you say pain in joints, after your Sadhya Udvartana and Virechana, Rukshata is more, you should have gone with Abhyanga. Why again Rukshana there?
Sir, as a patient was having heaviness of body along with the joint pain, we thought instead of going with Abhyanga, Churna Pindasvedam was a better option, sir.
Fine, ma. But since it's a single case study, the amount of outcome you have attributed to each treatment goes into debate, ma. But a good attempt.
Okay, sir. Yes, yes, yes. Thank you, sir.
Thank you, Dr. Sriranjani. Next presentation number 43, Dr. Pooja. Topic Ayurvedic management of dyslipidemia, a case study. Dr. Pooja, are you there? Dr. Pooja? Dr. Pooja, are you there?
We'll take up next.
Okay, I think we'll take up next presentation and come back to Pooja. Is that okay, judges?
Yes,
Yes,
ma'am.
you may proceed.
Yes, presentation number 44, Dr. Tanuja BM. Dr. Tanuja, you can start your presentation. Presentation number 44. Please unmute yourself.
Is it visible, ma'am?
Screen is not yet visible. You have started sharing, I think. Screen is not visible.
Yes, ma'am.
Yes, full screen, please.
Yes, ma'am. Is it
Presentation mode. Yes. Start.
Good morning, everybody. Myself, Dr. Tanuja, second year PG scholar from the Department of Shastra. My topic is Tilnala Pratisarane Kshara and the management of Abhyantara Ashes, that is second degree internal hemorrhoids. These are the contents. The introduction goes like Ashes is one of the rash-related hemorrhoids in the contemporary sciences, and with the prevalence of 50% in both the male and female, and having 4.4% of prevalence rate in the 10 million with the 30-65 years of the age.
Dr.
This is
Tanuja,
the case of the patient of 32 years male. Yes,
Tanuja,
ma'am.
slide is not moving. Yeah, now it is moving.
Yes, ma'am. 32 years patient with the he came to our hospital and he is having the chief complaint of mass per annum since 3 months, along with the associated complaints like pain and outpatient, and had heart stool since 20 days. He was apparently normal with the 3 months back, and he is known case of diabetic mellitus with the kg of 80, and he is having no history of surgical and drug and family history, and he is having and he is having the systemic examinations like respiratory system, bilateral airway clear and no abnormality found, with the CVS and CNS are normal, per abdomen is soft and non-tender, and Astasthana Pariksha goes like Nadi is Sarpagati, Mala is Nirama, Mutra is Prakruta, Jihva is Malika, Shabda is Prakruta, Sparsha, Druk and Akruti is Prakruta. He is taking with the food of both mixed veg and non-veg. He is a labor with the Mrudu Kosta and the Madhyamagni, the disturbed sleep. And he is having clinical presentation of BP 178 per minute, SpO2 99%, and respiratory rate is of 18 to 20 beats per minute. Temperature is normal with a weight of 80 kg. This is the clinical examination what we have done. With the inspection of no scar marks was identified and no external opening. With the external, no any external mass and along with that fish found around it. And then with the palpation, along with the proctoscopic examination, we got second degree internal hemorrhoids at 3 o'clock position. Distal rectal examination, in that sphincter tone was normal. As we go up to the investigations, HB was 12.4 grams, BT was 2.32 minutes, and CT is 3.17 minutes, and serum creatinine is 1.05 mg. Along with that, serology was normal. As we go to the Nidana, he was having the hard stools and it is of painful irregularly and with the along with the complaint of perineum and umbilical and is having aversion of food, irregular conditions. Digestion will be difficult when taken non-veg food. And his Nidana was like he was eating the Kashatikta food along with that cold food intake. And this Samprapti goes like with the doshas of Kapha and Pitta, Dushtis of Tikta, Rakta, Mamsa and Meda, Agni is Satragni, Tajanya Ama, Shota Dushtis are Rakta, Mamsa, Meda and Rasavaha. Diagnosis goes with the Kaphaja Arshas with the primary second degree internal hemorrhoids. We have here Tiranala Pratisarniya Kshara or with the informed consent under the local anesthesia we have tried. As we applied Tiranala Pratisarniya Kshara to the mass at the 3 o'clock position. After application, we have waited for 100 matra kala, that is approximately of 1 minute. After the application, we got the Pakva Jamfara. Before that, we have got the Nimbus Varasa and then followed by the NS wash. This is the discussion and conclusion of the case. As the Ashes is Mrudu, Prasuta, Avagana and Ruchita and having the having the nature of Ridoshaja and Kshatrakarma, which is minimal invasive, and we have followed up the patient for first 8th, 21st, and 20th day, so that we got mucus distal pleuritis and proctoscopic examination shows the mass was regressed at the 28th day. And this Tilanala is of Madhura Kashaya Tikta Katurasa Pradana and it is of Ushna Virya Madhura Vipaka and it is processed with the qualities of Vatahara, Vranahara and Shula Prashamana nature and it is Tridosha Shamaka. So we have tried this in Abhyantarashas, that is second degree internal hemorrhoids. These are the references where I have got. Thank you.
Thank you, Dr. Tanuja.
Dr. Tanuja, is this a single case study, na?
Yes, sir. Yes, sir.
So you have written in your title case study. It should have been ideally case report. If it is a case study, then you have to incorporate the detailed qualitative methodology, which is much more comprehensive than a typical case report, where you have to go for a comprehensive analysis of the data with regard to personal interviews or other sources of data. So the result should be much intense than a case report. So if that is, you are not meeting the criteria of a methodology for a case study, then you have to mention it as case report itself and follow the checklist which is prescribed under the care guidelines for the presentation.
Thank you, sir.
Dr. Tanuja?
Yes, sir.
Like you had mentioned that the patient is diabetic.
Yes, sir.
So is it a Nidhanarthakara Roga, your Arshas, or it is a Upadrava of Prameha? Any relation there? Have you tried to evaluate?
Sir, Nidhanarthakara.
Sorry, ma'am?
Nidhanarthakara, sir, we have tried.
But nowhere you mentioned that in your slide. See, because if you're trying to understand a metabolic disorder, if not treated, it can manifest like that. Then you'll also have to put a note, right?
Yes, sir.
What was the reason his diabetes was not managed? What was the diabetes parameter there? Like, for example, at least HbA1c, what was it? If you're putting it as Nidana,
His HbA1c was 7.8.
sorry, ma?
Oh, 7.8, sir.
7.8. Okay, ma'am.
Thank you, sir.
Thank you, Dr. Tanuja. Next presentation, 45, Dr. Jenu. Dr. Jenu and Benny, are you there? Yes.
Am I audible, ma'am?
Yes, please put it in full screen. Dr. Jenu, any problem? Jenu, do you want some time? Shall we?
Audible?
Yes, you're audible, but there is an echo. Mute one more device and log in one device.
Okay, ma'am.
Make your screen full screen and you can start.
Now is it audible?
Little louder.
Ma'am, now is it audible?
No, your voice is low. You're audible, but your voice is low.
Hello, ma'am, now is it audible?
Your voice is very feeble. Kindly enhance your volume.
Okay, sir. Good morning, sir. Is it audible, ma'am?
Very feeble.
No, you have a disconnect point, correct?
Yes,
Not to waste time, ask her to proceed further, madam. No issue.
yes, you can proceed further. Make your screen full screen and proceed.
Okay. Good morning, one and all. Ma'am, is it audible?
Yeah, you can proceed.
Good morning, one and all. Myself, Dr. Jenu and Benny, final year PG scholar, Department of Ayurveda, RNC Bangalore. The topic for my presentation is Ayurvedic insight in the management of metabolic disorder, a single case report on Saudia. Moving on to the introduction, metabolic disorders encompasses various syndromes related to excessive fat accumulation, insulin resistance, hormonal imbalance, etc. And obesity occupies a predominant position due to improper diet and disborn lifestyle. Obesity can be defined as excessive fat deposition in the body with a BMI of 30 kg per meter square. In Ayurveda, it can be considered as Medo Roga, which can be correlated to Saulia. It comes under the Samprapta Vigara, and Medava Dushti is the major factor in the Samprapti. Moving on to the rationale of the study.
It's not moving. Dr. Jenu's slide is not moving.
My first slide will moving on to the rationale of the study. Due to genetic tendency of Indian population to abdominal obesity, there is associated risk of lifestyle disorders, and approximately 16% of global Indian population are affected by this obesity. That is, there is high incidence of obesity in the contemporary scenario. Hence, this case study has been selected. Moving on to the case report, a 26-year-old female patient complaining of increased body weight, sweating, fatigue, and irregular menstruation came to the OPD. Increased body weight since 4 years, irregular menstruation since 2 years, increased sweating and fatigue since 8 months, increased hunger since 2 months, constipation, indigestion since 1 month, knee joint pain since 2 weeks, and her height was 161 centimeter, weight 86 kg, a BMI of 33.2. Her total cholesterol was 213. She was, after lab administration, diagnosed with grade 1 fatty liver, polycystic ovary, and advanced negligence. So after the diagnosis, came to be diagnosed as obesity class 1. While eliciting Nidana Panjaga, Nidana Adimatra Viruddha Asatmi Ahara, that means overconsumption of fast foods, Avyayama, Diva Sogna, etc. was there, which lead to Kapha Medovritti, Srodorota, and Vata Pragoba. It leads to Adisvegudara, Adikshut, and Adisveda, that is, it shows the Medova Chatadushti. Moving on to the materials and methods, that is the interventions. After diagnosing as Taulia, a tailored-made treatment approach was selected, which included Vivanapajana, Shodhana, Shamana, Patyahara Vihara, Vyayama, and Yoga. Shamanaushadhis included with Varanadi Kashaya, Navaga Gugulu, Ice Kriti, Medohara Vadi, Varanadi Krita for Snehapana, and Arogya Vardhini Vadi. Diet included Purana Shali, Yava, Mudga, Pulapayusha, Madhudaga, Laja Peya, sorted vegetables, etc. Also, Vyayama was advised. Along with that, Surya Namaskara, Virabhadrasana, Bhujangasana, Chakri Chalasana, Paschimottanasana, etc. were also advised. So, this was the treatment schedule. First and second day, Vivanapajana was done with Hinduadvijorna. Third to fifth day, Snehapana was done with Varanadi Krida. 6 to 7 days, Abhyanga was done with Tripulari Taila, followed by Sarvanga Bhashpasveda. 8th day, Vamana was done with Madana Ishtipanda, etc. 10 to 12 days, Snehapana with Varanadi Krida. 13 to 15 day, Abhyanga with Tripulari Taila. 16th day, Virejana with Trivat Legia. 18 to 20th day, Vidvatana with Polyvolutadi plus Tripula Churna. 21st day, Lekana Pasti was done with Tripula Kashaya, Gomutra, Yavana, Yavakshara, etc. This was the patient's procedure, Vamana. After 21 days of treatment, patient was advised discharge and she was asked to follow strict diet and also come for follow-up on the 31st day. This was the treatment results. Body weight was 86 kg before treatment on the 0th day. After treatment on 21st day, it came to 82.8. On follow-up on 31st day, it came to 79.4, which was the reduction in 6.6 kg. BMI, which was 33.2, came to 31.9 after treatment and 30.6 on the follow-up day. Increased sweating, constipation, knee joint pain, indigestion, increased hunger, everything came to significant reduction on the follow-up day. And total cholesterol was 213 before the treatment. It came to 198 mg/dl after treatment. Discussion. This case study shows that Ayurvedic tripod approach comprising medicine, diet, and exercises helps significantly in the management of obesity and other lifestyle disorders. There was a reduction in 6.6 kg and also reduction in BMI during the follow-up period. So, reason is that being a Dosha Avastha, Taulia necessitates the Shodhana Karma for Dosha Prashamana and reducing the Medo Dushti. Thus, Vamana Virechana Bhastyadi Panchakarma was selected for balancing the Dosha Dushti. Also, Root Shuddhartana, which acts as a Bahi Shodhana Karma, was done for reducing the Kapha Dushti and reducing Medas. Shamanaushadhi selected here had Vipanapajana, Kapahara, Medohara, Lekana Guna. Along with that, strict diet was advised and Ahara Ashada with Pitta Kadavishaya was selected. Yogasanas and exercise also help in reducing the excess body fat and also it imparts lipids to the body. Conclusion. This study concluded that there was a significant improvement in both subjective as well as objective parameters. Ayurveda helped in addressing this globally alarming burden of these lifestyle disorders through a holistic protocol by incorporating both preventive as well as therapeutic intervention. It also gives an assurance to patients, especially in this young age, for such metabolic disorders to get a satisfactory improvement during the stipulated time period with less force and without any harmful side effects. So I recommend for the future studies that such case studies can be done in more patients to obtain a significant result in the large population, and also management can be done with other Shamanoshris and Chodhana Karma. Acknowledgement, I would like to extend my sincere gratitude to the Organizing Committee of CARI for giving me this opportunity. Once again, thank you, Vananda.
See, I want to know what is the objective improvement of management of Staulia that you mentioned in your concluding statement. What was the objective improvement in Staulia overall that you made in your concluding statement?
Sir, BMI and cholesterol, total cholesterol was this parameters which I took.
What was the improvement you noticed in BMI changes?
BMI, it was 33.2 before the treatment. It came to 30.6 after treatment.
Yes.
And
Now,
also,
my question, listen, my question. BMI was 33, it may be. But as per the recent updates regarding the fixing the criteria for defining diabetes for Indian population, BMI 25 and above is considered to be obese population. Between 23 to 24.9 is considered to be overweight, right? So, although your BMI statistically you want to show that your intervention has some statistical improvement from 33 to 30, but that does not actually fit into the clinical improvement, right? When you are telling that HbA1c from 12 to 10, although it may be improvement from statistical perspective, what is the real therapeutic effect in terms of the clinical improvement? So we have to be very objective while making the statement, and we should not, just make the blind statement, right? So you make it specific, what was the actual thing and what is the actual improvement. And also, I don't think you have adopted the revised guidelines for BMI as well as the definition of obesity. It is waist and height ratio, that is 0.5 has been fixed as a criteria to define obesity. That needs to be reflected in your scientific presentations. And another thing is compliance. So how did you ensure that the compliances were met? Because you have also in your protocol many yoga and other activities also. How did you ensure that your participants were, or did you recommended them directly under your supervision, or how did you ensure that?
Yes, sir, we actually told them these procedures. We were telling them these procedures, and there was instructor for doing this one. Procedures when like daily hours was there, morning hours, half hour were given for patients. So under them, these patients used to do the yogasanas.
Okay, I just wanted to, you just update the things and be pragmatic. Don't be ambitious, right? Okay.
Yeah. Okay, thank you, sir.
Okay, thank you, Dr. Jenu. Judges will take Dr. Pooja, presentation number 43.
Good morning, ma'am.
Good morning. Pooja, you can share your screen. Presentation number 43, judges, please note the previous presentation which was left out. Pooja, you can continue.
Good morning, everyone. I, Dr. Pooja, Assistant Professor, Department of Kaya Chikitsa at Himalaya Ayurvedic Medical College and Hospital, Uttarakhand. Today, I am presenting a case study on Ayurvedic management of dyslipidemia.
Pooja, please share your screen, Pooja.
Okay, ma'am.
Full screen.
Moving towards introduction. Dyslipidemia is a major morbidity commonly associated with sedentary habits, faulty diet, and impaired lipid metabolism. Ayurveda correlates such manifestation with Medodushti and Santarpajanya Vikar, where compromised Agni, arm formation, and Kapha Medavation play a central role. Case report. Patient profile. The patient is 55 years old, female, married from Dehradun, belonging to lower middle class family. She is housewife with predominantly sedentary lifestyle. She has known medical history of hypertension for 6 years and type 2 diabetes for 2 years, for which she is on regular medications. History of present illness. The patient was asymptomatic 2 years prior. Then she gradually developed intermittent chest pain occurring accompanied by persistent fatigue and lethargy for the same duration over the last 1 year. She experienced generalized body ache on and off, along with development of multiple skin tags over the neck and periauricular region. Since the last 6 months, she has been suffering from exertional breathlessness and progressive weight gain. She had taken allopath treatment for these complaints but did not get satisfactory relief. Therefore, she came to our hospital for Ayurvedic management. Past history, hypertension 6 years, since 6 years, diabetes mellitus since 2 years, past surgical history, no any relevant history. Family history, no relevant history. Allergic history, not any kind of allergy to food and drug till now. For hypertension, she's taking telmisartan 40, and glimepiride and metformin for diabetes. Her personal history: appetite decreased, sleep disturbed, bowel habit constipated, micturition frequent and increased. Physical examination: her build was normal, height 160 centimeter, weight 85 kg, pulse 80 per minute, BMI 32.2 kg per. Laboratory findings suggest triglyceride 339 mg per dl significantly elevated, LDL elevated. For treatment protocol, management includes shaman therapy and shodhan therapy, followed by Lekan Vasti to reduce meda and improve metabolism. For Purva Karma, we have done Abhyang, Sarvang Abhyang with Til Tel, Swedan with Dashmul Kashai. In Pradhan Karma, we have done Shodhan, Lekan Vasti in 2 settings with 15 days gap. Lekan Vasti content honey 60 ml, Sandav Lavan 10 gram, Murchit Til Tel 60 ml, Kalk Dravya 50 grams, Quath 250 ml, Gomutra 60 ml, Prakshep Dravya 5 gram. For Pashat Karma, we have Shaman Aushad, Vidangadi Chun 4 gram plus 1 gram Kutki Chun twice a day with honey. Arogya Vardhani Vati 500 mg twice a day with lukewarm water. Paltrik Quath 40 ml twice a day. Moving towards the treatment. Treatment was given in 3 phases. First 16 days of Lekhan Vasti, 15 days of Shaman Aushad, and again 16 days of Lekhan Vasti. Results: significant improvement in lipid profile with reduction in triglyceride from 339 mg per dl to 253 mg per dl. According to Ayurveda, dyslipidemia can be understood as kapha meda vriddhi leading to meda dhatu dushti, Agnimand contributing to improper lipid metabolism, Shotoshodhan obstruction of channels, mainly Medovar Shotas. Lekan Vasti indicates where kapha meda vriddhi is predominant. Shoto Urod is present due to excessive lipid. The need is to scrap mobilize and expel accumulated maida. Mode of action of Lekhan Vasti is promotes Meda Lekhan, scrapping and reduction of excessive fat tissue, mobilize stored fat towards the colon for elimination, enhance Agni at Dhatu level, improves lipid metabolism, reduce inflammatory mediators and oxidative stress. Mobilize stored fat towards the colon for elimination, corrects kapha meda imbalance, improving overall metabolic functions. Removes avarna and clear medover shotas blockage, works as vata anulomak, helping proper movement and expulsion of toxins. Mechanism of action of oral medication and in dyslipidemia. Vidangadi Churn plus Kutki enhances liver functions, improves fat digestion and lipid metabolism, reduces cholesterol and triglyceride absorption in the gut. Kutki increases bile secretion, better fat breakdown, strong antioxidant action, lower oxidative stress linked to dyslipidemia. Arogya Vardhini Vati acts as a liver stimulant, hepatoprotective, improves lipid clearance, reduces synthesis of LDL and triglyceride, enhances bile flow, improving fat emulsification, shows anti-inflammatory and antioxidant effects, supports metabolic health. Paltrik Adi Kuat promotes beta oxidation of fats, mobilizes stored fat for energy, regulates lipid metabolism. Enzymes lower TG and LDL, reduces adipose tissue inflammation, improves digestion and gut metabolism, decreases lipid accumulation. Thank you.
Dr. Pooja? Dr. Pooja?
Yes, sir.
Yeah. Ma'am, you had mentioned about some chest pain all, and in your examination, you told CVS was normal. You did not do any ECG to rule out any cardiac issues because she is having that persistent chest pain.
Yes, sir. I have done ECG.
But that was not discussed in your slides, ma'am.
But it was not appropriate, sir.
Okay. Then what was the logic of giving 7 days gap between two bastis? Like Lekana Basti, then gave a gap of some 7 days, if I have heard it right. And again, you have continued Lekana Basti. Ma'am, are you there?
Sorry, sir. Please, can you please repeat, sir?
Madam, you have done Lekana Basti in 2 sets with a gap of 7 days in between.
Sir, the gap is 15 days.
Fine. What was the logic there? Why that particular decision was taken? Anything?
Sir, there can be a chances of a complication if we continue it. So that's why we have taken 15 days only.
And that is right, to prevent such complications. Suppose you are telling first you gave Lekana Basti in Yoga Basti pattern. That means duration will be 8 days. You have all the assessment to see whether there is Samyak Lakshanas, Atiyoga Lakshanas, Ayoga Lakshanas. When you monitor this, still you want to say there will be complication?
We have not seen any complications, sir.
Madam, this is a single case.
Yes, sir.
If you have not seen any complication, again the question remains, why is that 15 days gap in between 2 courses of Basti?
So we have given the Basti in Kal form according to patient's consent.
Okay, ma'am.
Anyway, ma'am, that is also not ethically viable. If the patient, you have to be judgmental. It's fine, as sir requested. What is the the patient's endurance about any therapy. So we need to be ethically conscious also. Anyway, that's good. Fine.
Okay, thank you, Dr. Pooja. So can we move on to the next presentation? Presentation number 46, Dr. Srireka Chandran.
Yes, ma'am.
Yes, Dr. Pooja, you can unshare your slides. Srireka, you can present your.
Okay, ma'am.
Make it full screen, please.
Ma'am, is it visible?
Make it full screen.
One second, ma'am. Ma'am, it's not sharing.
Raghavendra sir, can you sort this, sir? If you have their presentation. Can you share it again, otherwise?
Yeah, I'm trying, ma'am, but it's not. One second, ma'am.
I'll share the presentation from here. Is that okay for you?
Yes, sir. Yes, sir.
Okay. Just give me a minute. I hope my screen is visible now.
One second. Yes, sir. Thank you, sir. Good morning, all.
Please start.
Ma'am, can I start presentation?
Yes, please start.
Okay. Good morning, all. Myself, Dr. Srireka Chandran, and I'm privileged to present my topic, Comprehensive Management of Staulia with Mudga Lacha Khadra Kashaya Peya, a classical Ayurvedic view. Next slide, please. Atistula is considered one among the 8 Nindita Purushas. In Charaka Samhita Sutra Sthana Ashtaninditi Adhyaya, there is a detailed explanation regarding the Samprapti of Staulia. It is one of the Santarpanopta Vikara, wherein Nidhanas intake of Madhura Snikta Guru Ahara resulting in Dhatuvarti Mandya, which leads to Shrotorodha and formation of Ama resulting in Staulyam. According to WHO definition, obesity is considered one of the complex diseases in which there is excess accumulation of fat, which leads to many health risks. Coming to the prevalence of obesity among Indian adults, it is among 40.3%. of Indian adults are considered to be obese. So, coming to the greater risk factors, it is considered one among the fifth risk factors in worldwide for resulting in the death. Obesity also results in many other secondary diseases like type 2 diabetes mellitus, cardiovascular diseases, and other dyslipidemia conditions, etc. So next slide, please. So the primary line of management includes Lekhana, Deepana, and Kapha Medohara Dravyas. Next slide. So objective to evaluate Khadra Kashayam and Mudgalaja as integrated herbal and nutraceutical interventions for Staulia, focusing on their pharmacodynamics and functional attributes. This reference is taken from one of the Malayalam texts called Yogamritam, in which Stula Chikitsa Adhyaya, there is a mentioning of Mudgalaja Peya with Khadra Kashayam. And it is said beneficial in the context of Premeha and Ati Stula. And similar kind of reference is available in Chikitsa Manjari text also, in which in Premeha and Stula, this Mudgalaja Khadra Kashaya Peya is found beneficial. Next slide. Coming to the preparation, this is a unique preparation in which Mudga and Laja are boiled and cooked in Khadira Kashayam. Apart from the normal Peya preparation where Peya Drava Dravya is just water, here Khadira Kashayam is being used as the Drava Dravya, and the preparation is carried out. Next, sir. So coming to the nutraceutical values, Laja, it is having carbohydrate around 74.3, protein 7.5, and moisture content 14.7 with fiber 0. And coming to Mudga, it is rich in potassium, magnesium, calcium, and phosphorus. Carbohydrate is 56.7 grams, and energy is around 334 kilocalorie. When we see the Rasa Panchaka, it is mainly of Kashaya Madhura Rasa, and Guna is of Laghu and Ruksha, and Virya is Shita. Coming to the Prabhava of Laja, it is Pitta Kapha Shamaga, and coming to the Karma of Mudga, it is Brahmana, Vishata, and Pushti Bala. If you go through the bioactive compounds in Khadira, tannins, catechins, flavonoids, and alkaloids are found to be more of anti-inflammatory, antioxidant, and antimicrobial properties. Similar kinds of action can be seen in Laja and Mudga too. So coming to the Rasa Panchaka of Khadira, it is Tikta Kashaya and Laghu Ruksha Guna and Shita Virya, and Vipaka is Kadu, and Kapha Pitta Shamana as Karma. Next slide, sir. Mode of action, as I said, like Nidana, intake of Ahara Dravyas, which includes Madhus, the Gunas, and which are Kapha Medo Vardhaka, results in Medo Dhatu Agni Mandya, leading to defective Dhatu Parinama at level of Medo Dhatu and Shrodorota, and that results in formation of Ama. So the diet should always have a Laghu Ruksha Guna, and it should be Agni Vardhaka, Deepana, and Kapha Medohara in quantity and quality, and Ama Pachana. So Mudgadi Kashaya Peyam is good in Staulyam and Pramehahara, and it is having properties like Laghu, Ruksha Guna, and effective in increasing the Dhatu Agni, Kafahara, and Agni Deepana. Peya is also considered as a type of Patyahara, which is Laghu, Deepana, and Pachana property, and is ideal choice in Agni Mandya. Mudga is considered one of the Nitya Sevaniya Dravyas, and it can be used in a long-term basis. Though it is a little Vadakara, it has a good source of protein, carbohydrate, and energy, and hence it is considered more of Patya. Laja having Medohara and Kafacheda property, which reduce Meda and Kleda. Khadira, it is having Tikshna Guna and Vijada Guna, and helps in Shrodoroda and Medohara property also. Next slide, sir. Coming to the modern perspective, like if you consider, it acts as a low-calorie, high-fiber satiety enhancer. Mudga provides a high-soluble fiber, delays gastric emptying, and Laja is extremely low-calorie and light, and it helps and it prevents post-meal heaviness, and they prolong satiety, reducing overall calorie intake, modulate ghrelin, improves gut metabolism, and modulates gut microbiota, and it also reduces in systemic inflammation and oxidative stress. It enhances lipid mobilization and fat oxidation, improves insulin sensitivity and glycemic regulation. Khadira's astringent action also reduces in the gut permeability. It lowers endotoxemia and reduces chronic inflammation. It also provides a mild diuretic and decongestive effect and helps in reducing the water retention and cellular edema often seen in obesity. Supports better cardiovascular load and reduce oxidative burden. Next slide, sir, please. And these are the publications in which two studies has been done. One of effect of Mudgadi Kashaya Peya and selected yoga techniques in overweight, and effect of Mudgadi Kashaya Peya and selected yoga techniques in pre-diabetes. Both these studies has done in college and government Ayurveda College Tripunithara. In overweight, the number of participants was 30 and age group was 20 to 45. Their assessment criteria was BMI, waist hip ratio on the 0th day, 31st day and 61st day. Lipid profile was assessed on the 0th day and 31st day of period. Next slide, sir. So coming to the conclusion, Mudgalacha Khadira Kashaya Peya is mentioned in the Stauli Chikitsa of Yogamritam and Chikitsa Manjari for Staulya and Prameha. Mudga and Lacha Khadira are the ingredients of the Peya which are Kapha Medhahara in nature, and Peya is the Patyahara which is Legu and Deepana in nature and hence was effective in improving digestion. Recent studies on Mudgadi Kashaya Peya and selected yoga techniques for prebiotic and obese showed significant result in reducing BMI, body weight and waist hip ratio of the subject, and was significant in reducing total cholesterol, serum triglycerides, LDL and VLDL, and had a slight improvement in HDL, but was not significant on statistical analysis. Thank you.
Doctor, I just want to have your clarification. Guru Chatrapadam Stule Viparitam Hitam Krushab. Okay,
Yes, sir.
this is a fundamental principle for management of Staulia.
Okay, sir.
You justify this principle with regard to your intervention.
Sir, this Mudga Laja Peya, it is having both, it is having an Abatarpana quality. No, sir. Like it is.
No, listen. Guru Cha Patarpanam. Guru Cha Atarpanam Stule.
Okay.
Not Apatarpana. Guru Cha Atarpanam Stule.
Okay. It shouldn't be Tarpanam.
It is the principle for management of Staulia.
Okay.
14th chapter. Dvividopakramaniya. So you find, and even in Charak also. So Guru Cha Atarpanam Stula is the fundamental principle for the management of Staulia in general.
Okay.
So how do you justify your intervention with regard to this principle?
Okay. Sir, by giving this payam, it provides that fullness. So it can be considered like it is delaying the promoting, like it delays the hunger. It provides a fullness to the patient. So it can be considered like quality wise, it is all legu. I hope that is what.
It's okay, no issue. I just wanted to give you some clarity. So since you are giving dietary intervention, and second thing is like you make the outcome very specific with the real possibility with regard to your intervention. So you are giving some intervention. What is the real potential of that intervention in terms of the improvements in whatever objective or subjective? You define it and stick on to that one for your measurement, and that you try to showcase it as the improvement.
Yes.
Changes. So if you keep open like the management of Staulia, it becomes a very wide things that has many various constituents as well as components. Okay, so that intervention may not be actually addressing the whole umbrella of the factors of Staulia. So you make this thing very specific. What is the real possibility in terms of the improvement measurements and with regard to the intervention? So if you specify that, then that would be more sensible when you go for the literature publication.
Understood. So in terms of long-term use and cost effective, that is the main, what I felt is like it can be used on a long-term basis and cost effective.
So that is fine. With regard to the intervention, what you are giving, what is the possibility that you can expect in terms of the whether it is in the the biochemical improvements, or whether it is the changes you can expect in the BMI, whether you can change in which you believe that this is going to impact on this variable in Stolia, so that will be more,
Understood.
closer to the reality. Yeah.
Oh, okay, sir. Understood. Sir. Thank you, sir. Thank you, sir.
Rekha?
Yes,
Dr.
sir.
Sri Rekha? Yes, ma'am.
Yes, sir. Yes, sir.
This was a literary review, or you administered this on some patients?
No, sir. No, sir. It was a literary review, actually. I found it interesting because it comes under the nutraceutical concept, because it is both nutritious and there is a therapeutical intervention by changing the diet of the patient.
It was
So-
not given to any patients.
No, not given to any patients. Sir. Like then I found articles.
In
It
your
was
last
done.
slide, you have told. In your last slide, you have told that it reduces so many parameters all.
Yes, yes.
Without doing a study, concluding that will be a little bit difficult.
Yes. No,
And it
no,
should
sir.
be-
Actually, it was the publications where it is a study. It has been conducted, sir, in Tripunithura Ayurveda College. I have not personally given. So that's it. Sir.
Then that was, you'll have to mention that based on that study, these were the findings.
Okay.
In your title, rather than comprehensive management, it could have been effect of.
Okay.
And you see, in your title, you are told Kadira Kashaya and Mudga Laja. It has become Laja, it is Mudga Laja. But down the line in your presentation, we understood that it's a single combination where Kadira Kashaya is added to Mudga Laja Peya. And down the line in your presentation, you change the yoga itself, it's to Mudgadi Kashaya Peya.
Okay.
So starting your title says some combination. Down the line, the preparation itself is.
Okay. Okay. Sir. Hello, sir.
Thank you. Thank you, Dr. Sri Rekha. We will move on to the next presentation from Dr. Atira Mohan. Dr. Atira Mohan, are you there?
Good morning, ma'am. Am I audible?
Yes, please share your screen.
Okay, thank you.
Screen mode and you can start presenting. Yes. You
Ma'am, is it visible?
can continue.
Can I start, ma'am?
Yes, go ahead.
Okay, thank you. A warm welcome to one and all, and welcome to the presentation. Metabolic link in Alzheimer's pathology, mitochondrial and neuroprotective insights from Brahmidraksha Dikwadha in SHS5 cell line, an in vitro study. Myself, Dr. Adira Mohan MO, final year MD scholar, Manovijnanaya Manasaroga from BPSV Ayurveda College, Kottakkal. Alzheimer's disease is a complex neurodegenerative disorder that causes progressive memory, cognitive, and behavioral decline. Growing evidence links AD to metabolic syndrome as impaired glucose metabolism, insulin resistance, and lipid imbalance disrupt neuronal energy regulation. Mitochondrial dysfunction is central to this link, worsening beta amyloid buildup and tau hyperphosphorylation, the major AD hallmarks. Current treatments provide only symptomatic relief, and recent clinical trials shows limited success. Earlier research in Ayurveda shows promising effect of Brahmidraksha Dikwadha in mild cognitive impairment. However, the exact neuroprotective mechanisms of multi-herbal formulas are still unknown, and saline studies can help clarify them. To explore this, SHS5 cell lines widely used as AD models were selected here. The research question was, does Brahmi-Drakshadikwada has significant neuroprotective effect in beta-amyloid-induced SHS5 cell lines of Alzheimer's model in the in vitro study conducted at Center for Research on Molecular and Applied Science, Thiruvananthapuram, during the period of 2024 and 25. And these were the hypotheses. Coming to the materials and methods, study formulation was Brahmi-Drakshadikwada. Cell lines were purchased from National Center for Cell Sciences, Pune, and the experimental neurotoxicity was induced by incubating the cell lines with beta amyloid. Now coming to the observations. The direct microscopic observation revealed dose-dependent protection up to 6.25 microliter per ml of Brahmi-Drakshadikwada with signs of toxicity at 12.5 and 25 microliter per ml. MTT results also matched microscopic observations. Quada showed dose-dependent protection peaking at 81% viability at 6.25 microliter per ml, identified as the optimal protective dose. Higher doses lowered protection, indicating decreased efficacy or possible toxicity. Cell viability was also highly significant at p less than 0.001. Tau protein was measured by indirect ELISA. Beta amyloid raised tau. Quada reduced it in all the three sets. Tau reduction with Quada was also highly significant at p less than 0.001. Fluorimetric data showed baseline ROS in controls. Quada lowered beta amyloid-induced ROS but not to the control levels. From phase contrast and fluorescent images, it is clear that beta amyloid caused cell loss, distorted morphology, and high ROS, while the Quada improved cell density, preserved shape, and lowered ROS, indicating protective effects. Coming to the flow cytometry, control had low ROS, beta amyloid raised it, and Quada reduced it. Control showed 97% low ROS cells. Beta amyloid shifted 1/3 to high ROS, while the Quada restored over 92% to low ROS region. Flow cytometry shows basal autophagy in controls, slight increase with beta amyloid, and strong LC3 elevation and larger cells with Quada indicating strong autophagy induction. BDNF mRNA, which was normalized to GAPDA gene, stayed stable in the controls, dropped with beta amyloid, and nearly doubled with Quada. Agarostal results showed consistent GAPDH bands confirming it as a stable control, while BDNF was baseline in controls, weak with amyloid, and strong bonds that restored with Quada, confirming neuroprotection. Coming to the discussion, Brahmi-Drakshadikwada may boosted metabolism and mitochondrial functioning, reducing beta amyloid. It may inhibit tau by improving clearance and protein balance. It may lower ROS through scavenging or mitochondrial stabilization. It may enhance autophagy, aiding neuronal survival. And it may nearly double BDNF transcription via pro-survival signaling. To conclude, Brahmi-Drakshadikwada showed strong neuroprotection at 6.25 microliter per ml, significantly reduced to p value at less than 0.001, lowered beta amyloid-induced ROS, strongly induced autophagy, and doubled BDNF mRNA levels. These findings support its role in neuronal survival and cognitive improvement in AD models, so the alternative hypothesis was accepted. These are the references. Thank you.
Dr. Athira,
Yes, sir.
you're a final year MD scholar, right?
Yes, sir.
What is your dissertation topic?
So this is my dissertation topic, sir.
Okay, ma'am. Fine, ma'am. Because being a PG scholar, spending so much time on this, just wanted to ask, that's all.
Shall we move to next presentation, sir?
Yes, ma'am. Nothing from my side.
Thank you, Dr. Athira. Next presentation.
Thank you.
Yeah, number 48, Dr. Arpit Surya. Are you there, Dr. Arpit Surya?
Yes, ma'am, I'm there.
Your screen, Arpit.
Yes, ma'am. Once again. Is it sharing? Hello?
Yes, but it's sharing. Continue.
Yes, sir. Good morning, everyone. My name is Dr. Arpit Surya, PG Scholar, Department of Shalya Tantra from Ramakrishna Ayurvedic Medical College, Bengaluru. Today, my topic is evidence-based review of management of Vata Rakta through Rakta Mokshana. Now, let's come to the background. Acharya Charak has described Vata Rakta as a disorder arising from visheshan of Vata and Rakta disorder doshas. The condition manifests with severe joint pain, inflammation, and restricted movement, particularly affecting the extremities. Acharya Sushruta has emphasized the role of Rakta Dushti in pathogenesis, and he has highlighted Rakta Mokshana as a primary therapeutic intervention. Now, Ashtanga Hridaya has combined both Acharya Charak and Sushruta's opinion while adding diagnostic refinements and describing the condition's complexity involving multiple dhatus. He has also advocated combined treatment approaches, including bloodletting. Now, what is Rakta Mokshana? It is a procedure in Ayurveda which helps to restore and restore doshic balance. This procedure addresses the fundamental pathology of Vata Rakta by eliminating ama, toxins, which are present in Rakta and Rakta Dushti. Its therapeutic rationale is that it removes accumulated metabolic toxins from bloodstream, it reduces inflammatory markers or mediators at affected joints, improves microcirculation and tissue oxygenations, and it restores proper Vata Rakta equilibrium. It is of two types, Shastra and Anushastra. In Shastra, it has Sira Vedna and Prachanna Karma. It is done through Vrihimukha and Kutharika, specialized instruments like those, and it is applied to specific marma or affected joints under strict aseptic protocols. There is immediate blood removal, quantity control is possible, and it requires surgical expertise. In Anushastra, we can go for Jalauka application or Shringa Labu application. In Jalauka, it is nothing but medicated leeches, which are used for controlled bloodletting. Leeches release anticoagulants and anti-inflammatory compounds while extracting vitiated blood. It has natural enzymatic action, minimal tissue trauma, and these are ideal for sensitive areas. In case of Shring and Labu, they create negative pressure using animal horn, gourd, or glass cups after superficial scarification. Now, they draw blood and toxin to surface for removal. Now, it is localized treatment. It has adjustable section levels, and there is minimal bleeding volume. Now let's come to the indications and contraindications. In Ayurveda, indications include acute Vata Rakta with severe inflammation, Rakta Dushti presence, pain unresponsive to Shaman Chikitsa, Pitta predominant Prakriti patients, and in ideal seasons like autumn and spring. In contraindications, they have told about pregnancy, menstruation, extreme debility or emaciations, active bleeding disorders, Pandu Roga, children under 12 years of age and elderly above 70 years of age. In contemporary practice, we can correlate indications like chronic gouty arthritis with frequent flares, patients with NSAID intolerance as a complementary therapy to conventional maintenance, as preventive maintenance in remission, and in contraindication, if the patient is on anticoagulant medication, if he has immunocompromised stats, uncontrolled diabetes, mellitus, active infectious conditions, and cardiovascular instability. So these are the material methods that I've used. In initial studies, we can see that there is significant pain reduction in VAS scores improved by 62%. Inflammatory marker decreases there following leech therapy in Vata Rakta patient. We can also see that analysis revealed Hirudin and other leech salivary enzymes possess anti-inflammatory, anticoagulant, and analgesic properties. And studies confirmed reduction in serum uric acid levels post-treatment. We can also see that multiple center trials have compared Rakta Mokshana with conventional NSAID therapies, and they have concluded that combined approach is the way to go. It offers superior outcomes in symptomatic relief, functional improvement, and reduced recurrence rates. And in long-term follow-up over 12 to 18 months, we can see that quality of life scores have improved significantly with minimal adverse effects when performed by trained practitioners. So this is the result, which graphical presentation of the result which we have got. It clearly shows the importance of the Rakta Mokshana in Vata Rakta patients. And we can see that conventional therapy and a combined approach with conventional therapy demonstrated superior outcomes across all the measured parameters with statistical significance of p less than 0.05. Let's come to the safety profile. So in safety profile, comprehensive safety analysis from all these studies, we can see that minor adverse events were reported, only 2.8% were reported by the patients. Only 0.3% were moderate events, which included which included prolonged bleeding, localized infections. All were resolved, and no patient reported any serious events. So key safety factors here were that practitioners who were doing the procedures were trained and certified. there was strict sterilization protocol, appropriate patient screening was done, and post-procedure monitoring was also done. Clear contraindication adherence was also kept. Let's come to this discussion part. So in the initial assessment, we can go for comprehensive evaluation using both Ayurvedic Prakriti Vikriti analysis and modern diagnostic criteria like serum uric acid and inflammatory markers. And we can go for integrated protocol like developing personalized treatment, combining Rakta Mokshana sessions with conventional medications, dietary modification, and lifestyle interventions. We can go for collaborative monitoring like tracking clinical symptoms, lab parameters, and quality of life measures with coordinated care between Ayurvedic and allopathic practitioners. Now, in conclusion, we can conclude that all the Rakta Mokshana, that all the therapies of like Rakta Mokshana as a therapeutic option for Vata Rakta is very useful. Continued rigorous research and thoughtful integration into modern healthcare system will unlock its full potential for patient benefit. And in my recommendation, we can go for multi-center large RCTs, molecular mechanism studies of least salivary compounds, standardization of Rakta Mokshana protocols. We can develop evidence-based protocols for patients, integrative care models in rheumatic settings. And in policy, we can go for insurance coverage of validated Ayurvedic procedures, integrate traditional medicine in medical curricula, support interdisciplinary research collaborations, and we can promote public awareness of evidence-based Ayurvedic therapies. Thank you.
Dr. Arpit Surya, you have mentioned evidence-based review
Yes, sir.
in your title, and
Yes, sir.
in the slides you also mentioned that systematic review.
Yes, sir.
But looking at your contents, it doesn't look like a systematic review. So you should have
Yes.
adopted the methodologies, whether you are doing a scoping review, narrative
Yes, sir.
review, or systematic review, whatever it is. So
Okay,
accordingly,
sir.
you should have the templates of your presentation and as well as
Yes, sir.
your contents, what you are claiming. So be specific about what method that you have adopted. That is also very, very essential
Okay, sir.
in scientific
Yes, sir.
presentation, right?
Okay, sir. Okay, sir.
Yeah.
Dr.
Hello.
Conclusions you have told about
Sir,
diabetes.
sir, it was not audible, sir.
Okay. Am I audible now?
Yes, yes, sir. Yes, sir.
You have taken a wide topic of Rakta Mokshana, wherein you are not specified whether it is Shastrakrita or Ashastrakrita.
Yes, sir.
So,
Sir,
then whenever you're generalizing, let me complete. Whenever you're generalizing, you can't exclude, okay, diabetic, increased blood sugar levels, we are not doing. Whenever you specify, select, okay, you're going to do
Yes.
Shastrakrita Rakta Mokshana, in that also Siraveda. Then you have a set of indications, contraindications for that. On the other hand, you select Jalukavacharana. There is a set of indications and contraindications, but without any specifications that just speaking about Rakta Mokshana becomes little bit this as per your topic is concerned.
Sir, actually, sir, Acharya Charaka has told, like in Vata Rakta, he has told that if there is Ruk, Daha, Shul, and Tod, then we can use Jalauka in Vata Rakta. And if Vata Rakta patient comes with symptoms like Sukti, Kandu, or Chimchimayana, numbness, and all, then we can go for Shring and Alabu. And regarding this Sira Vedna, I have taken reference from Sushruta, sir, because Sushruta has told that Sira Vedna is Ardha Chikitsa, just like Basti is Ardha Chikitsa in Charak, according to Charak. So
Dr. Surya,
Sushruta has told.
sorry to interrupt.
Yes, sir.
See, your references is there, but your paper doesn't highlight what type of Sira Veda or Rakta Mokshana you have selected.
Yes, sir.
When it is vague, na, you can't be specific. You can't conclude anything. Okay, you could have selected one. Say, okay, you're going to select Sira Veda or Shrunga or Alabu or Jaluka Charana and work on that. Come out with your outcomes or the evidence based on that rather than just speaking about Rakta Mokshana. That's all.
Okay,
You
sir.
have the references with you, but your
Okay,
paper could have been more crisp and
specific.
precise.
Okay, sir. Thank you, sir.
Thank you, Dr. Arpit Surya. Next
Thank you.
presentation number 49, Dr. Shrikala V. Dr. Shrikala, are you there?
Yes, ma'am.
Arpit, can you unshare your presentation? Dr.
Yes,
Shrikala?
ma'am. Yes, ma'am. I'm sharing the presentation.
Ma'am, is it visible, ma'am?
Visible, you can continue.
Okay. Good morning, respected chair, co-chair, and organizers of this program. Myself, Dr. Srigalavi from CCRI's Lucknow Institute, presenting before you the paper entitled Translational Relevance of High Fat and Cholesterol Diet-Induced Rabbit Model for Metabolic Syndrome and Cardiovascular Drug Discovery. These are the contents of the presentation. As we all know, metabolic syndrome is a multifactorial condition characterized by obesity, insulin resistance, dyslipidemia, and hypertension, significantly increasing the risk of cardiovascular diseases that includes comorbidities like coronary atherosclerosis and non-alcoholic fatty liver diseases. This picture itself depicts the multi-system involvement in the etiopathogenesis of this metabolic syndrome, and this makes this disease a complex disease, and this complexity still persists for the drug development and new drug discovery against this metabolic syndrome. So, preclinical models that closely mimic human pathophysiology are essential for evaluating novel therapeutic strategies for metabolic syndrome. The high-fat and cholesterol diet-induced rabbit model has emerged as a promising platform due to its physiological resemblance to human lipid metabolism and atherogenesis. So we have come up with this study to evaluate the translational potential of the HFCD-induced rabbit model in replicating key features of human metabolic syndrome and to assess its utility in preclinical screening of drugs for metabolic syndrome and cardiovascular disorders. In the main study, we have done in healthy male New Zealand white rabbits by administering high fat and cholesterol diet for 12 weeks, and the assessment parameters we have taken include body weight changes, anthropometric measurements, serum lipid profile, liver function test, atherogenic index and coefficient, coronary risk index, hsCRP levels, and the organ weight changes. These are the various stages involved in the experimental methods. We have dissected the animal, and after dissection, even we have assessed the mesenteric and perirenal fat pads. They have been weighed, and the main target organs have been done histopathological study based on standard protocols, and even the organ weights has been assessed, and even the mesenteric and perirenal adiposity has been assessed for the analysis. And for the staining, for the liver and aorta stains, apart from the normal H&E stain, we have done mesenteric staining for the collagen fiber special stain, and in the aorta, even the EVG staining has been done for analysis of the elastic fibers involved. So these are the various stages involved in the dissection and histomorphometry. This is of the heart and aortic arch, and this is the adipose tissues collected for the analysis. Coming to the observation and results, after while comparing the initial assessment and the final assessment at the end of 12th week, we can see that there is a statistically significant increase in the lipid profile parameters in the HFCD-induced rabbit models. Actually, in the total cholesterol, we can see that about 10 times increase, whereas in the triglyceride level, there is a 6-time increase observed after the end of the 12th week. And in the case of liver function parameters also, we can see a significant increase in the case of high fat and cholesterol diet-induced rabbit model at the end of 12th week. And coming to the atherogenic parameters, we can see that the atherogenic index, coronary risk index, and atherogenic coefficient, all these are statistically highly increased at the end of the final assessment of 12th week. And in the inflammatory markers, hsCRP levels also, we can see a statistically significant increase at the end of 12 weeks. And we have also done the hepatic tissue cholesterol level assessment. And in that also, we can found a high increase in the triglyceride levels as well as total cholesterol level. These are the body weight changes. We can see that there is a symmetrical increase in the body weight changes in the high fat diet induced animal throughout the weeks. And in the case of anthropometric measurements, we have noted abdominal circumference, forearm assessment, lower limb assessment, neck circumference, various anthropometric measures we have taken. But in the abdominal circumference, we have seen a noted increase. These are the visceral fat distribution. We can see that in the HFCD-induced animal model, there is a high mesenteric and perirenal fat deposition that can be now clearly visible in the animal body after dissection. This is the visceral fat distribution that we can clearly see. This is the perirenal fat of aorta. There is atherosclerotic plaques with inflammatory cells that were observed in the tunica intima cells, and various pathologies that lead to this atherosclerogenesis pathogenesis can be visible in the H&E stain of the aorta of the normal and positive control animals. This is clearly visible in the HFCD animal. There is the defective endothelium showing development of the atherosclerotic plaques. And this is in the case of 10x view. Here also it is clearly visible. There is the atheromatous plaque formation and inflammatory form cells that is visible in the HFCD group. Coming to the heart cells also, while the H&E staining, we can see that there is localized infiltrating inflammatory cells and lipid accumulation. This is the heart cells. There is clearly evident lipid accumulation in the heart tissues also.
This is the hard myocardium. We can clearly differentiate the normal physiology and the abnormal pathology in the HFCD group. Coming to the adipose tissue, in the normal group, there is normal size and shape of the adipocytes, whereas in the case of HFCD groups, there is increased diameter of the individual adipocytes, and that itself indicates the hypertrophy of the adipocytes due to excess accumulation of lipids. This is the normal control rabbits, and this is the positive control. So coming to the mesenteric liver staining, we can see that in the HFCD group, there is an increase of collagen fibers around the dilated and congested central vein. This is especially evident in mesenteric staining only, these collagen fibers. We can see that the normal architecture has been entirely damaged in the case of the positive control group with adipose tissues accumulation and the collagen fiber disruption. This is the mesenteric staining. We can clearly differentiate the adipocyte cells in the positive control group. Coming to the aortic stain, we can see that in the HFCD group, there is abnormal number of collagen fibers in the atheromatous plaques. This is the atheromatous plaque that is clearly visible in the positive control group. Coming to the EVG stain for elastic fibers, in the EVG stain also, we can clearly see how the atheromatous plaques is gradually developing in the case of this HFCD diet-induced animal. So coming to the discussion part, both humans and rabbits are LDL animals, contributing to their similarities in lipoprotein metabolism and their usefulness as translational models for metabolic syndrome. Whereas humans and rabbits are rich in plasma cholesterol ester transfer protein, an important regulator of HDL and cholesterol metabolism, whereas rodents do not have this CETP. Rabbits fed on high-fat diet have been reported to exhibit hemodynamic and neurohumoral changes similar to those observed in human obese animals. Rabbits are very sensitive to cholesterol administration, and they can rapidly develop severe hypercholesteremia, leading to atherosclerosis if extra saturated fat is added, increasing both plasma cholesterol level and the extent of vascular lesions. The intimal macrophage accumulation and vascular smooth muscle proliferation are also mainly involved in this etiology. The 12 weeks administration of this high-fat diet and cholesterol diet has led to the fat accumulation and inflammatory response in the aorta of these experimental rabbits. As previously reported, the long-term cholesterol and fat intake will increase the pro-inflammatory changes, and this increased monocyte infiltration can also lead to aortic lesions. The study shows a positive pro-inflammatory status of HFCD-induced rabbits characterized by raised CRP levels also. So this is in correlation with or in having translational relevance with the Ayurvedic concepts of the Nidana, that is the Medho Dushti Nidana, the gunas that increases this Medho Dosha, Medho Vriddhi Lakshana, Medho Vahasrodho Dushti. All these are in align with the experimental model, that is what we have incorporated. So what we have to conclude is that while we are approaching for a new drug development or while we are understanding a disease, we should select the apt model for the study while considering the holistic approach, because a single system or single or organ targeted approach will not be effective in all the cases. So rabbits, like humans, can develop all the elements of metabolic syndrome, and that is why it can be widely used to understand the cardiometabolic complications associated with obesity and metabolic syndrome. The key verdicts of this study remains highly relevant for unveiling the multi-system involvement of metabolic syndrome and in the search for new drug discovery and drug development for metabolic syndrome and cardiovascular disorders. By exploring the holistic approach, considering the multi-system involvement of metabolic syndrome and focusing on multi-organ targeted therapeutic agents. I would like to acknowledge CCRA's Ministry of Ayush for funding this project. This is under the AYUSHNet scheme of CCRAs, and the study has been conducted at Center for Experimental Medicine and Surgery, IMS BHU, under the guidance of Department of Dravyaguna, IMS BHU. Thank you.
Dr. Shrikala?
Yes, sir.
Very nice presentation, ma.
Thank
But
you, sir.
see, from the beginning, it was values everything. But in the last few slides, suddenly some Ayurveda concept was forcefully introduced. I don't know why. Because if you want to introduce Ayurveda concept, you could have initially also put that. Like your Ayurveda principle says that whenever there is some like kapha medho vriddhi, that kupitanami doshanam sharire paridavatam, so that it can get accumulated in various organs, like you showed the diagram of your liver, pancreas, arteries, etc. So barring those two slides wherein suddenly you wanted to put the Ayurveda concept, rest everything is fine. Was there any relevance for you to introduce that Ayurveda points there suddenly at the end?
Sir, I accept your suggestion, sir. Actually, what I would like to highlight is that, sir, while we are going for an experimental model preclinical studies for Ayurvedic drugs, we are only approaching in a superficial manner. Just we are approaching for the anti-diabetic drug, for example, we are just focusing on pancreas. But at that time, we are telling that our drug is having not that much effective when compared to the standard drug. Likewise, we are coming to a conclusion. But this is against our traditional concepts and theories, because we are having a core theory. Actually, in the Samprapti also, Acharya has clearly mentioned what all etiopathogens is, what all doshas, what all dhatus, what all upadatus, what all srotas, all these are involved. Then how based on a single fasting blood sugar level or how based on a postprandial level, we can assess whether the drug is having anti-diabetic effect. So what I just want to highlight is that all these Samprapti Ghatakas, all these etiopathological factors that should be highlighted, because we are giving a streptozotocin induced diabetes model, we are chemically inducing. Then how we can translationally tell that it is having translational relevance in drug testing the Ayurvedic drugs? So actually my core concept is that for testing Ayurvedic drugs, we should come up with new models that should exactly at least almost correlate with the Ayurvedic etiopathogenesis, Ayurvedic Nidana Ghatakas, Ayurvedic Samprapti Ghatakas. Then only we can test our drugs and we can tell that yes, this drug is effective in this condition, otherwise this drug is not effective in these conditions. Otherwise, huge amount what we are expending on this new drug discovery and development, we will stuck somewhere in the later stages. So just for telling this concept, I just give an example in the discussion part, sir. Sorry, I could have included in the introductory part even.
Nothing. The content, the structure, organization, everything was fine. This something seemed personally for me as out of scope of this paper. Otherwise, good one. Good.
Okay, thank you so much, sir.
Shall we move to the next presentation, sir?
Ma'am.
Yes. Presentation number 50, Dr. Hasina Begum.
Ma'am?
Yes. Hasina Begum, are you there?
Yes, ma'am.
Yeah, please share your presentation.
Yes, ma'am. Is it visible, ma'am?
You can go ahead.
Yes, ma'am. Good morning, everyone. Myself, Hasina, and my topic is metabolic diseases.
Dr. Hasina, you can present. Dr. Hasina?
Discussion, conclusion, and references. And moving here, type 2 diabetes. Ma'am, is it audible, ma'am?
Now you can go ahead.
You can go ahead. Your voice is breaking, but you can go ahead.
Yes, ma'am. An introduction of my topic is metabolic disorder, that is obesity, dyslipidemia, type 2 diabetes are rising globally, driven by sedentary lifestyle, poor diet, and impaired metabolism. And these conditions leads to a major complications such as cardiovascular disease, renal failure, etc. And there is a need for integrative approaches, including lifestyle and traditional medicines. And in Ayurveda, the accumulation of pathological fat and glucose is attributed to the Medo Dushti and imbalance of Kapha and Abadha Medas, which disturb the metabolic fire, that is Agni. And if then Agni Manya leads to the impaired digestion and metabolism, this leads to the accumulation of Ama, Abadha Medas, and Kleda. These accumulate and leading to the diseases like Staulya, Medoroga, and Prameha or Madhumeha. And here Ayurvedic therapeutic strategies mainland Pramehagna Dravyas, which improves insulin sensitivity and corrects the Kapha Medo Dushti. These are applied along with the Ahara, Vihara and other Ayurvedic therapies. And mode of action of modern herbs, that is Medohara herbs, which enhances digestion, that improves Agni and promotes metabolism and stimulates lipids and reduce adiposity and improves lipid profile. Pramehagna herbs, which mainly enhances glucose uptake or utilization, regenerates or protects beta cell, inhibit intestinal glucose absorption, and which corrects dyslipidemia secondary to insulin resistance. These herbs also exert antioxidant, anti-inflammatory, and hepatoprotective effect. And next, I have included some of the herbs like Guggulu, Haritaki, Guduchi, Meshashtungi, and Jambu. Guggulu, here resin from Commiphora micul, that is Guggulu has been shown to reduce total cholesterol and LDL cholesterol in some trials. I have taken this from the article which is published in the PubMed. And along with that, Commiphora micul contains active components, that is gugulusterones, antagonize the bile acid or farnesoid X receptor. It is a nuclear receptor that acts as a key regulator of bile acid homeostasis, lipid and glucose metabolism, and inflamed primary in the liver and intestine, which helps thereby modulating the cholesterol or bile acid metabolism. And some human trials are conducted which shows mixed results. Once RCT showed an increase in the LDL in Guggulu group, so evidence is variable with respect to the Guggulu. Next is Haritaki, that is Terminalia chebula. Though less detail here, Haritaki is classically used for Prameha or Medoroga properties as it is Kashaya Rasa Pradhana, and which also regulates the lipid levels. And next is Guduchi, that is Stenospora cordifolia, used for metabolic disorders and which has immunomodulation antioxidant effects. Specific randomized clinical trials in metabolic syndrome context are very fewer. And next is Meshashtungi, Gymnema sylvestre. Here, one study has showed hypoglycemic and hypolipidemic activities, and there will be a possible beta cell regeneration. And next, a few larger human trials, but strong mechanistic or preclinical support. Next, Jambu, that is Syzygium cumini, traditionally used for Madhumeha, and modern work indicates anti-diabetic, antioxidant effects. Combined, these herbs support the Pramehagna pathway, improves glucose metabolism, reducing Kapha, Meda, and corrects Agni. Next, integration, formulation, and clinical evidence. Herbal combination of capsule, Haritaki, Guggulu, and Commiphora myra in hyperlipidemic type 2 diabetic women showed a reduction in fasting blood glucose, total cholesterol, and LDL, and increase in HDL, suggesting that combining Medora and Pramehagna herbs may address both lipids and metabolic disorders. And evidence-based is still limited here because sample size is small and duration is short. Next, management. Lifestyle management includes Vyayama, Nidra, and stress management. Diet includes avoiding Kapha Meda aggravating foods like heavy, oily, sweet fried foods. And here, light, warm, easily digestible foods with regular timings are indicated. Herbal therapies like use of Medora and Pramehagna Dravyas as adjuvant therapies. And ongoing, one should monitor weight, lipid profile, glycemic indices, liver or kidney functions as per the dosha dhatu status. And one should focus on restoring Agni, eliminating Ama, reducing Meda and Kapha, involving metabolism. Conclusion, metabolic disorders like obesity, dyslipidemia, diabetes represent a major challenge. Ayurvedic approach via Medora and Pramehagna Dravya offers an integrative therapeutic avenue, herbs that enhance digestion, metabolism, fat mobilizing drugs and herbs that improve glucose regulation, insulin sensitivity, and key herbs such as Guggulu, Meshashtungi, Haritaki, Jambu, Guduchi have supportive pharmacological evidence. And these are the references I have used for the compilation purpose. Thank you.
Dr. Hasina?
Yes, sir.
Dr. Hasina, are you there, ma?
Yes, yes, sir. Am I audible, sir?
Yes, ma, you're audible. Have you done any analysis based on the Rasaguna Virya Vipaka of this Medohara and Pramehagna Dravyas, one side, or any active ingredients present in these category of drugs as per modern parlance to come out with a concept that what is going to act from these Rasaguna Virya Vipaka or the chemical constituents in managing your metabolic disorders?
Sir, here mainly Medohara drugs have Tikta Kashaya and Katurasa Pradhana Dravya, sir. Here Guduchi is Tikta Kashaya Rasa Pradhana Dravya. Gugulu is Tikta Katurasa Pradhana. Haritaki is Kashaya Rasa Pradhana. And Jambu is also Kashaya Madura Amla Rasa Pradhana, sir.
Yes, ma. See, you have that information, but I did not see this anywhere in your slides. When you put this, okay, this is what there, this is how it is going to act. So thereby it can control or be beneficial in metabolic diseases. I couldn't get a slide. There was something information that, okay, this drug has got this, but your analysis, like you have an objective, like, okay, or a question that this drug based on this property, it might be acting. Somewhere in your slides, you are not able to capture this.
Okay, sir. I will take your suggestion, sir.
Okay, that's it from my side, ma'am.
Thank you, sir.
Shall we move to next presentation, sir?
Yes, ma'am. I think that will be the last one, right?
This is the last presentation for the session. Presentation number 51, Dr. Sangameshwar.
Yes, ma'am, I am there. Yes.
Yes, sir. Please share your screen, sir.
Madam, it's visible, madam.
Make
Hello,
it,
madam.
sir, make it full screen. Presentation mode has to be changed, I guess.
Yes, madam, it's visible, no, madam.
Sir, your entire desktop is visible, sir. Can you make it presentation mode?
Yes. It's visible, no, madam. Can I say?
Yes, yes, sir, make it.
Can I start, madam, now?
Yes, yes, sir.
So myself, good morning to all, and Om Dhanvantari Namaha. And my topic is Ayurvedic management of hypothyroidism, a case study. Myself, Dr. Sangamesh Durwater from SS Ayurvedic Medical College, Haveri. I am an associate working here. So my today topic is Ayurvedic management of hypothyroidism, a case study. So, as an introduction, the hypothyroidism is a metabolic endocrine disorder characterized by the reduce in the thyroid hormone secretions associated with the sluggish metabolism, weight gain, and the psychological disturbances. And the Ayurvedic literature correlates it with the kapha medo vruddhi and dhatvagni mande manifested as in the galaganda. The prevalence rate of the hypothyroidism developed by world about 4 to 5, and that is about 14 to 15 worldwide, whereas reported as in being 11.4 for women and 6.42 for men. India has the highest prevalence rate of the hypothyroidism, about 10%. Hence, the studies attempt made for the observation and thyroid hormone changes in the galaganda. So, the causes for the hypothyroidism, it has been shown in the slide. It is an autoimmunity disorder and lowered stomach acid and the leak gut syndrome as an adrenal fatigues, and also the T3, T4 and TSH hormones involved in regulating the metabolism and levels of the oftenly checked within thyroid functions, whereas in within TSH and T4 levels. And also it's on the thyroid gland produces the T3, T4 and pituitary gland responds to it levels of the T3 and T4 by releasing the TSH. So I have got a case, a patient within the 36 years female, married, visited the Panchkarma department OPD at SS Isaac Medical College Hospital, complaints with fatigue, weight loss and hair loss. Examining the patient was subjected to the thyroid functions test was done. Where the TSH value 11.45, T3 was 1.18, and the T4 was 9.71. And the Shamrao studies within the Kanchanara Buguru 500 mg TID, Arogvardhanavati 250 mg BD, and Hamsa Padadi Kashaya 15 ml BD was given for 90 days. Within the Prathamarshana Anutaila was advocated to it. And we have got the results. Before the treatment, TSH level was 11.45, and it was done on the 3rd May 2025. And after the treatment on the August 3rd, 25, we have been done 1.53 TSH was the value was found in the patient. And next, there was a case continuing within the same treatment. Another case study was presented. Still, we have done the investigations as the TSH level was changed in the on 7/8/2025, it was 77.30, and on the 1st/9/25, it was 62.4549, and on 20th/11, 54.15. The same treatment protocol was continued to this patient also. It was followed within the Prathamarshana and the Kanchanara, Arogvardhani, and the Hamsapada Kashaya. So this was the result found. The treatment adopted in this is, as you are seeing on the screen, the Hamsapada Kashaya, Kanchanara, DS, Arogvardhani, and the Anita Prathamarshana was given to the patient. So the observations found in the patient was the Prathamarshana was taken as one of the interventions based on the Adhisthana Doshi predominance, as the hypothyroidism is on the main pathology present in the thyroid gland situated in the Urdhva Jatudha Bhaga. For Urdhva Jatudha Vikaras, the Nasya Karma is only indicated. So there was the weight stabilized and improved in the digestion and bowel habits. TSH level showed a near normal improvement in the reports, and treatment used in the study was more effective in reducing the symptomatic treatments as an hypothyroidism and normalizes the TSH. Here the Kanchanara Guru acted as an the Lekniya Kafagna and Arogvardhanavati Deepaniya Pachane and Hamsapada Kashaya, the Kafavata Shamaka, it acted in the overall the studies, overall the treatment protocol. So in study, hypothyroidism was analyzed based on the dosha, sthana, srotas, and agni by comparing the signs and symptoms of hypothyroidism. Kapha and vata are the main dosha involved in the pathology. Most of the symptoms of the hypothyroidism are similar to that of the kapha vata vriddhi and pitta, kshaya, and agni mandya, which was further leads to dhatu agni mandya rasa and medo dhatu dushti. And the Ayurvedic interventions help to correct the doshic imbalance, and the multi-modal treatment improved in the both symptoms in biochemical markers supports the integration of the Ayurveda in endocrine care. And also the conclusion, the hypothyroidism is hypometabolic state of the resulting from the deficiency of the thyroid hormones. It's a condition involving the Agnimandas, Diaphragmanda, the Athagnimanda level along with the Kapha, Vata Vriddhi and the Pitta Kshaya and the Rasavas Rutu. To stabilize the condition, a steady attempt was made by the administering the Anutaila as Pratimarshanasya after the completion of the intervention of 90 days. There was a significant result found in normalizing the TSH level. In present study, the revealed signs and symptoms of the hypothyroidism effectively, which was proved with significant results in the lab investigations of the thyroid levels, and hormonal imbalances often result from the toxin accumulations in the body, leading to the sluggish metabolism and improper hormonal processing. NASA helps to clear the toxins, restoration of the hormonal functions. So thank you, and all. Thank you for the opportunity to each and everyone.
Dr. Sangameshwar?
Sir.
Yes, sir. Sir, well documented, you have all the lab parameters there.
Okay, sir.
Did you notice any changes in the physical parameters of the patient or the symptomatology of the patient?
In the weight reduction, I got the change, sir. In the weight management and the physically, I observed the changes in the patients.
Apart from weight management, anything else? Dry skin, hair fall, low appetite?
Yes, sir. The physical appearance itself in the patients, we have got so many changes, like the weight loss and the physical appearance only, sir, and in the hair loss also, and there was a little bit weight loss was improved in the patients.
Yeah, because that was not reflected in your slide.
Yes, sir.
Thank you, sir.
Okay.
Sir, regarding to, is I'm audible, sir? Dr.
Yes, sir.
Sangamesh?
You are audible.
Yeah, yes. The presentation was good, and you have showcased the evidences for the clinical improvement. And what I felt was in the presentations, technically, if you could come out with a SOP for like NASIA, whether you are adhering to the principles of the classical NASIA, or have you modified as per the convenience with regard to the type of NASIA what you used in the initial phases or in the later phases, how you switched over to Pratimarsha, or did you like Pratah Shleshmani, Madhyahne, Pitte? So there are the principles which are laid. Have you adhered to any specific, or do you have implemented any customized or your the convenient practice as per your clinical observations? So that thing also you need to detail in your presentation, sir, as a part of SOP.
Okay.
And also whether any including the comprehensive for 90 days. So whether the patient was adhering or the patient was like the compliance he was in with regard to the long, almost like for 3 months. So how did you ensure the patient is adhering to the compliances, sir? So these things, if you made it in your presentation, sir, and also technically in case reports, we have to whenever we are doing the scientific presentation, it is very essential to mandatorily adhere to the case report checklist guidelines.
Okay,
Including the informed consent and other checklist. That is very essential, sir.
Okay, sir.
That's all from my side. Thank you very much.
Thank you, sir.
Thank you, Dr. Sangamesh, sir.
Okay.
Now, since we are at the end of the session, I request our judges, esteemed judges, Dr. Ramesh Kumar sir, Dr. Bairesh sir, and Dr. S. Germany sir, to kindly provide the concluding remarks.
Yes, ma'am. I'm happy to chair this virtual session with Dr. Ramesh Kumar from All India Institute of Ayurveda, New Delhi, and Dr. Shashidhar H. Dudmani from Kari, Bangalore itself. I thank both of them for being my co-judges here. Today we had 12 presentations, and in that only 2 male doctors and the rest 10 were females. And when we see across, but the judges, all 3 are males. Okay, we did not have any female judges with us. Among the 12 papers, we had 2 on dyslipidemia, 2 on diabetic dyslipidemia, 2 on Staulia or obesity, 1 each in diabetes, Alzheimer's, Vata Rakta, cardiovascular discovery, hypothyroidism, and Arches. The doctors who have presented made a really sincere attempt, and it was quite a learning experience, especially in those in vitro and in vivo studies presented, one in vitro and one in vivo. And the confidence which the presenters did really good. I congratulate each one of the presenters for having participated in this virtual seminar and presenting their papers. All the very best to them. Thank you, ma'am.
Thank you, sir. Dr. Ramesh, sir.
Yes, respected dignitaries, respected judges, Dr. Bairesh, sir, I am Ramesh Kumar. So probably you may not remember me when you were doing PG. I was final year UG, Government College, Mysore. It's happy to be in this particular session with esteemed judges as well as, and I thank CCRS for providing this opportunity. And overall, the presentations were, as sir mentioned earlier, spanning over different research areas, starting from drug discovery to experimental models, which can be probably used for the like that rabbit study model and other clinical conditions. And I could notice like there was significant number of case reports were also there. So overall, all the presentation participants have made their good effort, and some new efforts with regard to the methodologies are also. And it was very interesting to see that few of the. I was particularly looking at the how scientifically the presentations are sound, and the second thing is the methodological part. And most of the presentations were quite good at the methodological part also. And in somewhere in the methodological part, improvisations are very, very essential. Why? Because when in the scientific presentations, the methodology is equally important with regard to the scientific soundness or the scientific merit of the subject. So hence, we need to weigh both of the components equally. And with regard to that, I made my comments also, and probably those who like. And the most important thing I would like to suggest, if the participants would like, when you are presenting, you have to specify what is the nature of your the present, that is study type or the research type, and what is the scope of your presentation. And if the presentation goes within that scope, and it would be more convincing to the audience, those who are, and that will make your presentation more appealing. So otherwise, all the presentations were good. And once again, I thank CCRS for considering me. Thank you very much. Namaste.
Dr. Dadmani, sir.
Namaste to all. Congratulations to all presenters for a well presentation. And I thank my co-chair, Dr. Bairesh and Dr. Ramakrishna, for making my job very easy. And I thank on behalf of CCRS and CRI Bangalore for both the judges. And the main culprit in this metabolic disorder is a lipid toxicity. So we have to focus on lipid, where it is mentioned in Prameya Rogadikara. So whatever you are taking the treatment or in module or whatever, so it should be to reduce the lipotoxicity as well as the insulin resistance. So we have to work on the how carbohydrates are work on the gut flora also, because in Prameya Adhikara mainly they mentioned regarding the almost kapha vrichas, how they work in the level of gut flora. So such things should be brought into the concept or in such a conference. So I am very happy that in Charaka he has mentioned Medha, starting with Prameya Rogadikara, where it is mentioned that, and we have to work on the gut flora and insulin resistance also, how the other drugs are acting as insulin resistant and making the insulin sensitive. So these are the points, and our presenters nicely presented. I congratulate once again. And I thank once again Dr. Raghu, my colleague, and Dr. Vidyashri and Dr. Rahul for technical support. And also I thank Sulochana Bhatt Madam, Assistant Director in charge, and DG Sir and DDG Sir for opportunity. Thank you all.
Thank you, sir. I thank all the judges for spending your valuable time here and making this session successful. I'm sure all your valuable feedback would be very beneficial for all the participants who are presented today. Thank you so much for joining us, sir. Thank you. We'll start the next presentation in another 5 minutes. Next session.
Thank you very much, madam. Can we leave, madam? Thank you.
Yes, sir. Yes, sir. Thank you so much, sir. Thank you.
Thank you, ma'am. Thank you, Ramesh sir. Thank you, Dadmani sir. Thank you, Vidya ma'am.
Thank you all. Thank you, sir.
Good morning all. We'll start with the next session of this virtual presentation organized on the occasion of International Conference on Ayurveda and Integrative Approaches to Obesity and Metabolic Syndrome, scheduled to be held on 1st and 2nd December 2025. I hope the judges, Dr. Umesh C. and Dr. Gopal Krishna Ji, are you available, sir?
Good morning, madam. I am available. I am Dr. Gopal Krishna.
Yes, sir. Dr. Umesh? Just a second, sir. I'll call you. We'll just wait for 1 or 2 minutes for Umesh sir to join. Gopal Krishna sir, is that okay?
Yes, madam.
Okay.
Yes, madam.
Okay.
Namaste, sir. Population, sir. Namaste.
Namaste.
Namaste, sir. Umesh, welcome. Welcome. Namaste.
Good morning, Umesh sir.
Namaste.
So I warmly welcome all the guests here. It's my pleasure to introduce Dr. Umesh C, Assistant Professor of Ayurveda in Department of Integrative Medicine at NIMHANS, Bengaluru. Sir has completed BMS from Government Ayurveda Medical College, Bengaluru, and MD in Kaya Chikitsa. He has served in significant academic leadership roles at reputed Ayurvedic institutions and currently contributes actively to integrative clinical research at NIMHANS. Sir has held important external roles, including member of the Board of Studies at RGHS and member of the CCIM Syllabus Development Committee in New Delhi. He has authored over 30 research publications in peer-reviewed index journals, presented at numerous national and international scientific platforms, and serves as principal and co-principal investigator on major Ayush-funded research projects on Parkinson's disease, ADHD, insomnia, etc. We are honored to welcome you, sir, Dr. Umesh. Thank you for joining us, sir. We also have Judge Dr. Gopal Krishna Ji, an eminent Ayurvedic physician and academician, currently serving as professor and head of the Department of Kaya Chikitsa at Sri Sri College of Ayurvedic Sciences and Research, Bengaluru. Sir has completed BMS in 1998 from Government Taranath Ayurvedic College, Bellary, and his MD in Kaya Chikitsa in 2002 from Government Ayurvedic Medical College, Mysore, where his postgraduate research focused on the management of Yकृt Vikara, with special reference to alcoholic liver disease. With 20 years of clinical and teaching experience, he has been a dedicated clinician and consultant at Upadhyay Ayurveda Healthcare, Bengaluru, and has guided many postgraduate scholars in thesis work, research publications, and scientific presentations. He has delivered numerous guest lectures and has contributed actively to academic and clinical advancements in Ayurvedic internal medicine. We are honored to welcome Dr. Gopal Krishna Ji as a distinguished judge for today's session. Thank you, sir.
Thank you, madam.
We also have Dr. Sanjay Kumar Giri, sir, who is our own research officer at CARI Bengaluru. Sir has completed his BMS and MD in Kaya Chikitsa from Utkal University, Bhubaneswar, Odisha. He is actively engaged in IMR and collaborative research projects, outreach initiatives, and clinical research activities, serving in various capacities, including principal investigator, co-investigator, coordinator, and nodal officer. He has successfully completed 8 projects as principal investigator and 7 projects as co-investigator. He has published over 43 scientific papers in reputed national and international journals and has reviewed manuscripts for the JRS journal. Dr. Giri has also participated in numerous national and international scientific conferences, seminars, workshops, and training programs in areas such as research methodology, scientific writing, good clinical practice, and ABS standards, public health research, etc. I welcome you, sir. I welcome all the guests for this presentation, and I'll give a brief instruction to all the candidates who are presenting next. Kindly strictly adhere to the allotted time, as timing is one of the criteria for your evaluation. Please keep your camera on throughout your presentation. Ensure that your location has a stable network and internet connectivity. And who are not presenting, kindly keep your mics off. Thank you. We will start with our first presentation now for session 5. Presentation number 52, Dr. Dishin M. Vaghani. Dr. Dishin. The topic is evidence-based review of Ayurvedic therapies for metabolic syndrome and obesity. Dr. Dishin, are you there?
Yes, ma'am.
Please share your screen.
Is it visible still?
Yes, yes. Please make it full screen.
Hello.
Slide
Is
is
it visible, ma'am?
Yes,
Dr. Dishin, it is visible. Make
Yes,
it whole screen.
Is it okay, sir, now?
Yes, it is in WPS mode, I think. You can start presentation. It is visible.
Okay. Thank you, ma'am. Good afternoon, one and all, everyone. Today, my presentation topic is evidence-based review of Ayurvedic therapies for metabolic syndrome and obesity. Myself, Dr. Dishin, final year PG scholar from Department of Panchakarma from RIMC, Bengaluru. Start with the introduction. Metabolic syndrome and obesity are among the most pressing global health concerns of this century. They represent a cluster of interrelated metabolic abnormalities: central obesity, insulin resistance, dyslipidemia, and hypertension significantly increase the risk of type 2 diabetes and cardiovascular disease. According to WHO, the worldwide prevalence of obesity has tripled since 1975, affecting more than 1 billion people. Sedentary lifestyle, energy-dense diets, and chronic stress are major drivers. From an Ayurvedic viewpoint, this condition corresponds to stholia or Medaroga, described by Acharya Charaka as one of the Santarpanata Vyadhi. Ayurveda perceives obesity not just an excessive accumulation of fat, but as a disruption of metabolic hemostasis rooted in Agni Mandya and Shrotarodha. This paper aims to present an evidence-based analytical review of Ayurvedic concepts and interventions for metabolic syndrome and obesity, highlighting their integrative potential in global health management. Aims and objective to analyze the Ayurvedic conceptual framework of Stholia and Medaroga, vice versa, metabolic syndrome, to review Panchakarma and Shamana intervention with classical and modern evidence, to identify integrative strategies combining Ayurveda, diet, and lifestyle for effective and sustainable management. Conceptual framework of obesity and Ayurveda. Dana, excessive intake of Madhura, Snigdha, Guru Ahara, lack of physical activity, excessive sleep, especially daytime sleep, psychological stress, alasya, and avyayama, genetic predisposition, and deranged Medodhatvagni. Samprapti. In Stholia, deranged Medodhatvagni leads to improper metabolism of Medodhatu. The accumulated Medas obstruct Vata movement, promoting further disposition and systemic imbalance. Lakshana: excess deposition in abdomen, breast, and buttocks, lethargy, breathlessness, excessive sweating, tendency to diabetes, hypertension, and infertility, poor stamina, and the psychological disturbance. Chikitsa Siddhanta, therapeutic principle. The management of Stholia is based on the Apatarpana and Lekara therapies to reduce the Medas and restore the Agni. Acharya Charaka emphasized Langana, Rukshana, and Shodhana as a primary approach. Shodhana Chikitsa, Vamana Dharma indicate in the Kapha Medaja Stholia, expels the accumulated Kapha and Meda, clears Shrotarodha. Modern studies reported a 12 to 15% BMI reduction and improved lipid profile after Vamana with Madanaphala Yoga. Virachana Karma. enhance the Agni, detoxify the liver, and correct lipid metabolism. Trivrit Leyam or Arendtela commonly used. 2023 RCT Jamnagar has showed significant decrease in LDL and serum triglyceride post-Virechana. Lekhana Basti, formulation like Triphala Kvata, Musta, Daru Haridra, and Madanaphala use. Animal studies confirm improvement in insulin sensitivity and reduce adiposity. Udvartana, external Rukshana therapy using Triphala Churna, Kola, or Yava Churna improves the microcirculation and lymphatic drainage, visibly reduce the subcutaneous fat and cellulite. Shamana Chikitsa, pacifying therapy, herbal and polyherbal formulation like Navaka Gugulu, Triphala Churna, Meduhara Kashaya, Rukshamla, Gugulu, etc. So Navaka Gugulu, the classical reference is Bhaishya Ratnavali. Modern evidence is given. The 2020 RCT has shows reduced BMI and total cholesterol level. Triphala Churna, classical reference is Charaka Samhita, and modern reference it decrease the visceral fat and oxidative stress. For Patya, Lagu and Rukshahara like Yava, Mudga, Takra, Kulatha, Laja, avoid Madura and Snigdha foods, warm water and honey as daily Anupana, intermittent fasting and Langana principle aligned with modern calorie cycling, lifestyle and yoga, Vyayama suited to strength, Surya Namaskara, Kapalabhati, Bastrika, Anulomana, Vilomana, regulates glucose and fat metabolism, pranayama and meditation, reduce cortisol, addressing the stress obesity link. Modern scientific correlates. Modern research parallels Ayurvedic observations. Vamana and Virachana stimulate the gut-brain liver communication, improving bile acid metabolism. Udvartana and Lekhana Basti improves lymphatic drainage and insulin signaling. Herbal agents like Gugulu and Triphala exhibits AMPK activation and adipocyte apoptosis, scientifically explaining Lekhana Karma. Clinically, meta-analysis shows BMI reduction 8 to 15% after combined Panchakarma and Shamana regimen. Weight circumference reduced by 4 to 6 centimeter and serum cholesterol reduced up to 20%. No major adverse effect, confirming safety of long-term Ayurvedic therapy. Integrative and preventive perspective, Ayurveda emphasizes Nidana Parivajana, avoidance of causative factors as primary prevention. The Dincharya and Riticharya regimes ensure sustained metabolic homeostasis. Incorporating Ayurveda-based lifestyle modification with modern preventive cardiometabolic care can significantly reduce the disease burden. The gut microbiota modulation concept of modern science finds strong correlation with Agni Shrota Siddhi achieved through Panchakarma and Deepana Pachana. Such integrative understanding may pave the way for Ayurveda-inspired metabolic rehabilitation protocol globally. Discussion. Ayurveda provides a multi-layered approach, root cause correction, systemic detoxification, that is Shodhana, functional optimization, Agni Deepana and Shota Shodhana, rejuvenation and stabilization, Rasayana. Modern anti-obesity treatment often yield temporary result or cause side effect. In contrast, Ayurvedic therapies produce long-term metabolic regulation by restoring Agni and balancing dosha, dhatu, shrotas. Therefore, integrative Ayurvedic Panchakarma, herbal formulation, and lifestyle practice offers a safe, sustainable, and holistic framework and metabolic syndromes and obesity. Conclusion, Ayurvedic literature provides detailed pathophysiological and therapeutic insight into Stholia, closely resembling modern metabolic syndrome. Evidence from the recent trials confirm the clinical efficacy of Panchakarma and herbal therapies in weight reduction, lipid normalization, and metabolic correction. Integrative approach combining Ayurveda, diet, yoga, and modern health strategies ensure a sustainable solution for global obesity challenges. Future multicentric, large-scale clinical studies are warranted to further validate this outcome and establish Ayurvedic protocol as mainstream integrative therapy for metabolic disorders. Thank you.
Thank you, Dr. Dishin. Judges, if any questions?
Dr. Dishin, it was a good presentation. Did you work on HDL cholesterol? You were
Sorry, sir?
commenting on total cholesterol, no? You were commenting on total cholesterol.
Yes, sir.
Is there any comment on HDL cholesterol, good cholesterol?
Sir, no, sir.
Our therapeutics, maybe Shodhana, Shamanaushadhi, whatever it may be, is there any role in improving HDL cholesterol?
Please unmute yourself. We are not audible.
Okay.
Dr. Dishin, you are
Overall,
not
it was good presentation. Overall, it was fine.
Dr. Dishin, you are not audible.
Is it audible, sir, now?
Now it's audible. Again, it's not audible. You are not audible, Dr. Dishin.
Also, something problem is there, sir. It's not able
Yeah,
to unmute.
now you are audible.
You are audible, you can talk.
Yes, sir.
Dr. Dishin,
Yes, sir.
your topic was evidence-based review.
Yes, sir.
So, what type of review it is? Whether it is a scoping review, narrative review, or a systematic review?
It's a kind of narrative review. Means I have analyzed the whatever the studies we have done.
How many databases you searched for this narrative review? How many studies you got at an initial point, and how did you assess the qualities of these studies before presenting?
Hello.
Huh. You muted both your video and audio.
Hello.
We are able to hear you.
Yes, sir. So, sir, I have searched like from different sources, from the PubMeds and all other articles, sir.
So, how many articles you were able to find in PubMed?
12 initially 12, then additional 2 more I have
What
added.
was your search strategy? What are the Boolean operators that you used?
Sir?
What was your search strategy? How did you combine your search strategy by using or and? What is the Boolean operators that you used, and what was your search strategy?
Sir, I have searched through the Google Scholars and different
Scholar,
journals.
it doesn't gives en masse kind of a thing. It doesn't as a search strategy.
Okay,
Have you
sir.
done it or not? Or you have selected few articles and just presented it?
Yes, sir. I have selected articles from the different sources, from journals related to functional procedures, sir.
That's it. But there was no systematic search.
No, sir. No.
Okay. Okay. Thank you.
Yeah. Okay, sir.
We'll move on to the next presentation. Judges, is that okay?
Yeah. Yeah.
Yes.
Yes,
Presentation. Presentation.
उमेश जी
नेक्स्ट के लिए जाए आप पूछे सर
ठीक है ओके नेक्स्ट सर
Presentation number 53, Dr. Shweta Jain.
Yes, ma'am, I'm here.
Please share your screen and make it full screen.
Dr. Shweta, you are muted.
Mute, kindly unmute yourself.
Ma'am, is it visible now, ma'am?
Yes, it is visible. You can talk.
Good morning, everyone. Myself, Dr. Shweta Jain, from Department of Kaya Chikitsa, Government Ayurvedic Medical College in Mysuru. So today I'm presenting a paper entitled Microbiome Modulation through Ayurvedic Diet and Herbs in Metabolic Syndrome under the guidance of Dr. Sanjay Kumar, Government Ayurvedic Medical College Hospital, Mysuru. So starting the presentation, so metabolic disorders, so there are many conditions like obesity, diabetes, dyslipidemia, hyperuricemia. So they are grouped as metabolic disorders because they all share a chronic low-grade inflammation and disrupted interconnected metabolic pathways. It may be a glucose, lipid, vascular, purine metabolism like that. But recent research links these disturbances to the gut microbiota dysbiosis, where the altered microbial composition leads to the increased gut permeability and endotoxin leakage and immune activation. So although these disorders appear separate, they are interconnected through inflammation, altered metabolism, and gut dysbiosis. So coming for this gut dysbiosis, so I have just taken it as a central trigger in the metabolic disorders because it involves the reduced microbial diversity and an increase in the harmful bacteria and a decrease in beneficial short-chain fatty acid-producing microbes like butyrates. And dysbiosis also leads to a leaky gut, so allows the LPS, that is lipopolysaccharides, into the circulation. So when it comes to the circulation, it causes the endotoxemia and chronic inflammation, and also the reduced this short chain fatty acids and the increased LPS, that it will impair the insulin sensitivity and the lipid balance and the and also the vascular functions contributing to the metabolic syndromes. So this process not only accompanies but it amplifies the metabolic dysfunctions. So just collating from the Ayurveda, this is just a Samanya Samprapti because each Samprapti goes different for the different metabolic disorders here. So as you know, the Agni Mandya takes place here, that which causes to Ama. So the Ama then leads to the Srota Varoda, then Dosha Vikriti takes place, and then it leads to Rasadhatu Dushti, finally it leads to till the Medadhatu Dushti. So finally the root cause for here it is the Agni Mandya. So the quotation, that is Roko Sarvapi Mandagno quotes here. Coming for the aims and methodologies, the main aim of this presentation was to evaluate how the Ayurvedic diet and herbs modulate the gut microbe in the metabolic syndrome, so through an integrative framework. The methodology that included reviewing classical texts like Charaka, Shishruta, and Ashtanga, and comparing them with the recent microbiome researchers from different journals. So coming from this Ahara, so we know that Ahara, it is considered as a Mahabhaishya and the Prayogasama in our Ayurveda. And also our Acharya has given three main dietary rules like Ashtavida Ahara Visheshayatana, Ahara Vidhi Vidhana, Srutu-wise Ahara Kramas. These have been told in, and these classical dietary guidelines that align with the microbiome concepts like microbial diversity and the circadian rhythms. And even the foods like Yava, Mudga, Takra, they increase the beneficial bacteria like Lactobacillus and Bifidobacteria. And this Peya, Vile, Peyusha, that will support the digestion and the microbial metabolism. And the fermented foods acts as a natural probiotics, and the fiber-rich food acts as a prebiotics, showing that Ayurvedic diet naturally supports the microbial balance. So coming for the herbs, so there are many herbs that which we use in the metabolic disorder. So just have taken the three commonly used herbs like Triphala. So this Triphala, it increases the short chain fatty acid producing bacteria and improve the barrier. And Guduchi, as you know, it is an immune modulation. Also, it acts as an anti-inflammatory. So coming for Haridra, it reduces the LPS and also it reduces the endotoxemia. So it protects the tight junction. So by this we can say that Ayurvedic herbs is natural microbiome regulators. So coming for the discussion, so Ayurveda is inherently microbiome aligned through the concepts of Agni, Ama, and Srutas. And the Pitta Darakala, it balances the gut mucosal barrier and the tight junctions. So Ayurvedic interventions restore the microbial balance through diet, herbs, and Panchakarma, and also the circadian element. So which modern researchers now recognizes as a influencing metabolism. So Ayurveda personalized approach aligns with the individualized microbiome patterns. So finally concluding my presentation, the review shows that the Ayurvedic principles closely aligns with the microbiome mechanisms such as short chain fatty acids, endotoxin, gut permeability, and immune modulated regulations. And the Ayurvedic diet, herbs, and Panchakarma, so they demonstrate that the strong potential is to restore the eubiosis, strengthen the gut barrier, and the metabolic inflammation. So evidence from the recent microbiome researchers, so and that is from 2020 to 24. So the classical it supports the classical Ayurveda, integrative Ayurveda microbiome approach can effectively manage the metabolic syndrome. So overall, the study concludes that Ayurveda offers a holistic, personalized, and scientific approach which is compatible framework to modulate the gut microbiota and improve the metabolic health. So with this, I'll conclude my presentation. So lastly, I just want to add to share my recommendation for future studies, like to conduct multi-centric clinical trials and integration of Agni, Ama, Srutas with the microbiome biomarkers, and also research on the Prakriti microbiome correlation to strengthen the personalized treatment approaches. So with this, I finally conclude my presentation. Thank you, everyone.
Judges?
So, Dr. Shweta Ji, it was a nice presentation. You are bringing up Ayurvedic concept pertaining to the diet and even the herbs in tackling especially metabolic syndrome conditions and all. Much more Ayurvedic part you could have concentrated like Bhutagni, Dhatvagni, relation with the metabolic syndromes. Especially the Samprapti and all, we were making Agni Mandya, then Ama directly. From there, better to even concentrate on Dhatvagnis also. Bhutagni and Dhatvagni, because for all metabolic syndromes, Yakrat, liver is the main source. So much more Ayurvedic part you could have concentrated.
Yes, sir. I have missed it. But I'll take note of it, sir.
Dr. Sweta,
Overall, it was nice.
Yes, yes, sir. Thank you, sir.
you were talking about evidence base, and your entire presentation was about 3 studies which you told, not rather than a study. All the 3 were reviews.
Yes,
They
sir.
are not clinical studies. So based on review, which doesn't contains any clinical evidence, you are telling that herbs and diet is modulating the gut microbiome. So can you claim such evidence without properly going through some RCTs where the herbs and diet has been specifically used in metabolic disorders? Whatever all the ahara that you are claiming, these have been seen in normal studies, normal individuals, but exactly in metabolic syndrome, whether this diet when given and when these herbs given, they really change the gut microbiome. Are there any studies?
Sir, there are no such clinical studies, sir. Only preclinical
So
studies.
then whatever you are claiming is just an hypothesis. Why? Because you are telling Haridra, it increases the short chain fatty acids. Curcumin absorption itself is a big question mark. Second thing, Triphala, you told lipopolysaccharides, it decreases. There is no evidence. There are no clinical studies. So I think you should just concentrate whenever you present these type of cases, you should more concentrate on evidence base, whether these studies have happened. Through that, you have to collect the things and then you have to show them. Just selecting 2 or 3 reviews and presenting doesn't use any. Novelty is not there in this presentation.
Okay, okay, sir.
Next presentation number 54, Dr. Van E. Lalu, if I am pronouncing it right. Dr. Van?
Yes.
Yes, you can share your screen, start presenting.
Okay. My screen is visible, ma'am?
Visible, make it full screen.
Okay, ma'am. Can I start, ma'am?
Yes, you can.
Okay, namaste. Myself, Dr. Van E. Lalu. I'm second year MD scholar from Department of RSPK. So the topic I'm going to present today is Nanorasaushadhi in metabolic disorder and Ayurvedic review, biomedical review of Agni, Ama, and obesity. Introduction. In India, obesity has emerged as a rapid growing public health concern, and it is over 135 million Indian are now estimated to be overweight or obese. According to the NFHS 5, obesity in adult increased by 91% in women and about 146% in men. This clearly shows that India is facing a growing public health crisis. According to WHO, obesity is a major risk factor for hypertension, dyslipidemia, and type 2 diabetes, etc. An adult with a BMI of 30 kg per m square or above are classified as obesity, and the rising prevalence is largely driven by the lifestyle changes and unhealthy dietary pattern. In Ayurveda, staulia is attributed to impaired Agni, accumulation of Ama, and resulting to Kapha-Meda imbalance. So for this, Nanorasaushadhi address these factors through Deepana, Pachana, and Lekhana properties. The modern research support this approach by demonstrating that Basma contain nanoscale particles which enhance the bioavailability and cellular activity. And does nanoresaushity offer a promising approach for metabolic? Coming to the literature review, Staulia, the causes of Staulia arise due to the overindulge in Guru, Sita, and Snigdha Ahara, and Vihara like Avyayama and Achintana. Concept of Agni, referred to as a digestive fire, which is transformation of all the metabolic activities in the body. So due to the Nidana in the causes of Staulia, due to Nidana, there will be excess Meda Dhatu. So there will be an obstruction of the Srotas, and Vata will get confined in the Koshta and further leads to the overstimulation of Agni and further increases the appetite. And this will lead to the Staulia. So further a patient will be continuous consumption of the Kapha aggravating diet. It weakens the Agni and causes Vishama Agni and Manda Agni and lead to incomplete breakdown of the food and accumulation of the Ama. According to Charaka, it has listed 8 defects underlying of Staulia like Ayur Harsha, Javaproda, Kricha Avyaya, Daurbalya, Daurgandhya, Sweda Banda, and Ati Krishna and Ati Kshuddha. So come to obesity. Obesity as WHO defined, it is based on the BMI with a value greater than or equal to 30 kg per m square. And the causes of obesity is mainly due to diet and lifestyle, high fat or oil food content, and with a sedentary behavior. And oxidative stress, overloading of the adipocyte, increasing the reactive oxygen species, that is ROS, and energy imbalance, that is excess calorie intake and with less physical activity. And there is this mitofactorial origins. Coming to physiology of obesity, due to the increase of the fat intake and sugar, mitochondria will become overloaded and that causes increase of the ROS and further lead to oxidative stress and adipogenesis. And this causes adipose inflammation, which causes due to excessive release of the TNF alpha, IL-6, etc. And this increases the free fatty acid release and causes mitochondrial dysfunction, and this further increases the ROS. This further lead to the chronic inflammation, insulin resistance, and obesity. Coming to the modern and Ayurvedic perspective on the obesity, when we compare the two systems, Agni Dushti can be aligned with a metabolic dysfunction due to the nutrition and sedentary habits, and Ama can be aligned with toxin, oxidative stress, and inflammatory metabolites due to that overload glucose and free fatty acid. And the obstruction of Srotas can be resembled with a microvascular and metabolic blockage, which can be due to the increase of the ROS. And the Meda Dhatu Vriddhi can be resembled with the adipocyte hypertrophy and fat accumulation, which can trigger the pro-inflammatory and pro-oxidant state. Coming to nanoresaushity, the bhasma is a herbomineral metallic compound. In studies, it has shown that the bhasma particle size is less than 90 nanometer. And in some research also show that the more Puttapaka method has been adopted further, the particle size also will be reduced and it will enhance the therapeutic efficacy. The significance of resaushadi here is like alpa matra upayogitvat, aruchi aprasangataha, kshipram arogyam dayitvat, aruchi aushadebhyo adhipo rasaha. When coming to comparing to the modern science, we can say that the nano medicine molecules, they range from between 1 to 100 nanometer. This will enhance the drug delivery, bioavailability, and control release. So on comparing both this, when comparing what is Ayurveda Bhasma and then the nanoscience, they share similar advantages with the increased surface area and then the bioavailability and then the target or quantum level effects and target delivery. So Bhasma behaves as a nano particulate therapeutic metals with a property like alpha mata, shigra vyapi, and the yogava. Coming to the dhatu bhasma properties, dhatu which can be used in obesity. Firstly, one which is made of property, tamra, naga, vayash. Bhasma, they will improve the metabolic metabolism and is useful in fatty liver, dyslipidemia, insulin and resistance. insulin resistance. And secondly, in Agni Vardhan.
Dr. Vanini, I think we have lost you. Hello? Dr. Vanini? We'll wait for 1 minute, sir.
Yes, madam.
Yes.
Hello?
Yes, we can hear you.
You can hear me, ma'am?
Yes. Please stick on to the time actually. Was that your last slide?
I think, Dr. Wan, your internet is not stable.
Internet is not stable and they are already exceeded time also. Can you conclude it if you have settled? Okay.
Hello?
Hello, yes. You can conclude it.
Hello?
Yeah, you can talk. Dr. Vanini, you can talk.
Hello?
Yes, we can hear you.
My network is keep on disconnecting, ma'am.
You are audible. You can continue, ma.
Coming to Dhatu Bhasma properties. Atasa Medohara and Atasa Lekhana, like Tamra Naga, Naga Vanga and Yashada Baswa, they reduces this will help in reducing the epidemic insulin and insulin resistance groups like Swarna Vanga and Makshika. They will boost the agony, support the mitochondrial function, and benefit in obesity with sluggish metabolic low energy. Thirdly, Rajata Basma, which helps form as the CNS and appetite regulation groups. They help in stress-induced overeating and metabolic imbalance. So coming to discussion and conclusion, obesity arises from sedentary lifestyles, poor dietary habits. So parallel with this, Ayurveda view as a disrupt dinacharya, impair agni, dosha imbalance, and then Veda accumulation. So for this, Dhatu Bhasma, through the Deepana, Pachana, and Lekhana and Rasayana action, it may help in restoring the metabolic balance, reduce excess Meda, and clear the ama. So, and because of their nano-sized particles, it will help in improving the bioavailability and also the targeted action. So they support both the classical theory and the modern neuroscience. Thus, the Dhatu Bhasma offer a holistic integrative approach to managing obesity and metabolic dysfunction. So for future scope, exploring the pharmacokinetics and pharmacodynamics profile for a deeper mechanistic understanding can be done, integrating the Dhatu Bhasma with diet and lifestyle for evidence-based obesity management, and promoting interdisciplinary research linking Ayurveda and nanotechnology for global therapeutic application also can be done. Thank you.
Yes, Dr. Van, you just show those mode of actions.
Yes, sir.
We're showing the mode of actions of various bhasmas, no?
Yes. Yes, sir.
No, not this one. Mode of actions
Several
of various
mechanisms you have.
Naga Bhasma. Here. Probable mode of any evidence-based study or hypothesis.
No, there's no evidence. No, there's no evidence based upon their properties only, which I've collected from various,
Here, so many things have been claimed, no? Like,
Not talking
with that only Yes, sir.
here, Tamra Bhasma
Yes, sir.
reduces serum cholesterol, improves liver function. On what basis these things have been claimed?
There is no evidence, sir, but based upon their properties only as per Ayurveda, it can help, but there is no evidence, sir.
Because here, mainly the properties go like Lekana, Medohara, Deepana,
Yes,
Pachana
sir.
and all.
Yes, sir.
How these, maybe if you go through with hypothesis also, how for example, Tamra Bhasma, how this might have helped in improving the liver function?
Because of
As
the Rasayan,
antioxidant property or scavenger, free radical scavenger, any such concepts?
there is some articles which have shown that they have a free radical scavenging property. So,
Okay, much more clarities are needed in this.
some articles I have seen, sir.
Even because many such vague terminologies, mode of actions have been utilized here. Okay. Some more clarifications are needed for this presentation.
Yes, sir.
We'll move to the next presentation, sir. Okay, sir.
Sir, next presentation.
Okay.
Presentation number 55, Dr. Nayana DR. Dr. Nayana, are you there?
Yes, ma'am. I'm audible, ma'am.
Yes, you can share your screen. Please stick on to the time, all the participants.
Is it visible, ma'am?
Yes, sir.
Good morning, all. Myself, Dr. Nayana DR, second year PG scholar, Department of Kaya Chikitsa, Government Ayurveda Medical College, Mysuru. The topic of my presentation is role of adaptogens in stress-induced metabolic syndrome. Introduction. Stress-induced metabolic syndrome dysfunction is the impairment of body's ability to regulate the metabolism due to chronic stress, leading to insulin resistance, obesity, and increased risk of type 2 diabetes mellitus and heart disease. This stress activates HPA axis, that is hypothalamic pituitary adrenal axis, and release of cortisol, catecholamines, and etc. These are all responsible for the metabolic dysfunction. And here at adaptogens, it is a natural substance that enhances body's non-specific resistance to stress and helps to normalize the physiological function altered by stress. And Rasayana Dravyas are considered as the natural adaptogens. Here is the correlation of stress and metabolic function. First, HPA axis overreaction. Due to chronic stress, there will be increase in corticotropic releasing hormone. It is secreted by the hypothalamus. And again, it stimulates the pituitary gland to secrete adenocorticotropic hormone, which in turn release of cortisol from the adrenal glands. And this cortisol promotes the hepatic gluconeogenesis, which causes hyperglycemia. And also it inhibits the insulin receptor signaling, which causes insulin resistance. And also it promotes the adipocyte differentiation, and which causes visceral adiposity. And the second one, inflammation and oxidative stress. This chronic stress, which increases the pro-inflammatory cytokines, that interleukin 6 and etc. These impair the insulin signaling and mitochondrial functioning and lipid homeostasis. And the third one, mitochondrial dysfunction. Mitochondria is the primary target of stress hormone and reactive oxygen species. This dysfunction results in impaired ATP production and energy imbalance. And here is the concept of adaptogens. This adaptogens is the herbal compounds, and it increases the non-specific resistance to physical, chemical, and biological stress, and it maintains the homeostasis in neuroendocrine, immune, and metabolic system. Here we can consider Rasayana Dravya as adaptogens because it promotes Ojas, Agni, and Dhatu Bala. These Rasayana Dravyas are Agni Deepaka, Srotoshodhana, Dhatu Poshana, Ojas Vardhana, and Manasika Bala Vardhana. Here is the mechanism of action of adaptogens. It mainly act as a neuroendocrine regulation by acting HPA axis modulation and reducing the cortisol secretion. And it acts as a molecular effect like HSP 70. It helps in maintenance of the cell from the stress, and it is a protein, and it increases the AMPK. It is an enzyme which maintains the energy balance and maintains homeostasis in our body. And mTOR, it is a protein which maintains anti-aging and metabolic regulation. And third one, cellular protection. It increases the antioxidant enzymes in our body like SOD, catalase, and glutathione. Here is the pharmacological evidence supporting Rasayana as adaptogens. First one, ashwagandha. It contains vithanolides and it decreases the cortisol and improves the insulin sensitivity. And guduchi, which contains tenosporide. It acts as a antioxidant and anti-inflammatory. Amalaki, which contains vitamin C and improves the lipid profile, and it is an antioxidant. And Tulasi eugenol, it contains eugenol and it acts as an anti-stress and glucose regulation. And Shatavari, saponins, it maintains the hormonal balance. And Shilajit, it contains fulvic acid. It acts as a mitochondrial energizer. Here is the Rasayana Dravyas as adaptogens. There will be due to some of the pathways like molecular and biochemical pathway, HPA axis and AMPK pathway, which is supports that Rasayana Dravyas as adaptogens. And Medhya Rasayana as neuroadaptogens. Some of the drugs like Brahmi, Mandukapani, and Shankapushpi. These are described as a Medhya Rasayana. They act as a neuroadaptogens and protecting the neurons from the stress-induced oxidative and inflammatory damages. And Rasayana and metabolic regulations. Rasayana Dravyas are known for it strengthens the Vyadikshamatva and Dhatu Bala. Here is the integrative model of Rasayana as adaptogenic therapy. It maintains the body and mind integration by Rasayana acts as the simultaneously and Sharira and Manas. It enhances both Manasika Rasayana and Sharirika Rasayana. And it restores it helps in maintenance of Tridoshak balance and Vyadikshamatva and cellular adaptations, like it maintains the mitochondrial integrity and redox balance and optimum gene expression for stress resistance. Here, due to stress, there will be disturbance in Agni and Ojas depletion, which causes HPA hyperactivity. Due to consumption of Rasayana that act as adaptogenic intake, results in HPA axis balance and immune modulation and antioxidant booster and improved metabolism, and which helps in maintenance of the homeostasis, so that it acts as an adaptogenic effect. Here is the conclusion. Chronic stress activate HPA axis and elevate the cortisol, leading to insulin resistance and inflammation and disturbance in glucose and lipid metabolism. Adaptogens, particularly some of the drugs like ashwagandha, guduchi, amalaki, tulasi, helps to counter these effects by modulating neuroendocrine responses and enhancing the oxidant defense, regulating the inflammatory pathways by improving metabolic balance and supporting mitochondrial function and strengthening overall. These adaptogens offer a holistic and evidence-supported approach to preventing and maintaining the stress-induced metabolic dysfunction. Thank you.
Dr. Naina,
Yes,
what
sir.
do you mean by Manasika Rasayana?
Sir, some of the Medhya Rasayana are mentioned, sir, in Rasayana Adhyaya, like
That
Manduka
means
Paraneshwara.
Yes, yes. First, they should act on Sharirika doshas, then indirectly Manasika doshas. No?
Sir.
No, the idea, like, from where you got this Manasika Rasayana word?
Sir, they are mentioned in some of the articles. Rasayana, it acts both on Sharirika
Classical,
doshas.
that is there, that is fine. When we have Sachara Rasayanam, all those things, the one which directly influences the Manasika doshas, Rajas and Tamas. So here, especially Manasika Rasayana, what is the concept of that Manasika Rasayana? Whether it directly acts on Manasika doshas or first it should act on Sharirika dosha, rectifying the Sharirika dosha, then it will influence the Manasika.
Sir, it acts on both the Sharirika and Manasika doshas, sir.
And that's right. First it should act on Sharira.
Sir.
It should come through Agni only.
Sir.
Rectifying the Agni, then Ama, then Srotas, then Dhatus, then only it should be. So whether do you have such classification like Sharirika Rasayana, Manasika Rasayana? Whether classically we come across with the word Manasika Rasayana?
No, sir. No, sir.
Just think of, okay?
Sir. Okay, sir. Thank
you. Dr. Nayana.
Yes, sir.
You spoke about HPA axis. Presentation was good, but from Ayurveda point of view, you didn't establish the psychosomatic axis. You spoke about stress playing a role in metabolic thing, but similarly, how the mind plays a role in causing these type of metabolic disorders from Ayurveda point of view, we didn't bring in that concept, because directly you brought the Rasayana into the play immediately. But I think somewhere you could have brought in that psychosomatic axis, like how the Manasika Bhavas affect the Agni metabolism. If you've seen Grahani chapter, you will get it. So those concepts you can have brought in. Okay, that would have little bit established the thing. And the second thing is that living HPA axis, where a lot of studies are there on ashwagandha to reduce cortisol. You climbed other pathways like AMPK pathway, NFKB pathway, antioxidant pathway, mTOR pathway. Can you just tell me one drug that you have found which act on these pathways?
Sir, ashwagandha, which helps in these pathways, sir. Ashwagandha
AMPK pathway. Have you seen? Any studies have seen? NFKB pathway, antioxidant pathway, mTOR pathway. Ashwagandha, have you seen? Are there any studies? Can you quote one study? Can you cite one study? No, na?
Yes.
So I think in future setting, when you put all these things, we should try to find out are there any evidences and then present. Then your presentation will be more informative. Okay. Okay. Thank you.
Thank you, sir.
We move to the next presentation, presentation number 56, Dr. Ravi Kumar.
Yes, ma'am. I'm audible, ma'am.
Yes, you're audible. Please share your screen.
Screen is visible, ma'am.
Yes.
Namaste, everyone. Myself, Dr. Ravi Kumar, second year PG scholar from Department of Ayurveda Samhita and Siddhanta, guided by Dr. Chetan M, Professor and HOD from Department of Ayurveda Samhita and Siddhanta. I'm going to present on the topic Gramya Ahara, Foundation of Metabolic Illness and Barriers to Rasayana. My screen is visible, right, ma'am?
Doctor, your screen is visible. You can continue.
Yes, thank you, sir. Thank you, sir. At first, the metabolic disorder is itself is not an Ayurvedic term. It is an Anukta Vyadhi. Nai sarva vikaranam namato asti dhruvastita. As by Acharya Charaka Acharya said, naming is not necessary for every diseases. How do we look at this particular diseases? I'm trying to integrate the modern definition of metabolism with Ayurveda wisdom. Kaya signifies with the Ayurvedic wisdom, where the Kaya signifies constructive or building phase, while the Sharira represents the catabolic. Anna transformed by the Agni to sustain Deha. The goal of this continuous metabolic cycle is Dhatu Samya, or the tissue balance. Any failure in this harmonious process results in the Sarvadosha Prakopa, that is the metabolic disorders, underscoring balance as the foundation of health. In Taittiriya Upanishad, it is beautifully explained that it says the fundamental principle of Ahara Parinamana, where Agni acts upon the Anna to create and sustain Purusha. It says that the universe provides the fuel, that is Anna, and the body's internal energy, Agni, performs the necessary work to turn the fuel into the Purusha. Then, where it occurs and how it occurs. If we understand the physiology, then it helps to understand the proper understanding of pathology. At first, understanding metabolism, Dhatu Parinamana at Srotas, where the Sarva Sharira is made up of Srotas, the Dhatu Parinamana takes place Dravyataha and Gunataha. All the endocrine and exocrine functions seen under this. The characteristics of food material transferred into the characteristics of tissues as a result of metabolism, where uniformity builds the body tissues, where the antagonism depletes the body tissues. At first, where we can understand transformation of food into the tissue components. Not all, but the part of food digested and metabolized into respective body tissues, the one which not convert will turn into mala. At second, impact of ahara gunas on dhatu formation. By principle vriddhi samanai sarvesham, those qualities that which are not aviradha to sharira will shows its respective rupa. Ahara, which is katina in nature, nourishes mamsa, asti, etc. dhatus, and dravabhaga nourishes shonitadi components in the visharira. Thirdly, the consequence of Viruddha Guna, where Viruddha Guna leads to Rasa of Sharira Guna, the Viparita Ahara leads to Kshaya of the Dhatus. And even Saptamitya Ashanas, where Sankirna Ashana, Viruddha Ashana, Amatra Ashana, Ajirna Ashana, etc., plays a vital role in the pathogenesis of the Vyadhi. Then, what are the factors which leads to the imbalance in the metabolism? The Gramya Ahara, where Gramya Ahara, it says Gramo Bhavaha, where the Ahara which undergone samskara and used in the Grama, where common everyday dietary and lifestyle habits, though seemingly normal to a community, they are fundamentally flawed and when regularly consumed or practiced, leading to diseases, where Gramya Ahara is responsible for all types of detrimental effects in the body, where it can be divided into Ahara, Vihara and Manasa Bhava, where Ahara it includes Amla, Lavana, Katuk, Shara, Shushka, Mamsa, Tila, Palala, Pistana, etc. Aharas, and Vihara, Diva, Swapna, Stri, Madhya, Nitya, Vishamati, Vyayama, etc. And Manasika Bhavas include Bhaya, Krodha, Shoka, Moha, etc. will leads to the finally Sarvadosha Bhavanti. Means Sarvadosha Prakopa can be seen by this Gramya Ahara. Next, Dusti of Dhatu Parinamana, how it can occur, where Agni is the cardinal principle responsible for all the chemical and biological transformations, extending the definition of metabolism beyond the modern biochemistry. It converts the Anna into subtle essence of the Purusha. When Agni is balanced, it creates proper bhavas that ensures the flawless ahara parinamana. This leads to the correct sequential formation of dhatus, resulting in the state of perfect dhatu samya, which is the swasthya. When Agni is impaired by the nidana sevana, etc., by gramya ahara, etc., it generates improper bhavas and leads to the formation of ama, where ama clogs the strotas, where it is the vital transporter of sara and kitta, disrupting the entire metabolic chain and leads to dhatu parinamana dushti and severe metabolic disorders. In essence, the Ayurveda views the metabolic health as a direct reflection of Agni's strength and efficiency, where maintaining the Agni prevents the accumulation of Ama. As emphasized by Acharya Charaka, Roga api sarve api mandagno. Where impact of positive factors, we can see Vishyandate cha analpa medaha, where Vishyandate, Vishishta Shandate of Meda can be seen. It can be understood by central obesity or fat dysregulation, etc. Vidayate raktam, where chronic inflammations or the precursor of hypertension, cardiovascular diseases, etc. can be seen under this. Na sandhiyate astishu majha shukram na pravartate, where endocrine and reproductive failures can be seen. Shayamupedi oja, loss of vitality, and where insulin resistance, etc. mitochondrial dysfunctions can be observed under this category. where ato nimittam e shitili bhavanti mamsani vimuchyate sandeha, where musculoskeletal dysfunctions. Next, sa evam bhuto glayati sidati nidra tandra alasya samanvito nirutsaha shwasati asamartha jeshtata, etc. And it is it acts as a rogana madhisthana bhuto. It becomes the foundation of many diseases by these gramya ahara. And understanding metabolic disorders, where Acharya Charaka beautifully explained in Santarpani Adhyaya by consumption of snigdha, madura, pichila, navanna, where new grains, alcohol, marshy and aquatic meat, etc. By these consumption of Santarpana Janya aharas, rogas tasyopajayante Santarpana nimittaha, where we can observe many metabolic or systemic illnesses, disorders like prameha, atistolya, clybia, pandu, jwara, kota, kandu, kusta, etc. Many metabolic disorders can be observed. Acharya Sushruta in Chikitsa, Kusta Chikitsa Adhyaya beautifully says, Tatra Twagdveshi, Mamsa, Vasa, Dugda, Dadi, Tila, etc. One must avoid in order to get rid of Kusta Vyadhi. So these are all the Kusta Varjyas. The role of Agni and metabolic disorders, where Acharya Charaka beautifully explains the entire foundation of the human vitality, our strength, health, lifespan, and every breath rest upon the digestive fire, which must be sustained correctly by proper food and drink, or else it will fail. Where Agni is the root of Sleshma, Bala, and Ojas. Balanced Agni ensures proper functioning of Vata, Kapha, and maintenance of Bala, and preservation of Ojas, which are the cornerstones of health. Of all the sustaining forces of life, Agni holds the highest importance. When Agni is balanced, it safeguards strength and vitality. When it is impaired, it gives rise to many disorders or diseases. And when it is extinguished, the life itself becomes an end. Hence, Agni is regarded as a fundamental basis of health and survival. Where even Acharya Charaka in Vatakalakali Adhyaya, he says, Prakruta Vayu Karma is the Dhatu Gati Sama, where it leads to Sukha and Arogya. Then if it gets Vishama, then it leads to Dukkha and Roga. Where the line of treatment, it includes at first the Nidana Parivarjana, where Nidana Parivarjana is the prime line of treatment. It helps in therapeutic, prognostic and diagnostic tool for proper chikitsa. Next, following Ahara Vidhi Vishesha Ayatana, where it plays a major role in the selection and intake of our food. Helps us know about the wholesomeness of food, and also we need to take the quantity, quality, and the combination of food, the place and time related, and the rules to be followed while consuming the food. Therefore, this is very important for everyone to know the conditions thoroughly. Next, Ahara Vidhi Vidhana, where it encompasses the guidelines for optimal health. It specifies method, timing, manner of food consumption, emphasizing proper preparation and combination of food. Next, we can see the Shodhana and Shamana line of treatment, where Shodhana is the main line of treatment for metabolic disorders, where Acharya says, Malapaham Rogaharam Balavarna Prasadanam, where by Shodhana, it helps to remove the doshas, and by Shamana line of treatment is mainly for Shesha Dosha Nirharanartha and Agni Deepanartha and Rasayana administration. Next, discussion conclusion, where the Gramya Ahara Vihara is the prime mode for vitiation of dosha and dhatu. The Ahara becomes Gramya according to the rasa that possess, the time in which it is consumed, the quantity in which consumed, the regular and irregular intake of that food, the other food particles used along with it, etc. When even the place of living is also an important factor which makes the food Gramya. Metabolic disorders or syndrome can be well treated as a Santarpana Vikara. Ayurveda views the Agni to be essential entity of the human body that not only aids in digestion but also responsible for many metabolic activities. Agni governs the metabolism of food into nutritional energy, which in turn regulates the regular physiological function of the body. The conclusive therapeutic command is absolute. One must achieve Nidana Parivarjana and correct the metabolism before becoming eligible for Rasayana, confirming that the cessation of destructive habits is the indispensable precondition for deep healing and longevity. Thank you.
Yes, Dr. Ravi Kumar, you were emphasizing on this Jataragni.
Yes,
but much more, especially last sentence is there, no? The conclusive therapeutic command. One must achieve Nidana Parivarjana and correct the metabolism. To correct metabolism, even we need Dhatwagni correction also.
Yes,
so
sir.
then only the person will be eligible to go for Rasayana therapy. So Bhutagni correction, Dhatwagni correction. So most of these things are like concentrating on Jataragni. So how we can go through up to the level of even the Nishtapaka also. For example,
if Jataragni is correct, then the Bhutagni and Dhatwagni will be absolutely right. then it will helps in the normal proper of avasthapakas, then it will lead to proper avasthapaka and then to proper nishtapaka, sir. If it is abnormal at the Jataragni phase itself, then almost all the complete process will be hampered, sir.
Only Jataragni, like going through Langana Chikitsa and all, so Jataragni will get corrected. But furthermore, to balance Bhutagni, do we have any furthermore line of treatment?
Sir,
Or
if we
only this is
yes.
sufficient? Only Jataragni correction is sufficient for all the diseases.
Sir, if we correct Jataragni, then it will automatically correct the Dhatvagni and Bhutagni, sir. It is the main thing that the Jataragni correction, it will helps to
For example, Dhatvagni vitiation may be sometime Adibala Pravurta or Janmabala Pravurta, may not be Doshabala only. So in that condition, what furthermore we can attempt to rectify Dhatvagni or Bhutagni? Only if we concentrate only Jataragni, is it sufficient?
Sir, doshanam api sarvesham roganam eka karanam, where doshas are the main causative factors for carrying the disease.
That is okay. Like Abhyantara Roga Marga diseases we have, especially Ajirna, Agnimandya and all, that is fine. Even Visuchika, Alasaka, Vilambika and all, that is fine. But
Yes,
when once the ama has entered into Shaka, so only mere, for example, Amavata we have, or any other disease wherein the ama would have entered into deeper tissues. Only Langana is sufficient during that period. Only correction of that Jataragni is sufficient.
No,
Or much more we will have to attempt.
We need much more, sir. Why? Because I have mentioned Nidana Parivarjana as the prime line of treatment, followed by that following Ahara Vidhi Visheshayatana and Ahara Astavida Ahara Vidhi Vidhana, where the next followed by that Shodhana and Shamana line I have mentioned. Why? Because Shodhana is the prime line of treatment for removal of doshas. When performing Shodhanas, it helps to remove the doshas from the body, and after that we can perform the Shamana line of treatment. It helps in the
That
more.
was the basic idea.
Yes, sir.
Yes, that was the basic idea, because only Langana may not be sufficient. No, Langana,
No, sir. No,
Langana
sir.
Pastana, Dosha Avasechana, then he is fit for Rasayana therapy.
Yes, sir. Yes, sir.
Okay. Okay, it was nice.
Thank you, sir. Thank you, sir.
Dr. Ravi Kumar, it was a very good, nice presentation. So
Thank
you
you so much.
compiled all the textual references and you explained them very beautifully. So I don't have much questions, but only one thing is that in current era,
Yes,
is
sir.
it possible to avoid Gramya Ahara?
Sir, it's the era where all the persons or the people who are addicted for Gramya Ahara, in the sense completely processed foods, pizza, burger, etc., hot oven foods, etc. So by proper, in the sense, if a, for example, sir, I am giving an example. If an IT worker who has to wake up all night and he has
I understood it. I understood it. Like, for example, see, nowadays, going to the fast culture, it is very difficult to avoid this pizza and burger. Okay, but we're talking about Ashtavidhi Ahara, Ayatanas, and
Yes,
all
sir.
these things. When these Prakriti, Karana, Rashis, Samyoga, Samyogopyakasta, everything comes, when nothing is in line in today's world, what would you recommend? What is that solution that you would recommend to avoid these metabolic disorders?
Sir, samskara of the food plays a major role, sir. Yeah, samskara of a food, what he
I
take
know
or
samskara of a rule, Ashtavidha Ahara Ayatanas play a major role. I know it.
Yes, sir.
But in nowadays, as it is inevitable to avoid all these things, so what is your suggestion for the present? I mean, for the audience, that what you recommend? What are the things that you can recommend, or what is the solution for it? I am asking.
Sir, up to most means for ಸರ್ ಈಗ ಅವ್ರ ಕೈಯಲ್ಲಿ ಎಷ್ಟು ಸಾಧ್ಯ ಆಗುತ್ತೋ ಅಷ್ಟನ್ನ ನಾವು ಫಾಲೋ ಮಾಡ್ಲಿಕ್ಕೆ ಹೇಳಿದಾಗ ಅವರು ಫಸ್ಟ್ ಎಷ್ಟಾಗ್ತದೋ ಅಷ್ಟನ್ನ ಸಾಧ್ಯ ಆದಷ್ಟು ಅವ್ರು ಫಾಲೋ ಮಾಡ್ತಾ ಮಾಡ್ತಾ ನೆಕ್ಸ್ಟ್ ಅದೇನಾಗುತ್ತೆ ಅವರು ಅದಕ್ಕೆ ಹ್ಯಾಬಿಟೇಟ್ ಆಗಿ ಅದನ್ನ ಫಾಲೋ ಮಾಡ್ಲಿಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತಾರೆ ಸರ್. ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಒಂದು ಸರ್
ಫೋಕಸ್ ಆತ್ಮೀಯ ಆಗ್ಬಿಡಲ್ವಾ?
ಫೋಕಸ್ ಆತ್ಮೀಯ ಅದು ಕೂಡ ಅದರಲ್ಲೂ ಕೂಡ ಮತ್ತೆ ಪ್ರಾಪರ್ ಆಗಿರೋದನ್ನ ಮಾತ್ರ ಫಾಲೋ ಮಾಡಿ ಅಂತಾನೆ ಹೇಳ್ತೀವಿ ಸರ್. ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಒಂದು ವರ್ಕರ್ ನೈಟ್ ಡ್ಯೂಟಿ ಮಾಡ್ತಿದ್ದಾರೆ ಅಂದ್ರೆ ಕಂಪ್ಲೀಟ್ ನೈಟ್ ಎಲ್ಲ ಎದ್ದಿರ್ತಾರೆ, ನೆಕ್ಸ್ಟ್ ಡೇ ಆಫ್ ದ ನೈಟ್ ಏನ್ ಎದ್ದಿರ್ತಾರೋ ಅಷ್ಟು ಮಲಗಿ ಫಾಲೋಡ್ ಬೈ ಫುಡ್ ತಗೊಳ್ಳಿ, ಈ ತರ ಸ್ವಲ್ಪ ಅವ್ರ ಡಯೇಟ್ ಆಗಿರ್ಲಿ ಲೈಫ್ ಸ್ಟೈಲ್ ಅಲ್ಲಿ ಆಗಿರ್ಲಿ ಸ್ವಲ್ಪ ಚೇಂಜ್ ಮಾಡ್ತಾ ಹೋದಂಗೆ ಅವರ ಲೈಫ್ ಸ್ಟೈಲ್ ಅಲ್ಲಿ ಸ್ವಲ್ಪ ಚೇಂಜ್ ಮಾಡ್ತಾ ಹೋಗ್ಬೋದು ಸರ್. ಪ್ಲಸ್ ಈ ಋತು ಶೋಧನಗಳಾಗಿರ್ಲಿ, ನೆಕ್ಸ್ಟ್ ಶೋಧನಗಳು ಅವರ ನೆಕ್ಸ್ಟ್ ಅಂದ್ರೆ ತುಂಬಾ ಅಗ್ರಿವೇಟ್ ಆಗಿರುವ ಟೈಮಲ್ಲಿ ಬಿಟ್ಟು.
Yes, got it. Thank you.
Yes sir, thank you so much.
Thank you, Dr. Ravi Kumar. Next presentation, 57, Dr. Sharada. Participants, please stick on to the time.
Am I audible, ma'am?
Yes, you can share your presentation.
Is the screen visible, ma'am?
No.
Now?
No, please share your screen. No, it's not visible.
Is my screen visible, ma'am?
Yes, make it full screen. Yes,
Now?
Yes, please start.
Namaste everyone. Myself Dr. Sharada from GAMC Mysuru. I'll be presenting on the topic Ayurvedic interpretation of gut dysbiosis in metabolic disorders, a conceptual review of pathogenesis and its management. Coming to the introduction, metabolic diseases are those in which the process of conversion of food to energy on a cellular level is hampered. Causes may be multifactorial, but a key contributor to the pathogenesis of metabolic diseases include disruption of gut microbiota, known as gut dysbiosis. The causes of the gut dysbiosis are mentioned in the picture below. So, as the father of modern medicine, Hippocrates says all diseases begin in the gut. Similarly, our acharyas have a long back told Sarve Rogapi Mandagnu. So the causes responsible for gut dysbiosis are similar to the causes mentioned in Agni Dushti and Ama Utpatti, which in long term may be leading to metabolic disorders. Here are aims and objectives and materials and methods. Coming to the etiopathogenesis of metabolic disorders involving gut dysbiosis, external and dietary factors, high fat, low fiber diet, stress, sedentary lifestyle, circadian rhythm disruption leads to altered gut, that is dysbiosis, that is decrease in beneficial commensals and increase in pathogenic taxa, leads to altered microbial metabolite profile, that is increase in lipopolysaccharides production due to pathogenic taxa and decrease in short chain fatty acid production, butyrate and propionate, leading to tight junction protein expression reduction, leading to intestinal barrier dysfunction, that is leaky gut. Increase in intestinal permeability causes translocation of LPS or endotoxins into bloodstream, leading to metabolic inflammation, activation of TL4 inflammatory factor kappa B pathway, leading to generation of pro-inflammatory cytokinins, systemic low-grade inflammation, metabolic endotoxemia, and further metabolic disorders depending upon the tissue affected. So, for example, in case of pancreas, chronic inflammation and oxidative stress causes beta cell dysfunction, leading to diabetes mellitus, and other two are mentioned here. Coming to the samprapti of metabolic disorders in Ayurveda, Chirakala Atipramana Ativela Nidana Sevana, including Viruddhahara, Atyambupana, Swapna Vipareya, Bhayakrodadi, leads to Dosha Prakopa and Agni Dushti. So here Agni Dushti hampers the production of Parama Sukshma, that is molecular part of Ahara Bhaga, which is responsible for Sharira Tarpana and Dhatu Poshana. So this is a reference taken from Sushruta Sutrasthana 14th chapter 3rd shloka, where rasa formation is explained. So this leads to Ama Utpatti. In Chirakala, it further causes increase in Dosha Prakopa, Jataragni, Dhatvagni, Mandya, Kapha Avarana, Ama Sanchaya in Dhatu increases, causing Sroto Avarodha and affecting the Dhatu Karma. So next here, an important concept, that is Vikara Vigata Bhava Bhava Prativishesha, which is taken from Charaka Nidana Prameha Nidana Adhyaya, plays an important role. So in the presence of Vikara Vigatakara Bhava, which also in which Agni also plays an important role, there will be no Rogotpati, and in the absence of Vikara Vigatakara Bhava, there will be Rogotpati, leading to Rasadi Dhatu Pradoshaja Vikaras, which I consider here as metabolic disorders. Coming to the results, the functions of gut microbiota mimics the functions of Agni, that is Ayu, Varna, Balam, Swastham, Utsaha, Upachaya, Bala.
That so the dysbiosis and Agni Dushti may be leading to metabolic disorders. Next, coming to discussion, metabolic disorders as a whole can be correlated to ama, avaranajanya vikaras, dhatu pradoshaja vikaras, and santarpanajanya vikaras. Here I will be comparing with the etiopathogenesis of metabolic disorders involving gut dysbiosis in contemporary and Ayurvedic perspective. Gut dysbiosis causes the decrease in short chain fatty acid production, which is correlated to Agni Mandya. So, in taking an example of Staulya Samprapti, there is a word mentioning Atikangshata. So Atikangshata is that is decreased satiety, that is increased hunger. So when comparing the contemporary, decreased short chain fatty acids is responsible for appetite regulation and satiety through gut-brain axis. So decrease in gut dysbiosis causes decrease in short chain fatty acids, causing decreased satiety, further leading to justification of this. Accumulation of metabolic intermediates, lipotoxicity, AG buildup, endotoxemia can be correlated to ama formation. Leaky gut microchannel blockage can be correlated to Sotaroda and Rasadhatu Dushti. Adipocyte hypertrophy, hepatic steatosis, etc. can be correlated to Dosha-Dushya Samurchana. And Vikara Vigatakara Bhava and Amajanya Shodha can be correlated to immunometabolic dysfunction and chronic inflammation. Coming to Chikitsa, firstly Nidana Parivarjana, then followed by Deepana Pachana, which reduces the lipopolysaccharide secretion, improves mitochondrial function. Next, coming to Shodhana, depending of the vector of the Vyadhi. Here, the Falashruti says Kaya Agni Rabhivardhan, that is resets gut microbiota. A study was conducted in obese patients, that Virechana was conducted, which showed the Virechana removed the colonization of the pathogenic organisms in the colon. Next, Vyadescha Upashamyanti reduces endotoxins, improves gut barrier function. Prakritishchana Vartate enhances metabolic pathway, reduces systemic inflammation, resets neuroendocrine balance. Next, coming after Shodhana, Rasayana is mentioned, that is which is taken from Vartarakta Chikitsa Adhyaya of Vagbata, that's Guggulu, Shilajatu, Lashana, and Triphala, which act as prebiotics. Prebiotic effect of Lashuna on gut microbiome has been done. A study has been done, which showed it increases the lactobacillus, which is reduced priorly. This all leads to increase in mitochondrial biogenesis, a decrease in oxidative stress, increase in ATP synthesis, and increase in antioxidant enzymes. Here, I would like to conclude with the future scope of the study and with the reference of Charaka Chikitsa 15 chapter, Shante Agno Mriyate Yukte Chiram Jivatyanamayaha, Rogi Syad Vikrite Moolam, Agnis Tasma Niruchyate. Here are the references. Thank you.
Dr. Sharada, nice presentation.
Thank you, sir.
You had told that Deepana Pachana, Shodhana, and respective probable mechanisms you told.
Yes, sir.
So it is your hypothesis, or you were able to find some correlation studies
Yes,
wherein
sir.
Shodhana has been seen for these to reduce LPS.
No, sir. In case of Shodhana, a study was that Virechana study was conducted over microbiome in obese patients, where it showed that it resets the gut microbiota. That is, it is removing the
So gut
colonization.
microbiome studies were done in it.
Yes, sir. It is published in PubMed, PubMed, then IU journal, sir.
So basically, what you have to do is that in bracket you have to cite the author and year of study. That will help us. Regarding on LPS and other things.
That was hypothetical, sir.
Hypothetically, yeah. Good. And you have mentioned that Lashuna is a probiotic. Is there
Yes,
any?
That is also a study was done. That is prebiotic activity of Lashuna extract over lactobacillus. So the extract showed increase in lactobacillus in patients were prone to chronic antibiotic use.
Thank you.
Okay.
We'll move to the next presentation, sir.
Yes, madam.
Presentation number 58, Dr. Darshan Hiremath.
Yes, ma'am.
Please share your screen. Dr. Darshan, please share your screen.
Yes, ma'am. Now it's visible.
Your screen is not visible, Dr. Darshan. Please share it. Now.
Yes, sir. Sir, now it's visible.
Yeah, screen is visible. Yeah.
Yes. So, good afternoon, everyone. Myself, Dr. Darshan Harimat, final year PG scholar from the Department of Rog Nidana and Vikriti Vijnana, from the Department of Kayar Shri BMK Ayurved Mahavidyalaya, Shapur, Belagavi. My presentation topic is about Agni, the core metabolic balance, and understanding its pathological dimension with reference to metabolic disease. So, purpose, metabolic syndrome is becoming more prevalent in recent years. Metabolic syndrome is a risk factor for many serious conditions like CVD, DM, and kidney diseases, and it also reduces quality of the life, and it's a economical and social burden. Hence, to explore the involvement of Agni in metabolic disorder, this presentation has been taken. First, we'll move to the importance of Agni. The Ayurvarna Bala Swastha Upachayo Prabaha Ojas Tojo Agneha Pranashoktam Dehagni Hetukaha. First, we'll importance of Agni is to maintain the normal function of the Ayu, Bala, Varna, Swastha, Utsaha, and Upachaya Prabha, and it also maintains the normal function of immunity. So, how metabolism occurs through the help of Agni? In the Grani Chikitsa Adhyaya, he mentioned about the Rasa Raktam, Tato Mamsam, Mamsam Meda, Tato Asticha, Astinam Majjam, Tata Shukram, Shukrat Garbam Prasadaja. It means the proper, to maintain the metabolic, normal metabolism, proper Agni is needed. From them, Rasa is getting nourished. Subsequently, Rasa Mamsa Dhatu is nourished properly. So, as we all know, there are 13 types of Agni. They are Bhutagni, Dhattvagni, Bhutagni, and Jataragni. From the normal nourishment of the Dhattvagni, it can again it is divided into Sarabhaga and Kittabhaga, whereas Sarabhaga is nourishes the Dhatus, and whereas Kittabhaga nourishes the Upadhatus. So, Agni Drishta Nidanas are like Vishamashana, Krodha, Bhaya, Shokadi, Vega Sandarnath, Atyampapana, and Swapna Viparaya. Now we'll correlate as Agni and metabolism. So in like gut hormones and gut enzymes in the core, like they in cellular level, they can be considered as the Agni in Ayurveda. The Agni is the which is responsible for the Pachana of Ahara, Dhatu Parinama, and which is responsible for the maintenance of Ayu, Varna, Bala, Swastha and Utsaha Upachayadi. Whereas the in metabolism can be defined as a total biochemical reactions that takes place in the body to produce the energy in which is needed for the growth and functions. This can be considered as a cellular level that like gut enzymes and gut hormones can be considered in the correlated as Agni in Ayurveda. As I told you, Agni is the again divided into Sara and Kittabhaga, whereas Sarabhaga nourishes the Bhutagni and Kittabhaga nourishes the Upadhatus. Next is metabolic syndrome. As per the WHO, metabolic syndrome is an asymptomatic pathophysiological condition characterized by the central obesity, high blood pressure, insulin resistance, dyslipidemia, and also hyperglycemia. The pathophysiology is overeating, sedentary lifestyle causes visual adiposity, and also free fatty acids leads to the increase in triglyceride and gluconeogenesis, and leads to the insulin resistance, and also causes the increase in angiotensin type 2 receptor, causing a central obesity, high blood pressure, insulin resistance, and also dyslipidemia, causing metabolic syndrome. In Ayurveda, Atyashana, Atimatra, Guru, Madhuradi Ahara Sevana, and also Divasapna can lead to the Medava Shrotadrushti and causing the Prameha and Sthaule. In in Ayurveda, it has been said that Sarva Rogopi Mandagni, that is causing the Ama Utpatti, that is causing the Shrotadrushti, causing the Medava Shrotadrushti, causing the metabolic disorders. So Dushta Agni Lakshanas are Trishno Alasya Balakshaha, Vidaho Annasya Pakasha, Chirat Asya Gauram. It can be correlated the cardinal symptoms of metabolic disorder. They are disturbed glucose and insulin metabolism, overweight, abdominal fat, central obesity, and also disturbed lipid metabolism, then that is causing the Chirat Pakase Gauram, like it delayed digestion and also absorption. And also with the hypertension, that is raised blood pressure. Next is discussion. Metabolic syndrome is a Santarpanokta Vikara, and it is also a collection of diseases Nidanas, and it can be considered as Vadi Sankarana. Welcome to the treatment part. First, we should mainly correction of the Agni is needed, and then the Amapachana, and then it is Apatarpana and Shodhana based on the condition of the Roga and Rogi. And also assessment of the status of the Roga and Rogi Bala, then planning the treatment will be lead into the fruitful result. Thank you, sir. Thank you, one and all.
Sir, Dr. Gopal Singh, sir.
Yes, sir. No comments.
We can move to the next thing, sir.
Can we go for next?
Next presentation number 59, Dr. Spandana.
Yes, ma'am.
Please share your screen.
Are my slides visible, ma'am?
Visible, full screen, please.
Yes, ma'am. Good afternoon. I'm Dr. Spandana, second year PG scholar from the Department of PG Studies in Raviguna, JSS Ayurveda Medical College, Mysuru. The topic of my presentation is Integrative Hepatometabolic Care, Ayurvedic Insights in Non-Alcoholic Fatty Liver Disease. What we once saw as a fatty liver is now recognized as the driver of the metabolic cures, cancer risk, transplantation burden. So let us see and explore how Ayurveda has a comprehensive framework in order to understand and manage this expanding clinical concern. Non-alcoholic fatty liver disease, which includes a spectrum of liver diseases that ranges from steatosis to the non-alcoholic steatohepatitis, which might progress to cirrhosis and then liver CA. NAFLD is considered as the hepatic manifestation of the metabolic syndrome as it is associated with the diabetes, hypertension, dyslipidemia, obesity, etc. Looking into the prevalence of NAFLD, it is considered to be more than 97% in the obese patients, more than 67% in the overweight patients, and more than 25% in the normal weight patients. Understanding this, because of obesity and insulin resistance, there will be increased in the hepatic free fatty acids, which causes an imbalance between the rate of synthesis and the rate of catabolism, because of which the hepatocytes will store the potentially toxic lipids, causing the cell death, inflammation, which then leads to fibrosis and cirrhosis of the liver. So why is it called a silent epidemic? Because it is frequently asymptomatic in nature. Although it might be associated with fatigue and discomfort in the upper quadrant, most of the patients recognize this only in the complication stages. Now, coming to the contemporary therapies, there is no pharmacological agents which is currently being licensed specifically for the NASH therapy. So the treatment is only directed towards treating the coexisting metabolic conditions, as I've told, obesity, dyslipidemia, hypertension, etc. And also there is a prompt screening and treatment of the cardiovascular risk. In Ayurveda, the liver disorders and its management have been extensively addressed in the classical texts. Like Acharya Sushruta have mentioned the word Ikrit Dalyudara for the Ikrit Vritti, and Acharya Charaka have mentioned it under the Santarpanajanya Vyadhis. Coming into its Samprapti, because of the Nidana and Nidanarthakara Rogas and Sruto Dushti, there will be Agni Vikriti, Apakva Annarasa, which causes Kapha Medo Dushti. That is, over accumulation of the Dushta Medas in the Ikrit, which we medically term as the fatty liver. And then the Pitta Vikriti happens, that is, the inflammatory alterations occurs in the hepatocytes. And when the Vata enters into the picture, there will be cirrhosis and CA. So the symptoms which we see here is primarily the Ajirna, Sthaulya, and Amlapitta Lakshanas. When there is systemic manifestation of this disease, we see the Lakshanas of Pandu, Kamala, Raktapitta. And when it is fully fledged, it leads to one of the Ashtamhagada, that is Ekritvadara. When we see into the Chikitsa of it, Ayurveda has an immense potential in management of these liver diseases. That is, the first line of treatment is Agnidipana, Rukshana, Sruto Shodhana. In the later stages, addressing the Rasa and Raktavaha Sruto Dushtis, Ekrit Shodhara Chikitsa, which is mainly done by Samshodhana, Samshamana, Virechana, and also Agnidipana Chunas like Hapushadi, Narayana, Avipattikara, and Gritas and Tailas like Trivrita Valeha, Mishraka Snehas, Patola Katurohinyadi Kashaya, Trakshadi, Falatrikadi Kashayas, Sudarshana Arishtas, Pipali Asava, etc. And in the later stages, while we control the cholesterol levels, Vamana is advised. These are some of the single formulations which can be used in the hepatic manifestations like Kalamega, Bringaraja, Chitraka, Sharapunka, etc. Looking into the mode of action of some of these drugs, the Kalamega andrographolide is one of the important phytoconstituent present in this, which helps in reducing the inflammation by inhibiting the production of pro-inflammatory cytokines, that is TNF-alpha, interleukin, and cyclooxygenase, and also suppressing the NF-kappa B signaling pathway, which helps in controlling the chronic inflammation. It also acts as antioxidant by enhancing the endogenous antioxidant enzymes such as superoxide dismutase, catalase, and it stabilizes the cell membrane, which helps in regeneration of the damaged liver tissues. Coming to the next drug, that is Bhumi Amalaki, it is also having a similar anti-inflammatory and cytokine modulation. The interleukin 10 production by this herb helps in inflammatory balance in the hepatocytes, and also it has got an anti-steatotic and anti-fibrotic effect, that is by it reduces the hepatic triglyceride accumulation by AMPK and other pathways. Then the enzyme antioxidant enhancement is by enhancing the endogenous antioxidants and replenishing the glutathione, which has been depleted due to hepatotoxicity, and lipid peroxidation inhibition. Coming to the next drug, Katukin. The Katukin, which is the phytoconstituent present in this, acts as a hepatoprotective by suppression of the xanthine oxidase inhibitors, metal ion chelators, oxygen anion generation, free radical scavenging, anti-lipid peroxidation activity. So coming to the conclusion, Bahukalpam Bahugunam Sampannam Yogyam Aushadam. Because of the alteration in the human environment interaction, there is a metabolic syndrome which requires a multidisciplinary approach. As there is no single drug which is clearly known to be effective in this disease, Ayurveda always affords a treasure of thousands of formulations which is curated by the scholars after the clinical researchers. So an improved knowledge about the pathophysiological links between the NAFLD and its extrahepatic complications will not only help us to develop the new pharmacological treatments, but also help us to decrease the global burden of this very common non-communicable disease. These are my references. I thank organizers for giving me this opportunity. Thank you.
Dr. Spandana, in one slide, you are claiming something like Vamana reducing total cholesterol, like some, in one slide
there
it was there. What is that?
This one, sir.
Here, Vamana.
Yeah. In the Samshodhana, after the Virechana, Vamana, it is also induced in reducing the cholesterol levels and improving the liver function.
That's Vamana reducing total cholesterol levels. Where is the evidence? Triglycerides improving the liver function.
I've taken this from this
No,
particular
these are fine. But what about that Vamana? Vamana, the slide is there, no? In that, it is claimed like this, no? So, Samshodhanam, Samshamana, Ahara, Vihara. Virechana in hepatic manifestations of disease.
Yes, sir.
That's okay. Sroto Shodhana and Agni Deepana, Churna, Gruta, Taila, Avaleha, Vamana. Reducing total cholesterol levels. This pertains to only Vamana or overall, like?
Overall, sir, overall, including overall treatment which have been mentioned here, which comes under Samshodhana, Samshamana, Ahara, and Vihara.
It is a claim or just hypothesis?
It is an hypothesis, sir.
That's right. Before claiming, no, we should have some evidence. And in modern science, they use this ursodeoxycholic acid. What is your opinion? Like a single drug only is sufficient to manage that condition. They claim like that for fatty liver.
Yes, sir. They also use vitamin E and pioglitazone. Some of the papers say that because of the excessive use of this vitamin E, that is more than 800. Yes, sir. there are more than usage of 800 international units per day of this vitamin E. It has given a promising result in decreasing this fatty liver, sir. But again, it has caused all-cause metabolism morbidity, and also it has caused the risk of prostate cancer. In some papers, it have been established like that. The usage of single treatment in NAFLD.
Other Shamano studies and all fine, no issue. But cleansing with Shodhana therapy and all, we should be little bit careful. Like how the mode of action can be explained. Okay.
Okay, sir.
Dr. Pandana, nice presentation.
Thank
In
you, sir.
most of non-alcoholic steatohepatitis cases, the liver functions will be normal. And in your study, you're mainly advising hepatoprotective drugs like Katukibon, Nimba. So
Yes,
in this present condition, do you need hepatoprotective drugs or something drugs which are Lekania in nature, which basically act on mesovastosis?
Both, sir. It would be followed by hepatoprotective drugs, followed by Meduhara drugs would be beneficial.
Oh,
As the
initially
disease
first
advances,
hepatoprotective, or initially it is the drugs which and the procedures which act on mesovastosis?
initially it would be hepatoprotective, followed by the
Why?
Lecania drugs.
Because LFT will be completely normal. In very rare cases, HGOT and
Yes, sir.
HGPT will be slightly elevated. So why do you want to give hepatoprotective drugs? What is the logic or
Uh,
rationale behind it?
Because before it is fully fledged, we see that it is only the fatigue or the Amla Pitta kind of the lakshanas, which the patients would obviously avoid it in the beginning. So they would not,
So
it
if
is
you give
only
Katekin
accidentally.
Amla Pitta, if you give Katekin Amla Pitta, so Amla Pitta will respond.
Amla Pitta will not respond to catechies.
And you
We need
have
to address a
given many
polyherbal formulation.
pathways. Yeah, and you have given many pathways for these drugs.
Yes, sir.
So were you able to find some studies for supporting these pathways?
Yes, sir. Some of the animal studies have been found, sir, which supports these AMPK pathways and all. But the clinical trials have not been done with respect to these pathways, which would explain these pathways. And
Good. Thank you.
thank you, sir.
Thank you, Dr. Spandana. We move to the next presentation, presentation number 60, Dr. Ambika. Please unmute yourself, Dr. Ambika, and share your screen.
Yes, ma'am, audible, ma'am.
Yeah, you're audible. Please share your screen.
Is the screen is visible, ma'am?
Yes, you can start.
Good afternoon, everyone. Myself, Dr. Ambika. Ma'am, is the screen visible?
Share. You can continue. It's
Good
visible.
afternoon, everyone. Myself, Dr. Ambika, final year PG scholars, Department of PG Studies in Rasashastra and Vaisheshya Kalpana, TGMC Ballari. Today, I am going to present on the topic therapeutic potentials of classical Rasaushadis in the management of metabolic disorders. Introduction: metabolic diseases like diabetes, obesity, dyslipidemia are rising faster than ever, especially among the younger population because of modern lifestyle. Ayurveda with its
Dr.
deep
Ambika,
understanding.
where slide is not moving.
Okay, sir. Now, sir.
Yes. Now it is moving.
Introduction. So Ayurveda with its deep understanding of the metabolic balances offer a very different lens to look at these disorders. It interprets the rising burden through concepts related to digestion, energy regulation, and tissue metabolism. Today, I will highlight how rasa formulations are potential tools in managing these metabolic disorders. Coming to Rasaushadis, as quoted in Rasaratna Samushaya, Rasaushadis are considered superior because they act in very small doses, quicker, and delivers the quick results. Metabolic disorders, these are the cluster of risk presented with central obesity, dyslipidemia, low HDL, high LDL, high blood sugar, insulin resistance, and elevated blood pressure. That together increases the cardiovascular
cardiovascular risk. Coming to the pathogenesis, ahara vihara and manasika nidanas, agnimadhya lead to ama formation and subsequently kapha and meda dushti. This results in strotorodha and further madhya, predominantly affecting the rasa, meda, mamsa and rakta dhatu. The combined pattern of sanga and atipravritti ultimate culminates in various metabolic disorders. Next, this is the list of some important rasaushadis, especially bhasmas, and their specified karma, which counteract the metabolic pathology. Swarna bhasma, with its deepana, rudya, balya, vishakara, and chinta, krodhajanya, roganashana properties, addresses not only dietary and lifestyle factors, but also psychological drivers of the metabolic imbalance. Additionally, bhasmas with Medohara, Lekhana, Pramehara, and Nadi Balyakara action effectively breaks the samprapti, making them uniquely suited for managing the diabetes disorders. These are few examples of the formulations that contain these bhasmas as the key ingredients used in day-to-day practices. Next, let me brief some how bhasmas work in metabolic disorders with few examples. Firstly, bhasmas act as micronutrient and enzyme cofactor sources. Zinc, copper, iron in bhasma supply essential trace elements that reduces nuclear factor kappa B inflammation, boost antioxidant defenses, and support mitochondrial energy, insulin secretion, and lipid metabolism. Secondly, they strengthen the insulin signaling. Yashada, Abraka, Vanga, and Swarna Bhasma activates AMPK pathway, increases GLUT4 mediated glucose uptake. This way, other important mechanisms such as reduce adipogenesis and enhance the lipolysis, gut liver metabolism, and endothelial microcirculatory improvements, along with the nano-bioavailability advantages of the bhasma and other rasa formulation, make them highly relevant for treating these metabolic disorders. Along with their benefits, it's important to highlight few practical and safety considerations, such as purity and preparation of these formulation and existing evidence gap, keeping these bhasmas. Coming to discussion, metabolic diseases arises from insulin resistance, inflammation, oxidative stress, and so on. What makes these rasaushadis particularly relevant is multi-targeted action at very small dose. They help reduce the inflammation, improve the antioxidant activity, they activate the AMPK pathway, and several other mechanisms involved in the pathogenesis of the metabolic disorders. In conclusion, rasaushadis addresses metabolic dysfunctions from classical Ayurvedic principles and modern biochemical mechanisms. When these combines with diet, lifestyle, and panchakarma, they provide a safe and integrative approach for managing today's metabolic disorders. Thank you. I would like to thank for the opportunity to the coordinate our principals and HOD sir. And these are the references I put it in this paper. Thank you.
Yes, good presentation, Dr. Ambika. You just show those
Thank you, sir.
bhasmas, their mode of action.
Sorry, sir.
Various bhasmas, no? Tambra bhasma, Vanga bhasma,
Yes,
Naga
sir.
bhasma, and all. Their karmukata you were presenting, no? The slide is there.
Yes, sir. Yes, sir.
Slide is not visible.
It stopped presenting, sir. I'll put it on one more time.
What all
Is
you
it
have
visible now, sir?
presented, no? Yes, yes, yes. That various bhasmas.
Yes, sir.
The slide was there, no? Here.
Yes, sir. This
This one only. So there are so many claims actually. See, for example, Loha Bhasma improves cellular metabolism. Are there just hypotheses or any work have been done? Any evidence?
So
Jalodhara
regarding,
Loha Bhasma.
yes, sir. So I have
How?
quoted the classical references here, sir. I've quoted the
Any
classical
such
references here.
any of these Bhasmas, any work have been done? For example,
Sir, yes, sir.
Tamra Bhasma is there. How it might
Yes, sir.
have helped in Jalodhara?
For particular Jalodhara, it's not there, sir, but correcting metabolism, it will help. So this is the hypothesis for Jalodhara. As per metabolism, sir, there are evidences that trace elements will help in the correcting
But
metabolism.
in the last slide, you have shown some general principles of these Rasaushadis, no? Like how they might
Yes,
have
sir.
worked.
Yes, sir.
So, but as such, like any particular Bhasma work has not been done.
Sir, for that, there are work present as anti-inflammatory and immunomodulatory actions of these Bhasmas, but in particular, these mechanisms are not addressed in those works, sir.
So that part we'll have to work on that. Okay.
Yes, sir. Like more evidences have to be collected
Yes,
in this part, sir.
Then much more it will be scientific.
Yes, sir. Definitely, sir.
Okay.
Thank you, sir.
Shall we move to the next presentation?
Yes, ma'am.
Number 61, Dr. Gopinath M.
Is my slide visible, madam?
Yes, you can
Hello.
make screen. Please make the page full screen.
Yeah. Is it visible now?
Slide is visible, but it is not full screen.
Now, ma'am?
No.
Is it visible now, ma'am?
Slide is visible. You have to, make it full screen. Click there, yes.
Yeah. It's done, I think.
I think you can present it this way. It is not yet full screen.
The easy slide
Gopinath,
itself.
please go ahead. Go ahead.
Yeah, sir. Thank you. This is Dr. Gopinath M. Patgar, second year PG scholar from the Department of Rashastra and Biosurgical Kalpana from the KLE BMK Ayurveda Mahavidyalaya. Today I'm presenting on the topic Integrated Strategies for Weight Management, Harmonizing Ayurvedic Metabolic Corrections with Modern Prebiotic Science, under the guidance of Dr. P.G. Darder, sir. So basically, first we want to know. Hello.
Please mute your mics.
Dr. Sukanya, please mute yourself.
Yes, first we want to look into what is gut metabolism axis. So there are in gut microbiota comprises of trillions of microorganisms that plays a fundamental role in energy metabolism, immune functions, and metabolic hemostasis. Obesity is characterized by the distinctive shift in the microbial composition, particularly the firmicutes to the bacteriocytes ratio, which influences the energy harvest efficiency of the dietary components. The gut microbiota induces the intestinal permeability through the suppression of enthalmine metabolizing bacteria, which leading to the accumulation of enthalmine that down regulates the tight junction protein expression, thereby elevating the gut permeability, the systemic inflammation. This leaky gut phenomena allows the bacterial lipopolysaccharide LPS to translocate into the circulation, triggering the low-grade chronic inflammation characteristics for the metabolic syndrome. So coming to the next one, like short chain fatty acid, the molecular mediator for this all metabolic health. The prebiotic is a digestible dietary fiber, are fermented by the beneficial gut bacteria, primarily by the Bifidobacterium and lactobacillus to produce the short chain fatty acids like acetate, propionate, and butyrate in appropriate molar ratio of a 60-20-20. These SCFAs functions as a signaling molecule through the multiple mechanisms like receptor mediated signaling, where it activates the G protein coupled receptors and expressed in the adipose tissue, colon, and other metabolic organs. Activation of the adipose enhances the insulin sensitivity and promotes the lipid oxidation and protects against the diet-induced obesity. And another next one is the metabolic pathway modulation, where these activates the AMPK, shifting metabolism from lipogenesis to the fat acid oxidation in both liver and adipose tissue. And next, coming to the satiety hormone regulation, where it stimulates the endocrine L cells in the distal intestines to secrete the glucagon-like peptide promotes the satiety, delayed gastric emptying, and reduced food intake. The prebiotic supplements increases the plasma GLP-1 and correlating with the enhancing satiety and reduced hunger in humans. And next, coming to the one more mechanism like energy expenditure enhancement, where the supplementation promotes the browning of white adipose tissue by upregulating the BG that adipocytes makers and gene involvement in the mitochondrial biogenesis. This enhances the thermogenesis and energy expenditure independent of the food intake alteration. Now, coming to the Ayurvedic point of view, in Ayurveda, Staulya arises from the vitiation of Kapha dosha and derangement in the Medodhatu, which leads to the Agnimandya, which leads to like impaired Jataragni fails to properly metabolize the food, producing Ama. Ama clogs that is Rodoroda, that is further leading to the Medo Vruddhi, and thus obstructed channels preventing Shrotoroda, like obstructing channels prevent the nutrient delivery to the subsequent dhatus like Asti, Majja, Shukra, leading to the systemic imbalance. This vitiate, upon vitiated Vyanavayu, propels excess of this excess Meda to the character sites like Udara, Spik, and Sthana. This Ayurvedic framework, correlating to the modern, Ama corresponds to the metabolic endotoxins like LPS and inflammatory mediators. Shrotoroda reflects the impairment in the microvascular perfusion and insulin resistance. Agnimandya represents the compromised enzymatic and metabolic capacities. Likewise. So coming to the Ayurvedic therapeutic principles, here Deepana, Pachana, Medohara can be taken here. Like Deepana, it kindles the Agni, Pachana digests the Ama, Medohara reduces the Medas, and in modern point of view, that stimulates the enzyme gut mobility, detoxifies, lower inflammation, promotes the lipid oxidation and insulin sensitization, kind of. And coming to the key nutraceutical drugs, what we can see in Ayurvedic which acts as a prebiotic is Triphala, Guggulu, Trikatu, Guduchi. Like Triphala has a polyphenol-rich prebiotic, reducing adipogenesis, increasing SCFA synthesis. Guggulu enhances AMPK, lower LDLC, reduces inflammation. Trikatu improves Agni, and it has a bioavailability constant. And Guduchi, immunomodulatory, lipolytic, and appetite suppressant actions. In my coming to the convergence from this Ayurveda point of view and the prebiotic science, we see that gut barrier repair. There we can see in Ayurveda Pachana, Shrota, Shuddhi, lipid metabolism like Deepana, Medohara, appetite regulation like Shuddha, Nigraha via Agni control, inflammation control like Amapachana, Shrotagna Karma. can be seen here. And coming to the clinical evidence for integration, the weight loss studies like in meta-analysis demonstrates oral Triphala administration produces statistically significant lower in the body weight reduction with the good tolerability. Combined Ayurvedic formulation incorporating the Medohara principle shows improvement in the BMI, waist-hip ratio, lipid profile, and inflammatory biomarkers. And microbiota modulations, Ayurveda herbs with prebiotic activities induce favorable shift in the gut bacterial composition, increasing the SCFAs producing genera, while reducing the pathogenic species. These changes correlates with the improved metabolic parameters and reduced systemic inflammation. The symbiotic approaches combining the prebiotic with the Ayurvedic formulations enhances the therapeutic outcomes through addictive effects on the gut microbiota modulation, metabolic hormone profile, and weight reduction. So, integrating the therapeutic strategies in future directions are like metabolic assessment and dosha evaluation. In the modern point of view, assessing the BMI, waist circumference, like lipid profile, fasting glucose, insulin sensitivity, inflammatory markers. In Ayurvedic prospect, we should look into the evaluating the Prakriti, Vikriti, and Agni status, ama presence, and dosha predominance in the patient. And the dietary interventions like prebiotic foods like incorporation of inulin, oligo, fructose, like resistant starch from in the point of view of prebiotic point of view in the modern point. But in the case of Ayurvedic Patya, we can use lagu, ruksha, aharas, which are guru snigdha, which are light to the patient, can be taken here. And fermented foods including traditional preparations like buttermilk and fermented rice can support act as a probiotic here. And pharmaceutical supplements taking the Triphala acts as a Deepana Pachana, and Trikatu and all acts as a bioavailability increasing Agni Deepana and Agni Deepana. Evening Gugulu taking as a Medohara lipid modulation can be taken here. And lifestyle modifications like regular physical activities, enhancing Vata Kapha balance, sleep adequate duration maintenance, circadian rhythm, stress management, and monitoring and adjustments, all this can be incorporated and can be given to the patient integrated approach. For the future prospect, the molecular correlations like AMPK, PPARY, and TGRS, 5 signaling mapping should be done, and personalized regimes like Prakriti microbiome profiling should be in working on it, and RCTs on long-term efficacy and safety, standardization of a phytochemical fingerprinting, SAFAs, assay, dosage guidelines should be worked on that. And the take-home message is gut and metabolisms are a dual gateway of obesity regulations. Ayurveda and prebiotics provides complementary mechanisms like microbial modulation, inflammation control, Agni optimization, lipid metabolism rebalancing, integrative approaches like sustainable individualized metabolic health. So these are my references of the articles and websites I have gone through, and the concept here I'm presenting only the concept. This is hypothetical only. There are some meta-analysis of Triphala also there have mentioned there. Thank you.
Okay, Dr. Gopinath. Fine.
Shall we move to the
next?
Yes. Class presentation, presentation number 62, Dr. Ashwini Deshmukh.
Yes, ma'am.
Dr. Gopinath, please unshare your slides. Dr. Ashwini, you can share.
Yeah. Is my slides visible, ma'am?
Yes, it is visible. No, not yet visible. Yes. Make it full screen.
Now, ma'am?
No, not yet.
Dr. Ashwini, you can present.
Present, yes.
Okay, ma'am. So good afternoon, everyone. Today I'm presenting the role of Kala Bhojana in the prevention of metabolic disorders, an Ayurvedic perspective, and presented by Dr. Santosh Pedvadi sir. Professor and HOD, Department of Kaya Chikitsa, DGM Ayurvedic Medical College, Gadag. Coming to the introduction, metabolic disorders such as obesity, type 2 diabetes mellitus, dyslipidemia have become a global health concern associated with lifestyle irregularities and disrupted eating patterns. These diseases affect how the body converts food into energy and building blocks for the cells. These disturbances may involve abnormalities in the metabolism of carbohydrates, fats, protein, and nucleic acid, often due to enzyme deficiencies and hormonal imbalance or dysfunction in metabolic pathways. Irregular food timings and midnight eating and skipping meals lead to the Agni Mandya, ama formation, and forming the root cause for the metabolic derangements. Aligning dietary habits with the Dinacharya and Kala Bhojana, which is the Agya Sangraha that has been explained in the Charaka Samhita, which is good for the health, and Vidhi supports the physiological rhythms and prevent the metabolic dysfunction. Coming to the pathogenesis, so high caloric intake will leading into the visceral adiposity, that is accumulation of the visceral fat. Visceral adipose tissue produces the inflammatory cytokines and adipokines, which are initiating the chronic low-grade inflammatory state. These cytokines impair the insulin signaling pathway and causing the insulin resistance in the skeletal muscle, liver, and adipose tissue. Insulin resistance causes the hyperinsulinemia, and initially, but in the further stages, pancreatic beta cells eventually fails to leading into the decreased insulin secretion, increase free fatty acids from the adipose tissue, worsening the insulin resistance and promote the gluconeogenesis and lipogenesis in the liver. And this is further leading into the neurohormonal activity, including renin angiotensin system, contribute to the hypertension and further metabolic dysregulation. Chronic inflammation leads to the endothelial dysfunction, atherogenesis, and increased risk of cardiovascular diseases. And this further leading into the metabolic inflammatory symptoms like metabolic syndromes and central obesity, hypertension, dyslipidemia, glucose intolerance, progressing into the type 2 diabetes mellitus and cardiovascular disorders. And metabolic syndrome mainly including the central adiposity, hypertension, raised triglycerides, and low HDL, fasting hyperglycemia. And metabolic disorders in Ayurveda. Understanding of metabolic disorders in Ayurveda, the Acharyas have mentioned Santarpana and Apatarmana Janya Vyadhis. Metabolic syndrome is the result of improper metabolism. In Ayurveda, metabolism is considered as a prime function of the Agni. Various causes of metabolic syndromes like sedentary lifestyle, Kala Bhojana, mainly Ajirnashana and Adhyasana, and lack of exercise, etc., mainly vitiates the Agni. It presumes that improper dietary habits and deranged function of different sets of Agni gives rise to the formation of Ama. When this preformed Ama interacts with the Medha Dhatu, it alters the nature of the adipose tissue, including lipids. This form of Ama, when circulate all over the body, leads to the blockades of the micro channels, that is Throto Sangha will be happening, and precipitate antigenic reactions, and finally generate a series of inflammatory events in the body. The interaction of Ama with the fat tissues is known as Sama Medha Dhatu, which is the main cause for the Medha Roga, and it leads to the variety of metabolic disorders. And here we all know that Ahara, Brahmacharya, and Nitra are the Trayopastamba. In Ashtanga Sangraha Sutrasthana, they have mentioned that Kalastu Ritu Vyadhi Ritu Vyada Yoksho Jirna Ajirna Lakshanam. And while explaining the Ahara Kala, Acharya Vagbata has mentioned Kala is the Ritu, Vyadhi, and Jirna Lakshana. In Sushruta Samhita, we can see that according to Ritu, Ekakala Bhojana has been mentioned. That is in Hemant and Shishira Ritu, Prataha Kala should be taken, and Grishma Pravrit, Aparanna, and Sharad Varsha Ritu, Madhyana should be taken for the Ahara. And according to Vyadhi state, Dvikala Bhojana, that is first Bhojana should be taken in the time of 9:45 to 10:30, and second Bhojana should be in the 4:30 p.m. And it can be compared to the Agnihotra Karma according to Sushruta. And according to Bhavaprakasha, Trikala Bhojana, time gap between the two meals should be not less than the 1 yama or not more than the 2 yama. And Kalabhojana, according to Jirna Ajirna Lakshana, some of the Jirna Lakshanas has been mentioned by Vakpata in Ashtangarudaya. After the elimination of the feces and urine, and mind should be pleasant in pleasant avastha and adosha in the natural pathway. When the hunger is manifested and flatus moves down and sense organs are clear, body is light. In such a condition, the person has to take the food. And according to Sushruta Samhita, when the stools or urine should have been voided properly, and when the senses are clear, that is in the presence of pleasantness of the mind, and the presence of lightness of the body, and presence of clear belching, and clarity of and lightness in the region of the heart and heart being devoid of blemishes, and proper movement of the vayu and vata being in the normal sthana, and presence of interest for the taking food, and in the presence of hunger, and the stomach should be empty and clear and light. So what are the benefits of Kalabhojana? So Kalabhojana stimulates and maintains the Agni. It will prevent the Agni Mandya and ensures complete digestion. It will prevent the Ama Utpatti and maintains the Srotas patency, prevents the Srotavarodha and balances the dosha as food is taken when doshas are in swasthana, and improves Dhatu Poshana Krama by ensuring the sequential nourishment, and enhances the manasika balance, since ahara in a proper kala supports the sattva and mental clarity. When the agni stairya, dhatu will be in a stairya avastha. And coming to the discussion, akala ahara sevana leads to the agni manda and ama utpatti, initiating the srotavarodha and deranging dhatu poshana krama. Kalabhojana practices under the proper physiological condition, that is post-elimination and the presence of hunger, clarity of the senses and lightness of the body, stimulates the Agni and prevents the further Ama formation, and maintains the dosha in equilibrium, and restores the Srotas patency. And this process ensures proper metabolic transformation, that is Dhatu Agni Deepana, and thereby reversing the pathological cascade of the metabolic disorders. Coming to the conclusion, Kalabhojana serves as an effective Samprapti Vikatana measured by restoring the Agni Bala, preventing Ama formation and maintaining the Dosha Dhatu Samyata. Regular practices can thus play a pivotal prevention and curative role in managing the metabolic disorders in an Ayurvedic viewpoint. Thank you.
Yes, Dr. Ashwin, in the initial slide, you were pointing out about Ati Bhojana. Later, it is now Kala Bhojana. Difference between these two now, Ati Bhojana or Kala Bhojana?
No, sir.
Kala Bhojana in one
So
metabolism slide. Here.
Sir. So Akala Bhojana is.
No, Ati Bhojana, while explaining metabolism, no, we are metabolic syndrome. That slide.
Sir.
I think second slide, I think. That one. So overeating.
Sir, overeating.
So you were demonstrating about metabolic syndrome due to overeating. But what about
Overeating?
Kala Bhojana?
Also, sir, Akala Bhojana is the main causes for the metabolic syndrome, no, sir? So in Akala Bhojana and also overeating, that combinedly leading into the pathogenesis of the metabolic
So then
syndrome.
in this slide, both should come, no?
Sir.
Akala plus Ati Bhojana.
Yes, sir.
Both should come.
Yes, sir. Yes.
Okay. Thank you.
Thank you, sir.
Sir. Give me, sir. Okay, sir.
Okay, sir.
This was the last presentation for this session. Thank you, judges, for sparing your valuable time and providing the feedback to the participants. I'm sure you would have had the participants. I request the judges for your concluding remarks.
Yes, madam. Thank you for giving this opportunity. Thank you for thank you, especially CCRS, for giving this opportunity. Almost all presentations were fine enough. Even Ayurvedic perspective, everything was okay. Somewhere like claiming some modern aspects. So without any evidence-based works, we may not be able to claim. So that's why there may be some issues. So while claiming also, there should be proper evidence. Some work might have been done. especially in Rasa Yogas, Rasa Ushadis and all, there were so many claims. So which furthermore works have to be done before claiming. Otherwise, presentations and all, they were fine. In between, some hurdles were there, but overall, even the program, managing the program also was very apt. And once again, congratulations for CCRS. Thank you.
Yes, sir. Dr. Umesh, sir.
Madam, thank you very much. I thank CCRS, the Central Ayurveda Research Institute, CARI, for giving an opportunity to judge this session. And indeed, all the papers were good. The only thing is that I think we should stick on to as much as possible to explanations that are there in Ayurveda. And the studies which have tried to explore these concepts which are there in Ayurveda, through which some sort of evidences have been there. Leaving that, like most of the papers, as Dr. Gopal Krishna sir was rightly pointed out, like there were a lot of pathways that have been climbed, but I think okay, you have climbed, but with certain references, if it would have been climbed, I think it would have helped all the audience and also the judges. So hence, in future presentations, I think citations from where these evidences have been taken is one thing I would suggest for all the presenters to quote in their slides. Leaving that, I think all the presentations were good, and I congratulate them. And thank you very much, madam.
Thank you, sir. Dr. S.K. Giri, sir.
Firstly, I congratulate to all present in the pre-conference virtual moment, and congrats to my chairperson Judge Dr. Umesh ji and Dr. Gopal Krishna ji to give the work very easy. And today all the presenters, they are presented very nicely, very systematically, and very correctly also. But some presenter is not mentioned the mainly that is in Ayurvedic methods, that is by Ayurveda and also modern in the methodology. That it is very important. Methodology and the safety parameters. Safety parameters and efficacy. These are very important in the way you present in the presentation, in the paper, in clinical or review any articles. And along with also you have to, when you present, some presentation must be there, some journals. So publication, with the help of the journals, we published, that is the presented the papers. And lastly, I thanks to our Honorable DG sir, and our beloved Madam Eddie in Church, and CCRS, TRI to give opportunity me. Thank you all. Thank you all.
Thank you, sir. Thank you all the judges for your time. Thank you so much. We will start with the next session. Dr. Maria will be coordinating the same. Thank you, sir.
Thank you, madam. Thank you. Thank you, madam.
Thank you, sir. Good afternoon, respected dignitaries, esteemed judges for today's session, and dear delegates, presenters. It is my privilege to welcome you all to the pre-conference virtual presentation of International Conference on Ayurveda and Integrative Approaches to Obesity and Metabolic Syndrome. On behalf of Organizing Committee, CCRS Cali Bengaluru, I welcome you all. We'll begin with the session 6, which is based on the theme Metabolic Syndrome, Ayurveda and related concepts. In this session, overall we have 11 presentations. It's my pleasure to introduce the respected judges for this session. Dr. Ashwin Chandra, Associate Professor, Department of Kaya Chikitsa, IIR, Goa. Sir is an Ayurvedic professional with over 21 years of experience in Ayurveda, encompassing teaching, clinical practice, research, and policy development. His work spans India and South Africa, where he contributed to the establishment of educational framework for Ayurveda. He has represented the Ministry of Ayush in global forums, focusing on traditional medicine's role in public health. Sir did his BMS from Hyderabad, MD in Manovignana Evam Manas Yoga from Kerala. Since 2024 October, he is working as Associate Professor, Department of Kaya Chikitsa, IIR, Goa. Previously, he was working as a Research Officer, Ayurveda at CCRAS. Sir had deputation in Ministry of Ayush since till October 24. He managed Ayush Education Policy, core member of COVID Project Management, member secretary, Committee on Ayush Guidelines, Task Force member, nodal officer from Ministry of Ayush for Shanghai Cooperation Organization. Sir had various international experience. To name few, he was a board member, Ayurveda Foundation of South Africa. He represented and delegated in various international activities, WHO, BIMSTEC, India-Brazil Joint Working Group, WHO Global Survey, WHO SEER Regional Consultation. He had various publications and presentations to his credit. Welcome you, sir.
Thank you, ma'am.
Our other judge is Dr. Srinivas Sahu. He is currently working as a research officer at RA, RIM and MMR Bengaluru and at CCRAS, Ministry of Ayush, Government of India. He also served as a research officer at Nari Charaturthi, Kerala for a period of 10 months. He completed BMS from Puri under Utkal University. And he did his PG in Kaya Chikitsa, PhD in Manovignana. He is a principal investigator, co-investigator, coordinator of various IMR, EMR collaborative projects, and he also in charge of various departments. He is a PhD guide and has various papers to his credit, national, international journals. He also participated in various workshops, conferences. Our other judge for this day is Dr. M.B. Kavita, Professor, Department of Swasthavruta and Yoga. Madam did her BMS from Mangalore University, MD in Swasthavruta from RUHS. She completed a clinical study titled Hypolipidemic Effect of Bhavita Amalaki. She is involved in various research activities on dyslipidemia. She has various publications to her credit. She is a part of her teaching and clinical roles, serves PG, UG education in preventive medicine and health promotion. Welcome you, madam.
Thank you, madam.
A warm welcome to our presenters as well. General instructions to all our participants. Please ensure that your microphone is unmuted during presentation. Keep your camera on as far as possible. Maintain a stable internet connection. Strictly adhere to the allotted time. Now we begin with the presentations. I invite Dr. Sukanya. She'll be presenting on the topic Ayurvedic Insights into Metabolic Disorders with special reference to Agni. Over to you, Dr. Sukanya. Dr. Sukanya.
Hello, ma'am, am I audible?
Yeah, yes, you are audible.
Yes. Good afternoon, everyone. This is Dr. Sukanya, second year PG scholar, Department of Rachana Shaira, GAMC. Hello, am I audible, ma'am?
Yeah, you're very much audible. Please go on.
Dr. Sukanya?
Good afternoon. This is Dr. Sukanya, second year PG scholar, Department of Rachana Shaira, GAMC Bangalore. So first, why did I choose this topic? So since Agni is the fundamental
Sukanya,
component
your voice is
of the
not
body.
audible. You are sharing. Hello?
Hello.
Sukanya?
Yes, ma'am. Ma'am, am I not audible? Hello.
I think you are audible to others other than madam.
Okay, okay. So my topic is Ayurvedic insights into metabolic disorders with special reference to Agni. So first, I'll tell why did I choose this topic. So since Agni is the fundamental component of the body for either health or disease state, so it is the basis for any of the diseases occurring in the body. So it can be a basis for metabolic disorders as well. So first we will understand what is metabolism. So metabolism refers to sum total of all the reactions that take place in the body, that is anabolism and catabolism. Metabolic disorders refers to any disease or condition that interferes with the normal metabolism of carbs, proteins, fats, or nucleic acids, leading to either accumulation or deficiency of metabolites. So metabolic disorders, to name a few, are obesity, diabetes, dyslipidemia, and which are increasing globally. So Ayurveda correlates metabolism with Agni, that is the digestive fire and metabolic fire. So Agni, it is of either balanced or deranged. So if it is balanced, it leads to health, and if it is deranged, it leads to disease. So concept of Agni in Ayurveda. Definition, Agni Rannam Pachati. So Agni digests foods and transforms it into energy. So according to Ayurveda, we have three types of Agni. That is, one is Jatragni, Bhutagni, and Dhatwagni. So Jatragni is 1, and Bhutagni are 5, and Dhatwagni are 7. Jatragni is present in the Jathara Pradesha, and it, along with Bhutagni, helps in digestion of food in the Jathara Pradesha, whereas Bhutagni with Dhatwagni helps in Paka of the Ahara Rasa at the level of Dhatus. So Jatragni, if there is the Dhatwagni and Bhutagni, everything are dependent on Jatragni. If Jatragni is Tikshna, then Bhutagni and Dhatwagni both are Tikshna. If it is Manda, that is Jatragni, if it is Manda, then Bhutagni and Dhatwagni both are Manda. Next, classification of Agni. So Agni, Samagni, that is balanced state, that is healthiest state, and Vishama Agni, that is irregular or Vata dominant state, Tikshna Agni, that is excessive, that is Pitta dominant state, and Mandagni, that is weak or sluggish type of Agni, which is Kapha dominant state. So now we'll see what is metabolism. So it includes digestion, absorption, assimilation, and elimination. So digestion refers to breaking down of complex substances into simpler substances so that it can be easily absorbed into the body. So absorption refers to it is the movement of the simpler substances which are being digested from the walls of intestine or walls of stomach into the bloodstream. Assimilation is nothing but it is the absorption of the process where the absorbed nutrients are then converted into energy, or they're helping in the tissue repair and growth. And elimination is the waste product which is being later after assimilation is present, it is eliminated. So now the functions of Agni are Ahara Paka, Dhatu Poshana, and helping in Ojas and Prana. Next, Samprapti of Agni Dushti and metabolic disorders. So when we have improper Ahara and Vihara, it leads to Dosha Prakopa, that is either Vata, Pitta or Kapha gets dominated and gets Prakopa, it leading to Agni Dushti either as Mandagni, Tikshna-Agni, Vishamagni, then it leads to Ama formation and Srotoroda by Ama, and then it leads to metabolic disorders. So we have the famous quote that is Rogaha Sarvepi Mandegni. So Agni Dushti at metabolic disorders. So Manda Agni, that is Kapha. If it is the dosha involvement is Kapha, and modern correlation is either it leads to obesity or hypothyroidism. Tikshna Agni Pitta, hyperacidity, ulcers and hypermetabolic disorders. Vishama Agni, that is Vata, IBS, malabsorption or variable appetite. So we also have a concept that if the Agni which is present is not completely performing well, then it leads to Ama. When this Ama alone causes different types of symptoms like Vishtamba, Sadhana, Shiroruk, Murcha, etc. When this Ama gets mixed up with Vata, it leads to Vataja disorders, Pitta, Pittaja disorders, Kapha, Kaphaja disorders. And when it comes with Rasadi Dhatus, it leads to diseases of the respective Dhatus. So this metabolic disorders can be correlated with the diseases occurring in the Dhatu level. So when the ama is just at the level of Vata, Pitta or Kapha, it leads to simpler diseases, whereas when it goes to Dhatu level, it leads to complicated disorders, which can be termed as metabolic disorders. So the management principles are goal is to restore Agni and eliminate ama. So either Langhana or Upvasa when there is lesser Agni Dushti and lesser doshas. Deepana, that is with the help of drugs, we are helping in increasing the Agni. So it is at the Madhyama Avastha of dosha, and Shodhana is when there is Tivra dosha Prakopa. Then the Shodhana helps in removing the doshas so that the Agni performs well. Next is Pathya and Apatya. We have a famous quote that is Pathya Sati Gadartasya Kimaushadha Nishevanaihi. That is when we follow Pathya, it helps in, it aids the Dravya so that it works well. And if we do not follow Pathya, then even if we take medicines, that will not help. Next is Rasayana therapy. That is, since during disease state, all the dhatus will be in Kshina Avastha. So Rasayana helps in our dhatu normalcy. So discussion and conclusion. Modern correlation of Agni can be enzymatic activity, metabolism, mitochondrial function. Ama can be correlated to toxins, free radicals, metabolic waste. Conclusion is Agni is the foundation of health and metabolism, and all metabolic disorders originate from Agni disturbance. Thank you.
I request our respected chair to please share your comments.
Yeah, Dr. Sukanya, you have mentioned that different types of Agnis. And
Yes, sir.
what is the condition of Agni? You have mentioned in obesity as Mandagni. So what Acharyas has mentioned, whether it is Mandagni or Tikshnagni in case of Staulyam.
Okay. In case of Sthaulya, they have mentioned it as Tikshna Agni only, sir. But Tikshna Agni, in some contexts, they have mentioned Tikshna Agni, but also they have told due to when the Samana Vata is deranged, it leads to Vishamata of the Agni. So in that case, Vishamata can be considered as sometimes Mandagni and sometimes Tikshna Agni.
So how you can say that it is Mandagni, at which level it is Mandagni and which level it is Vishamagni, and if it is Vishamagni, how the pathogenesis Samprapti, how specific Samprapti has been mentioned in Sthaulya. Can you enumerate on that?
Yes, sir. So Tikshna Agni can be considered as at the level of Jatra Agni because the person desires more and more food, and the Mandagni can be considered at the level of the Dhatu level. That is, Dhatu Agni is there Manda, because we know when there is Dhatu Agni Mandata, then it leads to more and more Dhatu Poshana. That is, the amount of Dhatu is more, and when the Dhatu Agni is Tikshna, then it is leading to Dhatu Paka, or there is Kshinata of Dhatu. So in that case, the Medo Dhatu Agni is Mandya, whereas Jatra Agni is in the Tikshna Avastha.
So what is the role of Avarna in this?
Avarana is mainly in the classics, they have told that Kapha, the Meda does the Avarana of Srotas, leading to Vata Prakopa, which leads to, so that the Vata gets Vata moves to the Jatara Pradesha, leading to the Vishamata of the Agni, sir.
So which type of Shodhana is indicated in Sthaulya?
Which type of?
Shodhana.
Shodhana. Sir, actually, Vamana and Virechana both can be used as a line of treatment, because Vamana helps in removing the excessive Kapha as well as Pitta, whereas Virechana also helps in removing excess of Pitta and Kapha. So, based on the Agni, whether it is Mandata or it is in Tikshna Avastha, we can use either of Virechana or Vamana, sir.
I think you need to refer back to Arha, Anarhas of Vamana and Virechana, whether Sthaulya is indicated or contraindicated. Okay. So you have not referred the text properly.
Okay, sir. I'll check.
Hello, Dr. Sukanya.
Yes, sir.
I had one doubt regarding one slide you mentioned the Tikshna Agni on which pathology increase. So here you mentioned one hypermetabolic disorders. What are this? Can you give an example? What is the hypermetabolic disorders which you can consider under this?
Yes, sir. Hyperthyroidism can be considered as hypermetabolic syndrome.
Then
Our Bhasmaka Roga can also be considered as hypermetabolic syndrome, sir.
in Bhasmaka, you are getting this type of patient? Practically, you are getting or
No, sir. I haven't got such patient till now.
what line of treatment or chikitsa is mentioned in Bhasmaka Roga?
Bhasmaka Roga Chikitsa is use of more Guru Ahara, sir, and Tarpana Ahara is told in obesity. Guru Ahara is told mainly which helps in increasing the Kapha dosha so that Vata and Pitta gets alleviated, sir.
Okay, right. So better to write is you are telling a hypothyroidism mentioned in Mandagni. Similar hypothyroidism can mention. So instead of hypermetabolism. Okay. Huh?
Okay, huh. Okay, sir.
Kavita madam, you have any?
Very good presentation, Sukanya. Congratulations.
Thank you.
It's not as straight as you have written on the slide. Mandagni, Kapha, obesity, hypothyroidism. I think hypothyroidism follows the same samprapti as obesity. Both places we have involvement of Vata as well as Kapha. So you have highlighted on Kapha and Pitta in your answer to Dr. Ashwin, if I am not wrong, but you have left out Vata. Vatanulomana has to be done, otherwise Tikshnagni cannot be treated, right?
Okay. Yes, ma'am.
So it's not very simple dosha involvement in the as in the table, right?
Okay.
So you have to treat both all the three doshas in obesity or hypothyroidism, right?
Yes, ma'am.
And at what level is the Mandagni? You said it is only in Dhatu, Dhatvagni level. Is it not in Bhutagni level?
Bhutagni, I am not sure, ma'am.
Why
Like,
you are not
I have to refer it.
See, action of Bhutagni comes first, then comes the Dhatvagni, right? So where will be the problem then? Jatragni, we have Tikshnagni because of Avarana.
Yes, ma'am.
Because of Avarana, right? So think again. Whether it is Bhutagni, that is Manda, and hence there is Mandyata in Dhatvagni, or it is only Dhatvagni that is involved.
Okay. I will refer it.
Okay. And also think on this. Why should we not consider Agni Dushti as improper gut microbiome? There is disbalance in the gut microbiome. Okay?
Yes, ma'am. Sure, ma'am.
They are points to ponder for you. Thank you. It was a good presentation, though.
Thank you, ma'am.
Thank you, judges. Thank you, Dr. Sukanya. Now we'll move on to our next presentation by Dr. Vaishnavi Devi on the topic Ayurvedic Insight to Understand Metabolic Syndrome as Santapanajanya Vikaras. Dr. Vaishnavi?
Hello.
Am
I audible, ma'am?
Presentation mode. Yes, you are audible.
Yes, So
Yes, sir.
Myself, Dr. Vaishnavi Deshmukh, second year PG scholar from Department of Davyaguna, GMC Bangalore. My today's topic is Ayurvedic insight to understand metabolic syndrome as a Santarpanjanya Vikara. Moving towards introduction, what is meant by metabolic syndrome? Metabolic is a whole range of biochemical process occurring in our body, and syndrome is a set of symptoms or condition which occurs together. What is difference between the metabolic syndrome and metabolic disorder? Metabolic syndrome is the alteration or the disorder of energy utilization and storage, and the causes of a metabolic syndrome is still an area of the research. The sign and symptoms of the metabolic syndrome is central obesity, high blood pressure, and etc. What is meant by metabolic disorder? Metabolic disorder, it is an inherited defective gene which causes the enzyme deficiency. Particularly, the cause is the dysfunction of the liver or the pancreas. The symptoms may be acute, late, or the progressive or the permanent. According to WHO criteria, they mentioned that the insulin resistance is a compulsory clinical observation observed in the metabolic syndrome. Other than that, the obesity and dyslipidemia, hypertension, and microalbuminemia, any of these four, and insulin resistance considered under the metabolic syndrome. In Ayurveda, metabolic syndrome is a cluster of the symptoms like obesity, which may be closely related with the Santarpajanya Vikara disorder that arises from the excessive nutrition, sedentary lifestyle, which further leads to kapha and meda increasing disorders. Moving towards the causes. The causes are the age, particularly in adult age up to the 40 year, we see the metabolic syndrome, and after 40, the risk factor gets increased. Obese person, sedentary lifestyle, insulin resistance, stress, diet, particularly sugars, sweetened beverages consumption, genetics, low physical activity, disturbed chronology, particularly altered the sleep pattern, mood disorder, excessive alcohol consumption. Moving towards the pathophysiology. When overeating and low physical activity happens, which leads to the visceral adiposity, which leads to three mechanisms, that is adipokine alteration or the cytokine increase and fatty acid gets increased. What is meant by adipokine alteration? In which the fat cell secretes two hormones, that is leptin and adiponectin. The function of the leptin is the increase the appetite. Also, they increase the blood pressure and heart rate. What is the function of adiponectin? Adiponectin, these are the insulin sensitive hormones. So, in obese person, the leptin gets increased and adipopectin gets decreased, which leads to the neurohumoral activation. And in cytokine, if increased, they leads to the two pathway activation, that is LOX activation, which leads to the neurohormonal activation, and RAS activation, which leads to the chronic inflammation. If the fatty acid in the blood sugars gets increased, which leads to the insulin get decreased, muscle glucose uptake decrease, also gluconeogenesis or triglycerides gets increased. Overall, the glucose in the blood gets increased, so insulin resistance happens. So we can consider it in the Ayurvedic perspective. Neurohumoral activation due to the Vayu provocation, chronic inflammation due to the Pitta provocation, and insulin resistance due to the kapha provocation, which further leads to the metabolic syndrome. Moving towards the obesity, the definition of obesity, a condition in which percentage body fat gets increased to an extent in which health and well-being are impaired. Here we see four pictures. The estimated two pictures, we easily seen that it is obese person, and middle to one, it is lean thin, also it is considered as obese person. Because first one is metabolically obese normal weight, means person have normal weight, but metabolically obese, means metabolically abnormalities are present in that person. And normal weight obese means person have normal weight, no metabolical abnormalities, but the visceral adipose tissue gets increased about 30%. And the other two obese person are there, metabolically healthy obese and sarcopenic obese. Metabolically healthy, it names seen that metabolically healthy means no metabolical abnormalities is present, but the patient have more BMI, low adipose tissue presented, and high CRF means chronic renal failure. And sarcopenic obese, they have both BMI is more, metabolically abnormalities also present.
According to Ayurveda, in stolya, the causes of stolya, atispurana guru madura, shita snigdha upayogat, avayama divasopnascha. This is mentioned in Chadak Sutra Sthana 21 adhyay, that is Langan Gruvani adhyay, and Santalpanjanya causes, that is Nava Anna, Medya, Masa, Anupa, Divasopna, which comes under the Santalpanjanya causes. The disease due to the Santalpana, which mentioned in Chadak Sutra Sthan 23 number adhyaya, that is Prameha, Ama Pradosha, Tistolya, Indriyanam Stotasa Leva. Here we can consider the Avadanjanya insulin resistance in that correlated with the Santalpanjanya Vikaras. Other than that, Shofa is also present. Ayurvedic, where we can see the Samamansa Pramanastu Samsahanano Nara. Along with increased BMI, body fat percentage as well as body fat distribution is take more importance towards the obese person. The stotas involved in the obese person are sthayi and asthayi. Sthayi are the mansas and medos, and asthayi are rasa. So here medo vahini dushanti dadu nishchati sevana. Overuse of alcohol or consumption of alcohol get stoto drushti in medova stotasa. Conclusion: metabolic syndrome should be considered under Santalpanjanya Vikara. Along with kapha, involvement of pitta and vayu should be considered and evaluated accordingly. Involvement of rasa, mansa, medo, stotas must be considered and treated accordingly. The metabolic syndrome and Santalpanjanya Vikaras closely related because there is a kapha meda udutti, agnemandya, ama, vata avadana, and inflammation due to the pitta. Thank you.
Next, our judges, to please share your comments.
Dr. Vaishnavi, I have a doubt.
Yes, ma'am.
I have a question for you. In the
Yes,
slide where you have depicted the 4 men with varied fat percentages, right? Can you
yes,
put that
ma'am.
slide?
Yes, ma'am. This one, ma'am.
I think it is the 6th slide.
Okay.
So in this, you have put BMI more than 30.
Yes, ma'am.
And sarcopenic obese also BMI more than 30. Why?
Both having BMI, ma'am, more than 30, but metabolic abnormalities is absent in metabolically healthy persons, and sarcopenic metabolic abnormality is present, ma'am.
Can you explain that? I could not get what you meant to say that.
Both, ma'am, both sarcopenic and metabolically healthy
They
obese
are
both have
having more
BMI
than
more
30
than.
BMI.
Yes,
But
yes,
the
ma'am.
first one has low fat percentage. Is that so?
No, ma'am. Metabolically healthy. First one is metabolically healthy. There is no abnormality, that is insulin resistance or cardiovascular disease is not in first one. Which
Yeah,
is
that's correct. What about the BMI?
BMI is both having more than 30%, ma'am.
How?
No, I can, ma'am.
Before putting that slide, you should understand that's a correct slide, but you are failing to describe that.
Okay, ma'am.
What is your understanding on the definition of sthaulya versus obesity? Definition of obesity.
Obesity, ma'am, there is percentage of body fat gets increased. In stolya, we can consider it may be medo dhatus or mas dhatus, maybe avadana, or in case of if vayu is more, that case is also stolya is more. No need to having only fat tissue gets
Don't
increased.
we have any
In
definition of sthaulya, Dr. Vaishnavi?
yes, ma'am.
Don't we have any definition for sthaulya? You are telling maybe.
No. Maybe, ma'am, I think.
No, you are telling maybe, but classics give exact definition for Staulia. Diagnosis of Staulia should be understood in this manner. It is clearly told in the classics.
Yes, ma'am.
Because you are
I
describing
don't remember this.
Santarpanajanya Vikara versus metabolic syndrome, you should
Yes,
be able to describe that. Right?
Okay, ma'am.
Okay.
Yeah, Dr. Vaishnavi.
Yes, sir.
Yeah. So some of the concepts you have presented well.
Yes,
Please elaborate on how the Samprapti of Staulia is similar and how it is different from Prameha, and where both meet on a continuum of spectrum of pathogenesis. Can you please elaborate?
Staulia and which, sir?
Prameha.
Both have due to the Mandagni, sir. But in Staulia cases, what happens? The tissue, that is adipose tissue secreting that hormone which resists the insulin. So blood sugars get increased in both in obese person and in Prameha patients, sir.
So you mentioned Mandagni. Mandagni at what level? Because in Staulia, Acharya is mentioning about Tikshnagni, isn't it?
Yes, sir. Yes, sir. Sir, but Jatharagni is not a Mandagni. Patient get consuming more food, but the Dhatu Agni gets decreased. So the percentage of creating Dhatu gets disturbed, sir. I think so. Dhatu Agni is Man, sir. Jatharagni is Tikshna.
So you have presented your topic with respect to Santarpanjanya Vikara, isn't it?
Yes, sir.
So what is your view of the role of Vata and Avarna and Nidra in Samprapti of metabolic disorders?
Sir, here we can
Vata,
see
Avarna and Nidra.
Vatavarana, sir, Indriya na lepa. So Indriya is considered as a cell. If cell is not accepting any receptor or any kind of hormones, that is avarana. So any kind of avarana, it is vatavarana or ama pradoshas vikara. So patient not taking that insulin or tissue not get insulin. So avarana is there.
So
And
resistance is due to Avarna or Dhatvagni Mandya?
Sir, Dhatu Agni Mandya is more correctly. Avarana, I think if Samprapti gets over and over, then Avarana is come.
Yeah, if there are no further question, we can, I think, call the next candidate.
Thank you, sir. Madam. Our next presentation is by Dr. Diksha Nayak on the topic Ayurvedic insights into metabolic disorders.
Ma'am, I'll be sharing my screen now.
Okay, doctor.
Ma'am, is this visible and am I audible?
You are audible, visible.
Okay, I'll proceed, ma'am. Thank you. A very good afternoon to everybody present here. I'm Dr. Diksha Nayak, second year postgraduate scholar, Department of Dravya Guna, Government College, Bangalore. And today I will be presenting on the topic Ayurvedic insights into metabolic disorders in a way that I have understood it when I read it. Before we go and understand the disorder itself, we have to understand where in the physiology is there going to be some changes. We can understand this in terms of Jataragni, Dhatvagni, and Bhutagni. Let me try and explain this in the with some examples that I have understood. See, when we understand the lipid metabolism, we see that there is going to be emulsification of fat, which is going to be done by the bile, so that it is easier for the lipases to act on that, and these lipases break it down to fatty acids and glycerol. Lipid metabolism, when it starts at the level of Jಠರಾಗ್ನಿ. I have also added an article here which says there is going to be effect of anxiety disorders in secretions of bile secretions is, affected by the mental status of the person as well. So we can understand that the Jಠರಾಗ್ನಿ is affected by the mental causes, that is Manasika Nidanas, and our acharyas also say there is a method of taking the food, that is Tanmana Bunchita. Then understanding about the pancreatic lipases, which digest the smaller emulsified fat droplets, and this has a direct link with the physical exercise we do, and I've added another article which talks about the exercise having an impact on the hepatopancreatic secretions. As we have seen, as Sushruta says, Divaswapna Vyayama Alasya Prasaktam as the Nidana for Prameha. So by these two, we can understand that the Jಠರಾಗ್ನಿ level, the action is about the starting stages of any kind of metabolism, say, be it carbohydrate or lipid or protein. And we can understand this in terms of catabolic reactions, the anabolic reactions, and in modern science, in the contemporary science, they talk about the carbs, proteins, fatty acids being the source of energy, but we understand that as the Vimshati Gunas. Now coming to Dhatvagni. As and when we see the Dhatus, and as I've understood it, I have categorized this into Sneha line, Khara line, and Udaka line. The fatty acids are then transferred to the bloodstream are then taken up by different muscles or different tissues in the way that it wants. When we see Vividashita Pitiya, we understand that Kalavat Anavastitam Sarvadhatu Pakam Anupahata Sarvadhatushma Maruta Srotaha. These three things, that is Sarvadhatu, Ushma, Maruta, and Srota, act as a triad, and they compose of what we can understand as the Dhatvagni. Now let us understand this with an example. See, we understand the glucose transport system. It's been divided into GLUT 1, 2, 3, and 4, and 5. 1 and 3 are present in most of the tissues, 5 in the intestinal mucosa, 2 in the liver cells, which again is the Raktavaha Sroto Mula, and entry into the muscle. That is the fourth one, which helps the glucose to enter into the muscles and the adipose. This also can be understood as the Dhatvagni because there is going to be some kind of Paka that is happening at that level. That's why Acharyas have told us about 10 dushyas that are there in a Prameha. So when we understand the different pathways, say EM pathway, the Krebs cycle, or the electron transport pathway, or mediated acetylcholine pathway, which is happening at the Dhatu level, or the action of insulin. So all of this is somewhat coming under the broad spectrum of Dhatvagni. So we can understand the action of different hormones, say negative feedback mechanism, and different Dhatu Pradoshaja Vikaras that happen because of the impairment in the Dhatushma, Maruta, and the Srotas. Swasthanastasya Kayagni Ramsha Dhatu Shamsritaha Tesham Sadati Diptibhyam Dhatu Vriddikshayodbhavaha. And we should not forget that even this Dhatvagni is under the guidance of the Jఠರಾಗ್ನಿ itself. Then coming to the Bhutagni. What does Bhutagni actually do? It divides the materials into the different kind of molecular structure that it is made of. Let me give an example here, which says in glycogenesis, the UTP glucose molecules plus pyrophosphate is hydrolyzed by the pyrophosphatase. So these UTP molecules that are there, they are connected by glycosidic links, and this differs depending on the molecular, say the structure, the built in it. So what do we understand? That they are coming together by the Bhutagni Paka depending on the particular constitution they have. For example, now we understand there's LDL, HDL, VLDL, and so much more. Why are there so many different lipoprotein like we understand? It is because of the help of Jఠರಾಗ್ನಿ, Dhatvagni, and Bhutagni, and they have a particular structure through which they are divided into these different forms. Now let us take an example, like macrophages grab the LDL and debris because of its oxidation, as a debris, and because of the oxidation, they create something called as the atheroma, which becomes a reason for hypercholesteremia in the body. So this also happening with the at the different Agni levels. Bhutagni also playing a major role in this. And in Sushruta, he gives the Upadrava saying Hritroga Laulya Manidra Sambhak Kampashulam Baddha Purishatvam Cheti Vatajana. And even in this cholesterol, this thing, we see chest pain, fatigue, shortness of breath as one of the Upadravas. Xanthomas, which is nothing but Pita Vinmutra Netratvam, that is a Pittaja Prameha
the Upadravas. So say the final product, the equations that happen, division is happening at the Bhutagni level. The above example discusses about the impact of these diseases on the body. The metabolic pathways that make up the body are disturbed, and hence metabolic disorders are originated. This could be understood at the problem arising at Dhatwagni, Bhutagni or Jatharagni level. So understanding the Udbhavasthana and the Vyaktasthana and treatment for both, along with changes in the Ahara, Vihara and taking care of the Srotas, will help us having a better yield in the treatment. Thank you.
Yeah, Dr. Diksha.
Yes, sir.
Yeah, Ayurveda insights into metabolic disorders. That was your topic, isn't it?
Yes, sir.
See, whatever you have presented well. Only thing is you didn't convey the complete picture.
Okay, sir.
So you tried to correlate with the Ayurveda concepts with the modern, with some supportive evidence. However, you have missed some important and emerging concepts like what do you think about the gut health, especially with relation to the gut microbiome? Where does the gut microbiome fit in this? And how it is affecting the metabolic syndrome or metabolic disorders? Gut microbiome, you have gone through it?
Not really, sir. Probably I wanted to understand this particular topic through Agni itself. So probably my concern, I read through some of the physiological aspects like Krebs cycle, etc., that happens in the metabolism, and about Agni, sir. I could not probably go in depth about gut microbiomes.
So in such case, you are actually the title doesn't reflect that, isn't it? And also the important aspects with related to Nidra.
Yes, sir.
And Vyayam.
Yes, sir.
Which are also equally important along with the Ahara causes, isn't
Yes.
it?
Yes, sir. So Vyayama I have just added, sir. Nidra I could not, but Manasika Nidanas as such will have an impact is what I tried to bring in, along with Vyayama being one of the most factor that is affecting, if not done in the proper way, having effect on the hepatopancreatic secretion. That was just told in the first slide, but in depth, yes, sir. I might have missed a few points there.
Because Nidra, now it's emerging like sleep medicine is a big thing. And the latest research shows that it has a lot of effect on metabolic disorders, apart from the psychological or mental health well-being. So there's a lot of role how it is changing the gut microbiome and affecting the metabolic syndrome. Because now with the age, especially with the adolescents, there is a constant rise of obesity is on the rise. That's why even our honorable Prime Minister has called the nation to for appropriate strategies, isn't it?
Yes.
So, and as you know, the adolescents, they are like late sleepers, very late sleep because of the screen time and other things. So Nidra has a big role to play. Okay.
Correct. Yes, sir. I'll incorporate that when in my presentation next time, sir.
Hello, Dr. Diksha.
Yes, sir.
Can you tell me what is your understanding of Jatharagni, Dhatwagni, and Bhutagni in one line related to metabolism?
Sir, I feel like it is a particular process that is happening. Jatharagni is like a giver. Dhatwagni is like a sustainer, and whatever has to be removed, whatever needs to be given, like to choose everything and then supplied, that is at the most sukshma level is being done by the Bhutagni, sir.
Another in slide you mentioned only the Sneha line in one slide. So what about your Khara line or another three things you mentioned?
So this, sir, actually this, like this was a categorization that I made depending on the Grahani chapter when the Paka is going on, and in Grahani when they are explaining about how from Rasa, Rakta, Mamsa, when there is excessive Ushma, when the Khara Guna increases, that's when the Asti becomes. And then there is something like say from Mamsa, then there is Sukshma Sneha part that enters, the Medas that's there, and that enters the Asti, and that becomes the Sneha part. where Sneha is being carried on and then it is Sarvavyapi in the Sharira and that becomes Shukra. Whereas Udaka line is when mostly it is in the form of major of say Rakta Dhatu, Rasa Dhatu, or for say Shukra Dhatu as well in form of Udaka. So the Paka that happens at the level of Grahani is happening in a level where it is going from the grossest to the subtlest. Say from Udaka, then there is Sneha involved, and then there is Kharatva that comes in when Mamsa is being formed and Asti is being formed. And then again the Sukshma Sneha level is carried to the Shukra. That's how I understood it, sir. And in terms of metabolism or Dhatu Parinama, Dhatu, like next formation of each Dhatu.
Another slide, you had given the reference of Manodvega with some metabolism. Can you show that slide? How you correlated with some bilirubin or something?
Which one, sir? This.
Some Manodvega with some metabolism, like you mentioned in one slide. Yeah, lipid metabolism. So how you correlated with these things?
Sir, here in lipid metabolism, what I wanted to bring was the action of bile, sir. The action of bile and the action of the hepatopancreatic secretions that happen. These are poured into the Koshtha, being the Madhyama Roga Marga, where we actually find the sthana of the Jataragni. This having, and when we see this and we see the Ahara Krama that's being told in our science, we see there's some kind of link between Tanmana, Bhunjita, all of that having the role to play in the Ahara Paka. So how could this be understood is what I was trying to explore when I found out that there are disorders of the mind that affect directly on the bile secretion, which is responsible for the emulsification of fat, which is again acting at the level of Agni. That's why these say mental factors, or another factor where there is Vyayama involved, and these exercise has an impact even on the hepatopancreatic secretions. So how this at the level of Nidana, when we see for Prameha, they're saying Vyayama is one of the Nidanas, and we see the Ahara Krama, there's Tanmana Bhunjita. So this probably has an action to play at the level of Koshta, at the level of Jataragni, which when impaired can lead to different kind of metabolic disorders.
Okay, thank you.
Thank you, sir.
Dr. Diksha, I have a question.
Yes,
In
ma'am.
the last but one slide, if I am not wrong, you have mentioned something about xanthoma.
Xanthomas, yes, ma'am.
Xanthomas, and you have compared that to Pitta Venmutra Netratva with, I mean to say Pitta Netratva.
No, ma'am. Actually, it was Pita Netratva cannot be taken as Xanthomas. Pita Netratva is what we see inside. I thought Xanthomas being the, say, an Upadrava, it's a question mark for me too, ma'am. I was thinking, can it be not just the Netra, but also in and around the Avayava as well? Because there's going to be what do you say, collection, deposition of the cholesterol.
Yeah, but discoloration is different than deposition, right?
Yes, ma'am.
You have a defined mass in xanthoma, which is filled with the fat.
Correct.
But in relation to that, you have spoken about Panduroga, where Pitta Venmutra Netratva, because of Pitta, is exhibited. That Pitta is different than the deposition of fat.
Yes, ma'am.
So, can you really correlate that like that? Just
Probably.
to say that it is one of the Santarpanajanya Vyadhi and you want to discuss it somewhere, you just can't push it like that.
Yes, ma'am. Okay.
Okay?
Yes, ma'am.
Thank you, judges. Thank you, Dr. Diksha.
Thank you.
The next presentation is by Dr. Yashaswini on therapeutic significance of Pramati Dravyas in metabolic disorders. Over to Dr. Yashaswini.
Hello, Namaste, ma'am.
Namaste.
Hello.
Keep it in presentation mode. You can start.
Yes, ma'am. A very good afternoon, everyone. I am Dr. Yashaswini, second year PG scholar, Department of Dravya Guna, Government Ayurveda Medical College, Bangalore. Today, I am here to present my topic on therapeutic significance of Pramati Dravyas in metabolic disorders. As we all know, Metabolic syndrome is nothing but any derangement in the metabolism of carbohydrates, amino acids, and lipids. That too, when it disrupts the normal cell's metabolic process. So, as we all know, Agni Vikaras can be correlated to the metabolic disorders, be it at the level of Chaturagni or Dhatuvagni. So, the lakshanas of Pramathi Dravya includes Nijaviryena Yadravya, Srotobhyo Dosha Sanchayam, Nirasyati Pramathi Syat, Tadyatha Maricham Vacha. Also, Srotamsi Dosha Liptani, Pramatya Vibhrunoti Yat, Pravishya Saukshmyat Taikshnyatcha Tat Pramatiti Sannitam. So, Dravyas which having the Sukshma Guna and Tikshna Guna, through their Sukshma and Tikshna Guna, they removes or clears the Sanchita doshas in the Srotas by their own Nijavirya, that is, by their own Brahma. Here in Deepika commentary, they says that Srotos can be correlated to Karnamukha Nasadi, that is Bahirmukha, and or Rasavahini Siras, that is Antarmukha. So coming to Maricha and Vacha, the Pramathi Dravyas, they both share the common guna, that is Tikshna and Ushna Virya, but Maricha does Chedana and Vacha does Lekhana. All these both Dravyas acts on three main srotas, that is Rasavaha Srotas, Medovaha Srotas, and Manovaha Srotas. And all these srotas have the Samana guna with Shleshma. Pramathi Dravyas in the Rasa Pradoshja Vikaras. So as we all know, due to the Kapha Kara Ahara Vihara, which leads to the Ama Utpatti, leading to Ama Pradoshaja Vikaras, it leads to mainly Agni Mandya. So due to that, there is Rasadhatvagni Mandya, which will not do the Poshana to Upadhatu. And due to that, also the Dhatu Mala, that is Rasadhatu Mala Kapha gets increased. So this leads to various Rasapadoshaja Vikaras like Ashraddha, Ruchi, Asyavarasya, etc. So for example, in case of Maricha, Harita says that in Rasadhatukshaya, he says Kshira boiled with Maricha can be given. So here Pramathi Dravyas, due to their Sukshma Guna, it does Sroto Shodhana and it corrects the Rasadhatukshaya. So next, through this, Pramathi Dravyas like Maricha Vacha can act on Sapradoshja Vikaras. Next comes to Medovaha Srodhodishtijanya Vikaras. So this also, it is due to mainly Kapakara Ahara Vihara, which does the Ama Utpatti, and due to the Savaibunyata, there is Samata, Medo Dhatuvagni, which leads to Sthaulya. So to correct this, to do the Medo Sama Meda Utpatti, due to the Sama Meda Utpatti, we have to do the Ama Pachana in the Medo Dhatu level. For that, we need Paturasa Tikshna Ushna Dravya. Like in the example, for Saulya, we have Triphala. So Triphala Kvata with Madhu is explained, which due to their Tikta Kashaya Rasa and Ruksha Ushna Guna reduces the Kapha and Medas in the Srutas level. Next comes the Manovaha Srotodrishti Vikara. As we all know, Rajas is the guna of Vata, Tamas is the guna of Kapha. So if there is any derangement in the both Manodoshas, that is Rajas and Tamas, it actually acts on the Manovaha Srotas. That is like Acharaka has actually mentioned that Alpa Sattva is the main Nidhana of all the Mano Vikaras. So to remove this Panga in the Manovaha Srotas, Pramathi Dravyas through their Sukshma, Tikshna and Ushna Guna, we have to remove the Srota Sangha in Manovaha Srotas. So Pramathi Dravyas through their properties, like for example in case of Kapaja Unmada and Apaswara, Vacha Churna with Grita is mentioned, and Mucha and Sannyasa, there is Maricha Churna Nasya is mentioned. So through their Sukshma Guna and Tikshna Guna, it removes the Sangha in the Manovaha Srotas. Like this, Pramathi Dravyas acts on the Manovaha Srotas. Discussion. So, as we all know, this Pramathi Dravyas, they mainly contains Katurasa and Tiktarasa. The main karma of Katurasa is Agni Deepana, Kledo, Malan, Upahanti, Marga, Vivrunoti, and also it does Shodhana. Also, Sneha, Meda, Kleda, Upashoshana. It does the Upashoshana of Sneha, Meda, and Kleda. In Tiktarasa, they have mentioned the karma of as Deepana, Pachana, Shodhana, Vinmutra, Kleda, Vivarana. Also, we know the Tikshna Guna, Hemadri commentaries, it says that Shodhane Shakti Tikshna, and as in Sukshma Guna, it says that Vivarane Shakti Sukshma. So by Pramati Dravyas, which contains all these properties, it does the Ahamapachana and clears the Srotosanga and acts on the to do the Samprakti Vigatana of various values. Other Pramati Dravyas we can consider is Vacha Haridradi Gana in the Sushruta and Bhagavata, and Lekhaniya Gana in the Acharya Charaka. Conclusions. So all these Agni Drishti Vikaras or the metabolic disorders are chronic disorders, that is Chirakari Vyadhis, which are mainly due to the repeated Nidana Sevana, leading to various Dhatvagni Manyata of various dhatus, that is Vasadi dhatus, leading to Pandu, Grahani, Pravahika, Saulyadi Vyadhis. So to combat such chronic diseases, we need Sukshma, Tikshna, Ushna Virya, Lekhana and Chedana Dravyas to clear the Sroto Sangha and to do the Samprakti Vikatana of the Vyadhis. So integrating such Pramati Dravyas into a clinical practice helps to prevent and manage such metabolic disorders. Thank you.
Hello.
Doctor,
Yes, sir. Yes, sir.
I just want to clarify one thing. You mentioned in Pramati there two things. One Maricha and Vacha. So Maricha having the
Yes.
Guna and Vacha having the Lekhana. For example, in case of Tulya, or obesity can consider which type of Lekhana Dravya means Pramati Dravya you want to give. Mainly Maricha or Vacha or both. What is your opinion?
My opinion, sir. Yes, sir. But actually, sir, for Staulya, actually, Lekhana is needed, sir, because in Lekhana only they have told as a definition that is Thulatva Krishadikare. So, in my opinion, I think Lekhana Dravyas actually acts on Staulya, sir.
Okay.
Dr. Yashaswini,
Yes, ma'am.
which one of the Maricha or Vacha would you give in different conditions of, can you tell me, in different conditions of Santarpanajanya Vyadhis?
Okay.
Which would suit which condition? Because that is not highlighted. You're not audible.
There is more kapha pradhana, where we need more of tikshnata, we have to choose maricha, like in Shwasa.
No, I know that. Can you
in
just-
Vacha, where there is more of vata involved?
I know that, but can
Yes,
you
ma'am.
give me the list where you would administer Maricha and where you would prefer Vacha? Give me the conditions.
Like two different vyadhis or same vyadhi.
Yes, both way.
Yes, ma'am. Like in two different vyadhi, like I have mentioned here, I have mentioned Chirotita Pravahika for Maricha. It does, due to the Tikshna Ushna Gana, it removes the Ama in the Pravahika, in Chirotita Pravahika. But in also Vacha, they have told it does the Shakrat Mutra Vishodhana. So it is given in the condition of Atisara. Maricha we give in the condition of chronic Pravahika, but in Vacha we give in the condition of Atisara, where there is Ama Atisara.
Okay. In a disease at different levels. Can you give me one example?
In a disease like in Tamaka Shwasam, we give Maricha.
Yeah.
But in case of Vacha, we use in case of Unmada and Apasmara.
No. In Shwasa, where would you
Shwasa.
prefer Maricha? Where would you prefer Vacha?
Vacha. Okay, ma'am. In Kaphaja, particularly, I prefer Maricha. In Vataja, I prefer Vacha, ma'am.
Why would you prefer Vacha in Vata?
Because actually, Vagati Gandhana Yohoma. Because there is Rukshata in Vata.
And then you are inducing Lekhana again. Will it not vitiate Vata further?
If we actually add the different anupana, we can actually combat the vata, ma'am, like Kshira.
You did not say that. Okay.
I have
And one
mentioned.
more doubt I have was,
Yes, ma'am.
you said milk along with maricha will be
Yes,
given
ma'am.
in some
Yes,
conditions.
ma'am. Actually, I got the reference from Harita Samhita, ma'am.
Yeah, but milk with maricha, is it not virudha?
Yes, ma'am. Actually, I also thought, but to do the this maricha as it is Tikshna Ushna, to combat the Shitata and Snigdhata of Shira, maricha should be added, ma'am.
How much would be the dose you would prefer to
Like,
administer?
yes, ma'am. Just like 3 to 5 grams, that's all, ma'am.
To how much ml of milk?
250 ml.
Will this not be really spicy? 3 to 5
ma'am,
grams
because it will
is
be in the
quite
Sukshma
spicy.
form. As it actually the Acharya has mentioned to boil it, ma'am. To boil the maricha churna with the kshira, then to take twice a day. It's mentioned, ma'am.
The dose
They have not
you have
mentioned.
to,
They have not
so when such
mentioned the
doubts are
particular
there, it is always preferred,
dose, ma'am.
yeah, not to highlight without doing any experimentation. And there was one Manovaha Srota slide. Can you go to that?
Yes, ma'am. Yes, ma'am. Yes.
Here, can you tell me where would you administer Vacha and where would you administer Maricha?
Yes, ma'am. As I have mentioned there, in Kaphaja, particularly Unmada Apasmara, we have a reference of Vachachurna with Krita mentioned. And in Murcha Sannyasa, Maricha Churna in the form of
No, that is to stimulus. Give a stimulus, right? Why not administer Maricha in Unmada, Kaphaja Unmada?
Kanyavahasrut. Sorry, ma'am, I didn't get that.
Why not administer Maricha in Kaphaja Unmada?
Because Maricha will be more Tikshna, ma'am, for Unmada and Apasmara. And Maricha also increases Vata, ma'am, because of its Tikshnata.
If I give it with Ghrita as you give Vacha, similarly, if I administer Maricha, would it be a problem? My suggestion is before you present like this, you have to think 100 times what combinations will work. Okay, because it is two different Pramati Dravya, you are mentioning two different conditions. But I would suggest both might suit a condition with different anupanas.
Yes,
right? So think on that. Thank you.
Yes. Thank you.
Thank you, madam.
Yeah, I have a few questions. Again,
yes, sir.
What will be the dose of Vacha, if at all you want to administer? Vacha?
Vacha will be, yes, sir. The Vacha dose was mentioned as 1 to 2 rati, sir.
Okay. 1 to 2 rati.
Yes, sir. Because of its, because it is a Vishadravya.
And you have mentioned, like there was discussion about the Unmada and all. So
Yes,
whether Unmada is mentioned under Santarpana Janya Vyadya or Apatarpana Janya Vyadya?
Manodosha was mentioned in the Apatarpana Janya Vyadhi, sir.
Huh. So, see, your presentation actually is very narrow. There are a few problems, especially as also Madam has rightly mentioned, that how you can actually the relation with this is a theoretical part you try to work on, but whether you have related with the clinical thing. You are from which branch?
Dravya Guna, sir.
Okay. You attend OPDs?
Yes, sir.
Okay. So Amshamsha Kalpana is important. We know that it's Santarpana Janya Vyadhi, Stolya. Prameya is there. Okay. So if you try to see which gunas, if the ahara, whatever the ahara the patient is taking in Staulya or Prameha. So could you decipher which guna pradhana ahara the Acharya is mentioning? Whether it is Snigdha, Shita, or
As in for a upakrama, sir.
not in ahara only. Different types of ahara has been mentioned as Nidana, Pastaulya and
Yes, sir.
Prameha.
Yes, sir. Snigdha Guru Shita.
Snigdha,
Guru Shita Ahara.
Shita or Ushna?
Shita, sir.
Huh? Prameha
Shita,
Nidana
sir.
is well. Guru Shita. Huh? Or Ushna. Different types of Mamsa Varga has been mentioned, Anupa, Mamsa and all. Whether they
Yes,
are
sir.
Snigdoshna or Snigdha Shita. You need to refer on that. Because see, we can't take only one aspect. Your concept is good, but if you would have presented according to Avastha, only this Avastha, this Pramadi type of drugs can be given in metabolic conditions, that too for this much period, because that's also important. You should have specified the Avastha, dose, and how long you're, because you tell me whether the Staulya or Prameya patient is coming, or for that Unmada patient is coming, whether you are going to prescribe only these medicines, and
No, sir.
especially with this present type of lifestyle. That's why I asked you whether you see the patients. Most of the patients, they also complained with Amla Pitta, isn't it?
Yes, sir.
Yes or no?
Yes, sir. Yes.
So how far practically you can prescribe Maricha and Vacha?
We have actually both Maricha and Vacha we cannot actually give as a single formulation, sir. Ekala Dravya we cannot.
Because Vacha Ugragandha Katu Tikta Ushna, Vanti Vahinikrit.
Yes, sir.
You have means the first sloka. Second, you have Vibandhatmana Shulakni, Chakrut Mutra Vishodhini. That is the second line. But first line is also important, na? So you need to see if the Pitta Anbadna is there, Ushna Guna, definitely Ushna Guna Visheshan is there. That's why if you see the Samprapti of specially related to Prameya, Snigdoshna Guna, and how it is, you can correlate with the Basanta Ratu and all, and how the you say the Bahudrava Sleshma Dosha Vishesha has been mentioned in Prameya, isn't it?
Yes, sir.
With Snigdha Guna and Shita, it can't be Drava. With Snigdha Ushna only, the Sleshma can be Drava.
Yes, sir.
So when Ushna Guna is mandatorily required for the pathogenesis, then use of the logic use of Pramati Dravyas is questionable actually in clinical practice. Okay.
Okay.
Yeah.
Thank you, Dr. Yashaswini. We'll move on to our next presentation by Dr. Amulya on circadian Ayurveda synchronizing Ahara, Nidra, Vyayama with chronobiology for metabolic. Yeah. Dr. Amulya, you are there? Dr. Amulya, you are there?
Then go to the next slide.
Judges, we move on to next presentation. Dr. Vajreshwari.
Yes, ma'am.
Okay. Our topic is on Ayurvedic insight and management of metabolic disorders. Vajreshwari, you can start. Share your screen.
Ma'am, is it visible, ma'am?
You share your screen.
Ma'am?
No, not it.
Ma'am, now is it visible, ma'am?
No, no. Vajreshwari?
Wait, try to. I'm trying, ma'am. Ma'am, is it visible, ma'am?
No, no, it's not visible. You share your screen.
I'm sharing, ma'am. Ma'am, now is it visible, ma'am? I have shared, ma'am. Hello?
No, visible.
Ma'am, I will correct and I will present at the end, ma'am. Can I? It is not. I'm sharing, ma'am, but it is not showing. I will correct it.
That's what we do.
Hello?
Wait, Dr. Vajreshwari, we will try to share our side.
Sir, sorry, I'm connecting, sir, but it is not showing.
We will share from our side. 1 minute.
Sir, sorry.
Okay, we'll share from here.
Sir, it is not showing, sir.
And Vajreshwari, you are not sharing your PPT earlier to us. So now
Sir,
you
I'm sharing, sir, but
share.
sir, I'm sharing, sir, but it is not.
You just share that PPT through email or you just upload in the link we have given to you. Otherwise, please share it in WhatsApp also because you are not uploaded PPT. We don't have a copy of that PPT. You just upload or send mail or send through WhatsApp. We'll share it from here. We'll keep your presentation for next. Okay. We'll invite next candidate.
Okay, okay. The next presentation. Vajreshwari, you can read, you share. You share through WhatsApp or mail. Okay? Dr. Vajreshwari.
Yes, ma'am. Yes. Okay, ma'am.
Okay. We move on to next presentation by Dr. Parvana on role of Srotas in nutrient signal and metabolic network regulation. Dr. Parvana?
Hello, ma'am.
Yes, you can share and start with your presentation.
Okay, ma'am. Ma'am, is it visible, ma'am?
Yes, visible. Please start.
Okay. Good afternoon, everyone. I am Dr. Parvana PT, Department of Kriya Sharira, SDM College, Harsan. I will be presenting the topic role of Srotas in nutrient signaling and metabolic network regulation under the guidance of Dr. Pretti Ma'am, Associate Professor, Department of Kriya Sharira, SDM College, Harsan. So these are the contents today I am going to present. So, Srotomayam hi Shariram. Ayurveda emphasizes our body is composed of innumerable channels, which mainly functions as an internal transport system, which also does the various physiological processes. So, the term nutrient signaling refers to a range of cellular signaling pathways, which is influenced by the availability of nutrients, thus regulates the metabolism, growth, secretion, and autophagy. So the Ahara Rasa, which will flow through the Srotas, can be understood in terms of cellular nutrient transport and signaling. So when the Srotas is in the balanced state, that is Prakrita Avastha, it will ensure the metabolic homeostasis, whereas the Sroto Dushti will causes dysregulated nutrient signaling and leading to metabolic disorders. So in an era of rising metabolic syndromes, exploring the Srotas offers integrative approaches for metabolic disorder management. So materials and methods. Literature review was conducted focusing on Brihatrayi and Laghutrayi, describing about Srotas with its properties and functions, and referred modern studies on nutrient transport, signaling pathways, and metabolic network regulation. And comparative analysis were performed to correlate traditional concept with current scientific understanding. So when we define the Srotas, it is Sravana Srodhams. Sravanaditi Rasadeva Poshasya Sravanas. That is traversal of the Rasadi Posha Dhatus. So the Srotas ensures the distribution of nutrients all over the body, thereby maintaining the Dhatu Samyata. So that can be understood as it maintains the homeostasis in our body. So when the person indulges in Nidana, like Ahara and Vihara, which is similar to the dosha and dissimilar to the Dhatu in Guna, that is termed as Sroto Dushti Karana, will lead to the Sroto Dushti Lakshanas like Adipravritti, Sangha, Vimarga Gamana, and Siragrandhi, which will ultimately leading to the manifestation of signs and symptoms of the Vyadhi. So nutrient signaling and metabolic disorders. So here I have taken glucose metabolism. So we know that insulin and glucagon are the both hormones which will influence the glucose metabolism, and this mTOR signaling pathway is the metabolic pathway which will maintain the blood glucose homeostasis. So what is mTOR pathway? That is mammalian target of rapamycin, is a signal which senses the availability of the nutrients such as glucose, oxygen, insulin, etc. And it plays as a central regulator of cell growth, metabolism, and energy balance. How this is acting? So when the nutrients are sufficient in amount, this mTOR signal become active and it will promote the anabolic processes. But in case of metabolic disorders, when there is a high level of BCCA, that is branched chain amino acids, and glucose from the diet, or if there is an overload of metabolites, it will chronically activate the mTORC1 signal. That there are two, mTORC1 and mTORC2. So here it will chronically activate mTORC1 signal, which will causes the excessive phosphorylation of insulin receptor 1. Thereby it decreases the insulin sensitivity, leading to the insulin resistant and thereby metabolic disorders. So moving on to the discussion. So Ahara Rasa, which flows through the Srotas, can be understood here as glucose, which will travel along with the mTOR pathway. So here the Sroto Dushti Karana is the excess nutrient availability, that is especially the glucose, and it will lead to Sroto Dushti Lakshana, that is overactivation of the mTORC1, which will causes the insulin resistance. We can understand it as a Dhatu Pradosha Vikara. So concluding my presentation, Srotas acts as a dynamic channels regulating nutrient flow communication. Thereby, their balanced state ensures the optimal metabolism and cellular homeostasis, whereas the Sroto Dushti mirrors the disrupted nutrient signaling, leading to metabolic disorders. So for this, Nidana Parivarjana, Sroto Shodhana, and Rasayana therapies can restore the health of the Srotas, and integrating the traditional Ayurvedic principles with modern science provides a more complete, preventive, and personalized way to manage metabolic disorders. These are the references. Thank you.
Ravana,
Yes, ma'am.
you have highlighted only of glucose metabolism. What about fat metabolism? Because in metabolic disorders, we also come across a lot of conditions related to fat metabolism.
Yes, ma'am.
Can you explain some points on fat metabolism and Srotas?
Ma'am, fat metabolism, like the triglycerides are converted into fatty acids and glycerols after the digestion. Then it is converted into
No, the way you have explained the glucose metabolism,
Ma'am,
can you explain fat metabolism?
the signaling pathway is different, ma'am. So I'm not sure about this lipid
See,
metabolism.
you have highlighted the most easiest pathways.
Yes,
Okay.
ma'am.
We have to understand the other two major macronutrient metabolism also when we want to talk about Srotas in nutrient signaling. So what about the fat and protein?
Ma'am, I have taken like insulin resistance, so I have concentrated on glucose metabolism only.
Yeah,
I'll
but
go through
insulin
it.
resistance is the cause even for obesity. So
Yes,
where
ma'am.
fat metabolism gets involved.
Definitely, ma'am, but I'm not sure, ma'am, like about lipid metabolism. I'll go through it, ma'am.
It was a good presentation, but I felt it was incomplete without the involvement of the other metabolisms. It is just not so complete. For me, it is
Okay.
not a complete.
Okay.
Yeah, I also completely agree with the madam. It's you have provided only a minute point actually, related with the glucose metabolism and insulin resistance, because metabolic syndrome or metabolic disorders involves many other aspects.
Yes, sir.
Apart from the glucose, the lipid metabolism is the core, isn't it? Which is
Yes,
getting
sir.
affected.
Yes,
And
sir.
as you told that you have taken only insulin resistance, actually the dyslipidemia has also effect on insulin resistance. And also the growth hormone, cortisols, the stress factors, they also have effect on the insulin resistance.
Yes, sir.
And specifically, there is something related to hepatic insulin resistance. The reason why the fasting blood sugar levels are rising. So I think it was just not only unidimensional, it is much lesser than that. The idea is good, but you could not incorporate all the factors. I think the literature search you have done, you have mentioned only about the classical text. Whether you have tried to find out the contemporary sciences evidence in terms of searching PubMed or Web of
Yes,
Science
sir. Yes.
Scopus?
Yes, sir. I have searched, sir.
So you didn't do your homework properly then, isn't it? If you so, what was your search strategy? What were the terms used? How you
For
searched the PubMed?
searching, sir, nutrient signaling and metabolic pathways, sir.
Only the, what were the mesh terms you have used?
Sir, I've used mTOR signaling pathway only, sir.
So you have not followed the primary rules for such strategy, isn't it? So you need to use maximum synonyms, isn't it?
Yes, sir.
Yeah.
Okay, sir. Thank you.
Thank you, sir. Thank you, madam. Thank you, Dr. Parvana. We move on to our next presentation by Dr. Soumya on Ayurvedic perception into metabolic disorder, a critical analysis on Agni, Dosha, and Dhatu with respect to Prameha. Over to Dr. Soumya.
Yes, ma'am.
You can share your screen and you can start.
One second, ma'am.
Sorry to interrupt. There's some disturbance which is coming. Some noise.
Dr. Soumya?
Yes, ma'am.
Background noise is there.
One second, ma'am.
Soumya?
Yeah, so Soumya, you are not audible. I think, sorry to interrupt. I think there's a technical glitch at Soumya's end. So can we proceed with another presenter?
Yes, sir. Sure, sir. Yes, sir.
Thank you. Thank you.
Dr. Sridevi B. on the topic metabolic syndrome in Ayurveda. Dr. Sridevi.
Yes, ma'am. 1 minute, ma'am.
Yes. I request other participants also to be ready.
Hello, ma'am.
Yes,
Hello, ma'am. Ma'am,
Yes,
it's
yes.
audible, ma'am.
Yes, sir.
Okay, good afternoon, everyone. Myself, Dr. Sridevi Gude, final year PG Scholar, Department of Panchakarma, DGM Ayurveda Medical College. I am presenting metabolic syndrome in Ayurveda. Coming to introduction, metabolic syndrome correlate with the Ayurvedic concept like Santarpanajanya Vyadhi, Medo Pradoshija Vikara, Medo Shotadashti, Ama Pradoshija Vikara, Staulya Prameha, Rudraga, and Avarana. It is also called as a syndrome of X and insulin resistance. According to WHO, pathological condition characterized by the abdominal obesity, insulin resistance, hypertension, and hyperlipidemia are called as a metabolic syndrome. The global prevalence rate is 20 to 25% in adult populations. Coming to Nidanas, Nidanas are classified into Aharaja, Viharaja, and Manasika. Aharaja Nidana is like Abhojana, Atibhojana, Adeshana, Vishamashana, Viruddha Ahara, and excessive consumption of Guru Snigdha and Amla Aharas and Namanapana, Grama Udaka, Anuparasas, and Viharas like Viruddha Chesta, Divasupna, Ratri Javana, Vega Dharana, and then Ati Vyayama and Bhojanattara Vyayama and Ati Vyavaya, Sukha, Asi Sukha and Swapna Sukha. Manasika Nidana is like a person who is consuming the food with the emotional disturbance of Bhaya, Krodha, and Moha and Isha, etc. Coming to Samprapti, due to the Nidana, there is a Vaishami in the Jatragni that leads to formation of the Ama, and that will vitiate the Dhatvagni. That will be a formation of the Dhatu Mala, that will vitiate the Rasa, Rakta, Mamsa, and Medas. That will, in that condition, Kledamsha of the body, it will increases, and that will form, does the Shotorodha due to the Vatu Prakopa, and Agni Ruti will be expressed. That leads to Staulya. Due to the Dhatvagni Mandya, that leads to, and Visheshan of the Rasarakta Mamsa Meda, that takes Tanasamsha in Basti, that leads to Prameha. And due to the Dhatvagni Mandya, and then Mala Sanchayana Dhamani, that leads to, and Vanavayu Prakopa, that leads to Rakta Chapa. And coming to diagnostic criteria, by considering the abdominal obesity and elevated triglycerides and fasting glucose, and then high blood pressure and a low HDL cholesterol is the diagnostic criteria for the metabolic syndrome. And coming to the Ayurvedic management of a metabolic syndrome, in Ayurveda, we can consider as a Ahara Hi Aushadha. So, ask the patient to take a warm and fresh food and eat 3/4 capacity of the individual and consume food only 2 to 3 times a day, and eat food according to the seasons, and by following the viharas like Langana and Vyayama. In Alpadosha Avastha is there, in that condition, by using the dravyas like Pashana Beda, Gokshura, Varuna, Shilajatu, Punarnava, and then Kapha Meda Haradravyas like yogas like Palatrikadikwada, Nishamaliki Chuna, Shilajatu Rasayana, Chandrapavati, Shivagutika, and Stavle Harakashayas. And in Bahudosha Avastha, Shodhana is adopted. In Purvakarma, Langana Rukshana Svedana is adopted, and Pradhana Karma Vamana Virechana Vasti can be adopted. In Rutucharya, we can go with the Surya Namaskara and Bhujangasana, Pavanamuktasana, like asanas, and pranayama for the mental health, that is Nadi Shodhana. Coming to in metabolic syndrome, that is a Santarpanajanya Vyadhi. So in that condition, Apatarpana Chikitsa has to be adopted. In Langana, before any Shodhana, we can go with the Purukarma like Langana, Deepana, Pachana. So Langana is the first line of treatment in Ama Pradoshaja Vikara, and it will helps to liquefy the dosha Ama, and also ignite the Agni. In Deepana and Pachana, it will does the Amapachana, and it will ignite the Agni by using the Panchakola Chuna, Shaddaran Chuna, and Arogya Vedini Rasas. And Rukshana with the Udvartana Chunas, like by using a Trifala, Nimba, Nagaramota, and Vaja and Shunti. So in and Snehapana, we can administer with the Muchita Grita, Google Tikta Grita, and Panchatikta Grita, and Muchita Tilatela. Vamana can be administered with the Madanafala, Kutajan, Pritavedana, and Virejana, like Trivut Leha, Manivadra Guda, and Kalana Guda, and Abhayadi Mudaka. Basti like Lekana Basti and Chedana Basti can be administered by using a Madhu Vaja, Yava, and Devakshara in Marija. In Basti, in practice, we can practice with the Manchita Dikshara Basti, Madhutalika Basti, Trifala Dikshara Basti, and Moladi Basti, and Panchatikta Basti. Coming to discussion, Prameha, Staula, and Rakta Chapa comes under the metabolic syndrome based on the Bala of the patient and the Dosha Visheshan treat the condition. Initial condition of a metabolic syndrome can be correlated with the Medavahashota Dushti Lakshana. In that condition, we can adopt the Medo Kafahara Aushadas and Vatanulomana and Shamana Aushadis, having the properties of Ushna, Tikshna, and Roksha Gunas, and fully develop a metabolic syndrome without complication, that is correlated with the Apatya Nimityaja Prameha, can be treated with the Langana, Rukshana, and Shodhana Chikitsas. And the complicated stage of a metabolic syndrome can be correlated with the Upadrava Avarana, that is Upadrava Prameha also. In that condition, we can go with the Shodhana, that is Shodhana Chikitsa, and Vatanulomana Rasayana like Shilajatu Gugulu and Lashunas. Conclusion, prevention is better than a cure. Hence, by following the Dinacharya, Rutucharya, and Shadruta, Sadruta, each individual helps to maintain the health and prevent from the disease. Medo Pradashita Vikara and Santarpanajanya Vyadhis are due to Apatarpana is the main line of treatment. So it includes the Langana, Deepana, Pachana in Alpadosha Avastha, and in Bahudosha Avastha, Sudhana Chikitsa can be adopted. That will helps to manage the condition and prevent the complications. Thank you.
Dr. Sridevi, where is the reference for Rakta Chapa? Some word you used as Rakta Chapa.
Ma'am, we can hypertension, we can be correlated with the Rakta Chapa.
No, you are correlating it, right? Where do we have the reference? Do we have any reference for Rakta Chapa? It's a coined term from Hindi, right?
Yes,
There is
ma'am.
no Sanskrit word, at
No,
least
ma'am.
for
No,
Rakta
ma'am.
Chapa.
No, ma'am. Yes.
So don't use such words. I don't suggest you as PG scholar to use such words in scientific sessions.
Okay.
You could use some Amritavata concept here for hypertension, right?
Yes, ma'am.
And Rakta Chapa directly it translates into blood pressure.
Yes,
Is
ma'am.
blood pressure a disease?
No, ma'am. Due to the Medo Dhatu Sanchay in the Dhamani, so that will leads to hypertension, ma'am.
Hypertension is not Rakta Chapa. In Hindi also it should be considered as Ati Rakta Chapa, not Rakta Chapa, because Rakta Chapa directly translates as blood pressure. Without blood pressure, no human being will be alive, right?
Yes,
If your
ma'am.
blood pressure drops and comes to 0, will we survive?
No, ma'am.
So this is not the right word for. And I don't think you have tried to analyze something. You have directly said metabolic syndrome as Santarpanajanya Vyadhi, and you have tried to give the details of Santarpanajanya Vyadhi, isn't it?
Yes, ma'am.
Okay. Ashwin sir, can we go to next
Yeah.
one? Do you have a question?
Yeah, I have a couple of questions, ma'am. Yeah, in your last slide conclusion, if you can just show me, Dr. Sridevi.
Yes, sir.
You have mentioned, like, if I'm seeing it rightly, the difference manifestation of diabetes or hypertension. Yeah, comes under metabolic syndrome based on the bala of the patient. Dosha Visheshan is okay. How the bala of the patient will determine Prameya, Sthaulya and Rakta Pitta? Can you please elaborate? Hello? Dr. Sridevi? Hello?
Yes, sir.
Yeah, can you hear me? Yeah.
Yes, sir. Yes.
How the bala of the patient actually determines whether he is going to manifest Sthaulya, Prameha or hypertension.
Sir, in treatment aspect, we can Alpabala and Satvapta condition, we can go with Sir Chikitsa. Like Uttama Bala is there, in that condition, we can go with the Shodhana Chikitsa. Like Dosha
A
Visheshan.
treatment aspect.
Yes, sir.
But
Yes, sir.
your line suggests it is of the Samprapti pathogenesis or how they are leading.
Sir, in some Chikitsa aspect, I mentioned, sir, in some it's due to Santarpanajanya, like Uttama
Okay,
Bala.
so can you explain me how, based on the doshas, how actually this Samprapti varies with Sthaulya to Prameha to hypertension, Raktavrutavata or Raktagatavata?
Sir, in Prameha, Kapha Visheshan is more there, sir. It's due to Medo or Shrutadrushti, sir.
Yeah, Medava Shruta is also involved in Sthaulya.
Yes, sir.
Hmm.
And in hypertension, sir, it is due to Avarana of the Vata, sir.
Okay. So the difference between Sthaulya and Prameha? Staulya and
Sir,
Prameha.
in Prameha, Datvagni Mande will be there, and Staulya also Datvagni Mande will be there. In Staulya, Avruta Vata is there, sir.
Prameha, Avrita Vata is not there. How the Sthana Samshaya will be different?
Sir, in Prameha, it takes Samshaya and Basti, sir.
In Staulya?
It is in Amapakvashaya, sir.
Okay. So you need to have that clarity of how the Staulya is actually leading to Prameya, isn't it?
Yes.
How Bahudoshavastha is there, Bahutarava Dosha Vishesha. Kleda is more. And the Bastisthana, Mutrava Srotas is mainly involved, na? Mutrasya Kleda Vahanam, isn't it? So how actually the Samprapti
Yes,
is
sir.
changing from Staulya to Prameha? And in metabolic syndrome, can you, do you know why they have mentioned only the fasting blood sugar, not postprandial? In the diagnostic criteria, you have mentioned diagnostic criteria, isn't it?
Yes, sir.
Hmm?
Yes,
What do you
yes.
think? What do you think? They could have mentioned raised blood sugar levels. It can be anything. Why it should be only fasting? They have to specify. Think about it. Okay.
Yes.
Thank you.
Thank you, sir. Thank you, madam. And we move on to our next presentation by Dr. Joel. Presentation is on sleep, a lifestyle pillar for male reproductive health, Ayurvedic perspective. Dr. Joel.
Yes, ma'am. Am I audible, ma'am?
Yes, you are audible.
Shall I start, ma'am?
Yes, you can start. Mr. Joel, you can start. Yeah, Dr. Joel.
Okay. Good afternoon, all. Welcome to the presentation. Myself, Joel L. Joy, under the guidance of Dr. Jidesham, Professor and HOD Department of Kaya Chikitsa, VPC Ayurveda College, Kottakkal, presenting the topic on sleep, a lifestyle pillar for male reproductive health and Ayurvedic perspective. We all know that a 6 hours of minimum sleep is needed for the healthy human being survival. But unfortunately, 35% of the total global population is suffering from lack of sleep. Among them, 5 to 7% are night shift workers. We all know about the importance of circadian rhythm, importance of melatonin and pineal gland, suprachiasmatic nucleus, and the prostaglandin secretions, etc. The sleep cycle are they are NREM 1, 2, 3, and REM cycle. These are well aware of them. But when we discuss about the sleep deprivation and the metabolic effect, it may affecting various systems like endocrine system, gastrointestinal system, nervous system, cardiovascular system, etc. When, as per my presentation, how these sleep deprivations affect the seminal parameters. Certain studies suggesting that sleep disturbances contribute to affect our sperm concentration, total sperm count, motility, morphology, and even testis size. There is studies suggesting that a low-grade chronic inflammation leading to formation of reactive oxygen species and causing cellular damage in the reproductive system. Also, the formation of anti-sperm antibody by sleep deprivation, damaging the sperm and causing reduction in sperm production and sperm motility. Also, oxidative stress in the testicular microenvironment causing poor sperm parameters. We will discuss about some Ayurvedic parameters like Jagrana is causing Vyanavada Dushti and Pakvashya Vada, leading to Pakvashya Vada Roga. Then Nidra Vidharana leading to Udanavada Dushti and hence Bela is affected. Ruksha Sevana, it causes Vyana Dushti and Pumsato Brahmsa is one among the lection of Vyanavada Dushti. Also, we all know, I am well aware of the Abhana Dushti directly causing to the Shukra Dosha. Ayurveda describes Roga as Sharirika and Manasika. Here, stress and sleep deprivation and they are counteracting, which means sleep deprivation leading to stress and it may also lead to infertility. The infertility part also leading to stress and may be causing sleep deprivation and forms as a cycle of events. Also, the triad of Agni, Ojas, and Manas is crucial in the management of infertility and it affects the triad. Agni is counteract with the Ojas and Manas, and these three will counteract with all these things. By this, Shukra and Nidra are very evidently affecting these parameters. Here we will be discussing in three domains like functional aspect, causal aspect, and the management aspect. The functional aspect, we all know that Sukha, Tushti, Bala, Jnana, Jivita, and Vrishada are the functional aspects of Nidra, and scientific studies are available in this regard. Also, in the causal aspect, Dukkha, Karshya, Balahani, Ajnana, Marana, and Klibata are the causal aspects of Nidra Nasha. When we are discussing about the Samprapti, the probable Samprapti where the Viharas like Ratri Jagarana or Sopna Vivriya causing Agni and Samanavada Dushti, which may be leading to Rasa Dushti, which affect Vyanavada and Udana, leading to Shukra Dushti. Also, Agni Dushti affects Pakvashyavada, then Abhana Dushti and affects Prana. Also, Rasa Dushti affecting Dhatu Parinama and maybe leading to eventually leading to Majja Dhatu Dushti and finally Shukravada Dushti. And it can be manifested as Chena Shukra, which is Vada Pitta predominant, Shukra Gada Vada or Shukravada Vada, which is Vada predominant in nature. So in this background, how we can manage a patient or an infertile male patient with impaired seminal parameters? When we assess the sleep and perceived stress, we can assess the sleep with the Pittsburgh Sleep Quality Index scale and perceived stress with the perceived stress scale. If we found an association, if there is no association, we can manage based on dosha, nidana panchaka. We can use vajikarana chikitsa, whichever treatment we can use there. If there is an association between nidra and their impaired seminal parameters, we should avoid that nidana parivartana. We should advocate them about the nidana parivartana and samprapti vikatana. That Nidra Nasha Chikitsa and Nidra Vegarodha Chikitsa can be incorporated here, which include Udvardhana, Snana, Abhyanga, Murtha Daila, Mano Anukula Vishaya, etc. Also Kaya Sega, which is mentioned in one of the Kerala textbooks, which can be used in both the conditions of Nidra Nasha as well as Shukra Vegarodha Jini or Shukra Nasha. Also, if the patient is Shodhana Arha, then we can do Shodhana, then Sneha Sweda. If Shodhana Anarha, Shamana Chikitsa can be done. After all these, Vajikarana Chikitsa should be done. Moving to the conclusion, Saumanasya is the Agriya for Garbhadharana. Saumanasya is one of the qualitative factor of sleep also. Prayovastambha, we all know that Ahara, Nidra and Brahmacharya, which maintains the healthy sleep, and sleep can be used as a curative and promotive aspect in various health domains. Assessment of sleep is essential in the basic screening of fertility management and advising a sleep hygiene for these kind of infertile couples is essential in this era. And that association of other factors has to be studied, and the causality is not yet proved. That Nidra Nasha directly leading to or directly causing seminal the disturbances in seminal parameters, the causality is not proved. That is why there is further researches like RCT has to be conducted. These are the references. Thank you.
Dr. Joy, everybody is talking about sleep. You have to sleep.
Yes.
But whether it is the quantity or the quality of the sleep that matters.
Thank you for the question, ma'am. Actually, both these parameters matters. Both the quality and quantity matters. If some days ago one patient come to our OP, suggesting that they sleep, he sleep for almost 8 hours, but it is not satisfactory. That is, in that patient, the quality of the sleep is affected. In another patient, maybe in another patient, the quantity is also may be affected. That is why the studies, latest studies also suggesting that both the quality and quantity of the sleep has to be addressed in this regard, ma'am.
So what is the actual quantity and the timing that you suggest?
Okay. Actually, in Ayurvedic perspective, the sleep is sufficient when there is a quote like Sukha Sopna Prabodhanam. That is the key we want to identify in Ayurvedic terms. But in modern statistics or modern scientific studies suggesting that a minimum of 6 to 8 hours of sleep is mandatory for all working human beings. That is why that hours of that minimum hours of sleep is essential for the healthy survival of human being, ma'am.
Yes, but if students like you sleep at 3 o'clock in the morning and then sleep for 8 hours, will it be metabolically fine to give you a good quality Shukra Dhatu?
No, of course, man. No, it is a relevant question in this era because many of the youngsters, especially Gen Zs, that 90s, that those people slept by 1 o'clock or 2 o'clock and awakening by 9 a.m. only. That's an issue actually because the circadian rhythm or the Ratri is a crucial factor because in Ashtanga Hridaya it is mentioned that Ashtanga Hridaya Anaraksha Adhyaya it is mentioned Ratro Jagaranam Ratro Jagaranam Doksham Snigdham that is the mentioned now. That is why if we are waking or if we are awake till 3 a.m. or 2 a.m., it may causing the rukshada in the body, which may eventually affect the Shukra Dhatu also. That is why it may be causing a rukshada to Shukra Dhatu and Shukra Dhatu Kshayam also may be happen. Some of the patients come to our OP, they are practicing football or any games in turf during late night, especially up to 12 a.m. When we examined them, they came to our OP for the infertility management. Unfortunately, we checked for these things, but no other factors was there. This is the only factor we elicited from that patient. That is why in this era, we should advocate patients regarding the healthy sleep hygiene and importance of sleeping on time, especially before 10 or before during 9 or 9 to 10. We should advocate those patients regarding the importance of that timing of the sleep.
Yes, I expected that in your presentation, which was lacking. It is the first part of the night that you have to highlight as a quality. There he has to sleep, not the quantity. And even if the quality is good and it is the daytime, he is waking up at 11 o'clock. That quantity doesn't matter to the health, right?
Yes, ma'am.
So that
Yes,
had
ma'am.
to be highlighted in your presentation.
Yes, ma'am. Thank you, sir.
Dr. Joel,
Yes, sir.
I think you are a PG student, no?
Sir? Hello, sir. I'm not audible. Hello, sir.
Hello.
Yes, sir.
You have any data regarding those who are coming with that infertility like that? So when you are taking the history, is there any data who is percentage are having sleep related problems?
Sir, I couldn't comprehend your question because it is somewhat missing the audio, ma'am, sir.
No, when you are seeing the patients of infertility, have you taken any data how many percentage of these patients having sleep problem, those are having infertility?
Okay.
So, you have taken any data, you have any data related to these things?
Okay, sir. Sir, regarding the data, we just observed in our infertility OP or in our OP settings where the patients coming with infertility or impaired seminal parameters, we observed that 30 to 35% of the patients are having some kind of sleep deprivation. That is the data we are having, but we didn't publish it anywhere because the causality or something has to be proved. That's why we didn't publish. But in our experience and observation, it is found that 30 to 35% of the patients are having sleep deprivation with these impaired seminal parameters, sir.
So in present era, maximum those are having night duty or some other problem, night duty specifically. So how you will manage if they are having this type of problems? either supervrushti or infertility. So what do you advise to these type of employees?
Sir, actually, that is mentioned that we want to educate them about the importance of sleep, educating them about the need of night sleep. But unfortunately, now these people are having less sleep, especially during night. So we want to advocate them, as mentioned in the Ashtanga Hridaya Sutrasthana Anyarakshadhyaya. We should advocate how many hours of sleep that is lost during that night. Half of the amount of that time should be slept in the daytime. But that has to be in an atmosphere that mimicking the night, because a room with a sufficient amount of light in the daytime sleep, it is no use at all. And as ma'am told, it is qualitatively and quantitatively affecting the sleep. But instead of that, we should suggest them regarding an atmosphere which is similar to night, or which is mimicking night, that thing covered, the light should be covered, and sound, the room should be a soundproof, or that thing has to be fixed. Also, another thing is abhuktavan, that abhuktavan, the content is mentioned in Ashtanga Hridaya. That means without having a heavy food, we can suggest them to sleep in daytime, sir. These are the three factors which has to be checked for these kind of persons, sir.
Thank you, doctor.
Yeah,
Thank you.
Dr. Joel,
Yes, sir.
it was a good presentation.
Thank you, sir.
When you see your patients, you maintain your sleep diary?
I usually suggest them to maintain a sleep diary. Not at all, not only the sleep diary, but regarding most of the patient, I would suggest them to keep a daily chart for their exercise, for their diet, for their
What you ask them to record? What you record? How you record that sleep diary?
not only the sleep diary, sir. All these things has to be included. Also, in that part, sleep diary is
What is
included.
sleep latency? Sleep onset? SOL.
Sleep latency is the period between we are going to bed and the time taken for getting that sleep, sir.
VASO?
Sir?
VASO, WASO.
Sir?
VASO, WASO.
WASO. Sorry, sir. I think wake up after. Yeah, sir. That's it.
Okay, and as Madam rightly asked, and you responded, like Sukhanitra Prabodhinam.
Yeah.
Actually, it is Sukhena Pratibodhinam.
Yes, sir.
Where it has been mentioned?
In the Arogya Lakshanam, sir.
Arogya Lakshanam. And what are the other two Arogya Lakshanas mentioned with respect to Nidra?
Sir.
Sukhena Pratibodhinam is one. There are other two Lakshanas mentioned with respect.
Sukha Swapna Prabodhana?
No, that you already mentioned. That Swapna word is not there. Actually, it is like Nidra Labho Yatha Kalam.
Yes, sir. Yes, sir.
Yeah, that is the thing which I think Madam wanted you to mention. Nidra Labho Yatha Kalam. So the nighttime Nidra, Bhutadatri Nidra, Ratri Swabhava Nidra, isn't it?
Yes.
And the second is Vikaranam Cha Swapnanam Adarshanam.
Adarshanam, yes, sir.
Kena Pratibodhanam.
Yes.
Yes. So these three, that Dhatu Samya Lakshanas, it has been mentioned.
Yes, sir. Yes.
And what sleep hygiene you advise to the patients? How you advise? You have mentioned
actually,
sleep hygiene. Yeah.
Sir, regarding the timing, I advocate something. Then regarding the food and that food diet, especially diet before sleep, I
How
usually
many hours
advocate
of
them.
gap you advise to your patient
I
after?
usually advise 2 to 3 hours of gap, sir.
Okay. And what are the other factors you advise?
I usually advise them to avoid using coffee, usage of alcohol, using cigarette, etc. Especially in the night time before sleep,
Okay.
that has to be avoided. These are hindering the quality of nidra or sleep. That's why I advocate them to avoid these things. Then
Screen time?
sir,
Screen time?
screen time, of course, sir. Screen time. I usually tell patient to avoid screen time by at least 1 hour before the sleep. But
Okay.
studies are suggesting 2 hours before sleep, you should not use any kind of screen. But I usually suggest them for a minimum of 1 hour, sir.
Okay. And if a patient has gone to bed, he or she is not getting sleep, what the patient should do?
If they are having a chronic or a long history of this kind of
No,
insomnia,
whether they should still be in the bed or not.
yeah, in my opinion, the person should be in the bed, and he can do some kind of meditations in the bed itself. That may be some techniques or meditative techniques can improve their sleep in that time itself, sir.
Okay, thank you. Good.
Thank you, sir. Thank you.
Thank you, sir. Sir, we'll move on with our next presentation. Dr. Arun Kumar on Agni and Teja, the metabolic and diagnostic fire of life, and Ayurvedic and scientific correlation. Dr. Arun Kumar.
Yes, ma'am. Am I audible, ma'am?
Yes. You share your screen. Start with your presentation.
Okay. Okay. Am I audible, ma'am?
Yes, you are audible. Keep in presentation mode.
Good afternoon, everyone. I am Dr. Arun Kumar B. Reddy, PG Scholar, Department of Kriya Sharira, SDM Hassan, under the guidance of Dr. Pratibha Kulkarni, ma'am, Professor at HOD, Department of Kriya Sharira, SDM Hassan. Today I am going to deal with the topic Agni and Teja, the metabolic and diagnostic fire of life, and Ayurvedic scientific correlation. Coming to the background of the study, where the metabolic syndrome, in which the global rise of metabolic syndrome demands the non-invasive early diagnostic tools. One of the diagnostic tool which I have taken is Agni, is the core regulator which governs the life, strength, enthusiasm, and the prabha. Tejas as a biomarker, it is the nothing but the Agni as a biomarker. The subtle Agni is diagnosed externally as the prabha at visible radiance. Prabha is the clinical observation that aligns with the mitochondrial activity and the ultra-weak photon emission. We can see there that Visargo Adana Vikshepai, Soma Surya Anilayata, Darayanti Jagadeham, Kafapitta Anilastata. According to Loka Samya Purusriddhanta, where the Surya does the Adana Karma, which holds the energy and transforms the energy. In the same way, Pitta does the transformation of energy and sustaining the energy. Where the Pitta is nothing but the Agni, where the Agni Tattva is present, we can see the Ayurvarno Balam Swastan, Utsaha Upachayo Prabha, Ojas Tejo Agnaya, Pranachukta Deagni Hetukaha. By seeing the Varna, Prabha, Teja, and the Bala, Swasthya, we can see that how the Agni present in the person, from which the metabolism also can be estimated. It emphasizes the central role of Agni, maintaining the oral health and the well-being. Coming to the materials and methods, I have collected the information from the Brihadrais and also modern research on metabolism, mitochondrial activity, thermoregulation, ultra-weak photon emission to interpret Tejas in the scientific terms. Coming to the Ayurvedic descriptions linking the Agni, Pitta and Teja, here I am going to tell that Agni and Pitta are same, where the Agni Tattva is present in the Pitta also. By saying if the Agni is Kshina, that is Kshina Guna of Agni, by using the Samana Dravya Upayoga, we can kindle the fire. That is nothing but the Agni. If the Atiruta Agni Guna, we can use the Shita Kriya Upayoga so that we can reduce the Agni Tattva in the person. In the same way, if proper Agni Pitta is there, it leads to Tejas, which is the Sarvadahika in nature, can be externally observable manifestation through the Prabha. we can see the Pitta Karma, that is Pitta Paktushma Darshanaihi, Kshudru Ruchi, Prabha Meda, the Shaurya Tanumardavaihi. Coming to the core aspect of Tejas, where it is nothing but Teja Prabhave Deeptaucha Bale Shukre. It is also called as Teja Parakramaha and Teja Shuklantanam Dhatunam Sneha. It is the Sara, that is essence of all the tissues. And Jyoti Sakala Sharira Antargataha Tejaha. And Jyoti is nothing but the Agni. And it is also considered as Drushtis Tejomayi Prokta Shukram Tejascha Kevala. Altogether, we can consider that it is Tejas is nothing but Agni, that is glory, heat, Shukra Dhatu, vigor, spirit, energy, and the nutritive essence of all the tissues. The essence or the fire situated within the entire body. We can also know the synonyms such as Shukra, Tejas, Retas, Prabha, Ruchi, and Deepti and Ojan. From this, we can tell that Agni and Tejas is nothing but all are same, which leads to externally manifestation, that is Prabha, which is the diagnostic indicator of the Tejas. Coming to the definition of Prabha, Prakarshena Bhati iti Prabha. Pra means excessively and Pa is to shine, that which shines brilliantly. Asanna Lakshate Chaya, Prabha Durat Prakarshate. It is nothing but the radiance, light to shine or to illuminate or luster. We can see that instances where Prabha gets affected due to the impaired Agni of metabolism. In case of Pittakshaya, Mandoshma Agnita Nishparvatacha. In case of Pitte Mando Analaha Shitam Pravahani. Pravahani is nothing but the Kanti Nasha. In case of Raktakshaya, that is Vigata Kanti, which the symptom we are going to see. In case of Linganasha or Tingira, it is Nishprabha or Hatadarshana. Nishprabha Hatadarshana. It is nothing but if the metabolism or the Agni is hampered, the Prabha gets affected. That is loss of radiance, dullness, lacking glow, pallor, loss of vision, loss of sparkle from the eyes. Till now, we have seen what Agni is and Pitta, how the similarities between Pitta and Agni and Tejas and the Prabha. Now we are going to see the Agni Vyapara, and in terms of Tejas, that is through mitochondria, which is the cellular firehouse. Microcosmic expression of Agni is mitochondria, where the oxidative phosphorylation takes place, is oxidized to form ATP. Oxygen reacts as the final electron acceptor, analogous to Agni Sandukshana by Vata. This biochemical fire produces both energy and the Ushnatva. In case of thermoregulation, brown adipose tissue that is undergoing the non-shivering thermogenesis dissipates the chemical energy as heat. That is nothing but the Ushma at the tissue level. By seeing this both of mitochondria and thermoregulation, further ultra-weak photon emission, which is in where the reactive oxygen species cause the other molecules to become excited, carrying the excess energy. It is the same energy that causes the light to be emitted from the person. It is nothing but can be considered as the Prabha from the person. We can see by taking some examples, we can see here that obesity is nothing but Staulya, where the accumulation of Kapha and Ama due to the Mandagni takes place. It is leading to the external manifestation that skin appears oily, heavy, or dull due to the metabolic waste accumulation. In case of diabetes, that is Prameha, the impairment of Meda and Kapha imbalance leading to metabolic overload, leading to the external manifestations such as radiance, is displaced by the sticky, pale, or excessive oily appearance, signaling the poor glucose metabolism. In case of Rakta Dushti, that is Visheshana of Rakta Dhatu and Pitta, where the skin may show excessive redness, heat, or inflammation, reflecting the Agni Dushti. In case of anemia, where the Hatha Anala, that is Agni failure, leads to Raktakshaya and Dhatu Shitilata due to the Agni Dushti. It leads to the external manifestation such as Vaivana and Vigata Kanti. By this, we can conclude that Agni, which is the main indicator of the life, leads to the Tejas, which is Sararika in nature, and it leads to the external manifestation, visible manifestation in the patient, such as Prabha. From this, we can conclude that Teja symbolizes the perceptible outcome of balanced Agni. And integrating the Teja-based clinical observation with modern metabolic evaluation offers a holistic approach to health assessment. Thus, the Agni represents the foundation of metabolism, and Teja, its radiant glow, serves as a vital diagnostic reflection of internal vitality and well-being. Many studies have suggested that all humans emit the subtle light until they die, which can be correlated with that of Tejas through the Prabha. In our acharyas have told that the all humans emit the subtle light is nothing but Shante Agnum Riyate, Yuktam Chiram Jiva Dhanamaya, Rogi Sad Vikrute, Moolam Agni Tasman Niruchate. these are the references from which I have collected the data. Thank you.
Dr. Arun, you have
Yes, ma'am.
you have mentioned in one slide where Prabha and Linganasha you have correlated.
Ma'am, it is nothing but Timira and Linganasha.
No. Can you go to that slide, please?
Yes. Yes, ma'am.
Linganashe api ta nishprabha hatadarshana. It means loss of vision. It is not loss of prabha.
Yes, ma'am. If Prabha can be understood in terms of Drushti, I have taken like that, ma'am, here.
How can you take prabha as drushti?
Ma'am, external visible manifestation Prabha can be taken through the skin and the eyes. If clearness in the eyes is there, means we can take it as Prabha now. Like that I have
But
taken.
here, it is not about his eye they are talking, it is his vision they are talking.
Yes, ma'am.
Hatadarshana, Nishprabha, all that is not his eye, but his vision. So Prabha is seen in the eye, right? As per your version.
Yes, ma'am.
I didn't understand how this exactly can be correlated.
For the Drushti, the same Alochaka Pitta is responsible for Drushti and the same Prabha, ma'am, in terms of eyes. So I have taken like that. If the
So
Alochaka,
theoretically, whatever you might tell is correct, but practically, how can you correlate them? See, Prabha will be correct if all the three doshas are in balance.
okay.
It's not only about the pitta, isn't it?
Yes, ma'am.
You are healthy when tridosha balance is seen.
Yes,
So
ma'am.
when you are healthy, your prabha is properly seen.
Yes, ma'am.
Your prabha will be attractive only when you are healthy.
Yes.
Right? So it is
Yes.
the tridosha balance that is required for a really good prabha. It is not only pitta. You have focused yourself only on pitta. Pitta and Agni are two different things. I suppose you know it. Right?
Yes, ma'am.
And in one slide where you have highlighted the Agni, that table is you have made, I think next slide or next to that.
This one, ma'am.
Here in the center, diabetes and inflammation, that row, why have you considered impairment of Meda and Kapha in Agni relation or vitiation of Rakta Dhatu and Pitta in Agni relation? I did not understand.
Ma'am, here I have considered the Datvagni Mande or Agni Dushti in Datvagni level. I have taken into consideration.
But Kapha is not Datvagni.
Kapha is involved in causing the disease of Prameya. No? Like that I have considered.
But Prameha is Tridosha Vikara. Why
Yes, ma'am. Of course it
highlight
is.
only one dosha? See, I don't understand why only one dosha you consider when you talk about Prabha. It is not one dosha. Balance of Tridosha is required. Okay.
Yes, ma'am.
Thank you.
Hello.
Yes, sir.
So I have just one doubt regarding the Prabha. You had mentioned which is the visible radiance. So have you any assessment pattern, means any pattern or scoring pattern like that to assess the Prabha?
Sir, I have not gone through any assessing pattern of Prabha. I have to search about that, sir. Just I have exhibited the theory which can be. taken from this. Only I have worked upon the theory. I didn't search any assessing tool for the Pravas.
Okay. And in the last you mentioned one last slide you go. No, before that. Many studies, no, last before the last slide. Here many studies has proven that all human emits suffer light immediate die. So we have any studies like that?
I have searched the articles, sir. Some studies have been done in terms of modern, but in Ayurveda, such studies has to be conducted, sir. So I have correlated Agni and Tejas and the Prabha in terms of the light emitted by the persons.
No, what the modern studies say regarding this, what you quoted here?
Yes, sir. Here I have mentioned that this modern studies talks about the ultra-weak photo emission. That is nothing but the way metabolism takes place. In that, reactive oxygen species cause the other molecules to become excited, carrying the excess energy. It is the same energy that causes light to be emitted. The studies have been suggested like this.
Thank you.
ये रचना वाले सारे के सारे भी ये रचना शरीर
Yeah, again, can you please go to this, metabolic disorder, Agni slide? I think the concepts are still not clear. If you see Staulya, you are mentioning Mandagni.
Okay, sir.
Yeah, see, Staulya is a unique disease, which is a typical example of understanding the concept of wherein the Jatragni is actually Tikshnagni, isn't it? And the Medo Dhatwagni can be Manda, but Jatragni, at the level of Jatragni, Acharya has mentioned it as Tikshna. So you see that there's a concept, Vikruti Vishama Samaveta, isn't it?
Yes.
There's a Prakriti Sama Samaveta. In Prakriti Sama Samaveta, if you see the understand the physiology, there is if the Jatragni, Dhatwagni, it is depending, isn't it?
Yes,
If it is Tikshna, it is Tikshna, but it is happening in a Vishama. So the Vikruti Vishama Samaveta, that is the Samprapti which is happening in Staulya, which every one of you need to understand that. That's why there is a Koshtagata Vata which is getting vitiated. That's how the Avarna is manifesting and increasing the Jatragni. That's why Acharya is, if you see the line in this, that Nitya Adhyaya, Acharya is specially mentioning like Vatagnya Annapanani Shleshma Vedo Aranisha. Rukshoshna Vastaya Tikshna, Rukshan Udvartananisha. So first Acharya is telling remove that Vata, which is actually getting vitiated, which is doing all this problem, isn't it?
Yes.
That's why the Vasti, that's what Tikshna Vasti has been mentioned. So the Mandagni with relation to Staulya is at the level of Dhatwagni, not at the level of Jatragni.
Okay.
That every one of you need to understand that. And as Madam has rightly mentioned, you can't go with a single dosha. Prameya itself is a tridosha. You can mention that I am trying to correlate with the Kapha Pradhana Tridosha Avastha with this so and so. But you can't forget the basic concepts, isn't it?
Yes, sir. Yes.
Yeah.
Thank you, sir. Thank you, Dr. Arun Kumar. With the permission of chair, I request Dr. Soumya to present if she is technically ready. Dr. Soumya,
Yes, ma'am.
are you
Am
ready?
I audible, ma'am?
Yes, yes. Share your screen.
Yes, ma'am. Whether my screen is visible, ma'am?
Yes, Dr. Soumya. Serial number 8, she will be presenting on Ayurvedic perception into metabolic disorders, a critical analysis, Agni Dosha. Dr. Soumya, you can start.
Yes, ma'am. Good evening, everyone. Myself, Dr. Soumya, second year PG scholar, Department of Panchakarma. My topic is a critical analysis of Agni Dosha Dhatu in Kaphaja Prameha vis-a-vis diabetes mellitus is guided by Dr. Varsha Kulkarni, Professor and HOD, Department of Panchakarma, GMC, Mysuru. Introduction. Diabetes mellitus can be considered under Kaphaja Prameha characterized by increased frequency and turbidity of urination. It covers a wider spectrum of conditions involving the disturbance in the metabolic processes, and highlighting its importance, it is considered under Ashtamahagadas. In India, the prevalence of diabetes is 10.5% in 2025, and 1 in 7 adults has diabetes and 43 are undiagnosed. Ayurvedic perspective offers a deeper etiopathological understanding concepts of Agni, Dosha, and the Dhatu. The pathogenesis begins with the weakened Agni, primarily affecting due to the lifestyle factors, later involving doshas and other dhatus. So understanding the Agni, the Pachaka Pitta does the Bhakti-Ushma Darshana, Kshitrashna, and Pachana of the Anna, Vibhajana, Sarakrita, Prataktata. Then Kledaka Kapha does the Anna Sangata, Kledanath. Then Samanavata does Grahana of the Anna, Pachana, Vivechana, and Munchana. In the same way, the pancreatic secretions does the breakdown of proteins, lipids, carbohydrates, and the endocrine secretions like insulin does the lowers the blood glucose, and glucagon raises the blood sugar. In the same way, secretions does the gastrointestinal motility decreation and regulating the pancreatic secretions and stimulating the appetite. In Kaphaja Prameha, mainly the Jataragni Mandyata due to the Asisuka Supna Sukadi Nidanas does the Madrasita Alasya Malakayata Nidrata, then Prabhuta Avila Mutrata. In later stages, due to Avarana Janita and Sroto Dushti, Tikshagni will be there. There we can see Mukatalu Kantashosha, Atikshdatta, Pipasa Avastha. Then Samanavata Dushti having the Anaha Shakrit Graha, and Pachakapitta Dushti having the Kshutrashna Tivrata, and Kledaka Kapha Dushti having the Agni Sadhana Gauravadi Lakshanas. So here there are also Prithvi Agni Mandyata and the Jalagni Mandyata. Considering the endocrine pancreatic insufficiency due to loss of islet, acinar axis, nerve damage, and inflammatory and fibrosis of pancreatic tissues and other reasons, there will be dysfunction in the digestive enzymes. So, Dhatu Agni Mandyata, in simultaneously or the one after the other, there will be symptoms seen are Ashradata, Aruchi, Asyapakata, Tvakvikara, Puti Mamsasa, then Madhura Asyata, Mukatalu Kantashusha. These lakshanas can be seen. In diabetes mellitus, due to complications, there will be neuropathic, dermopathy, and the foot ulcers or the adipose tissue dysfunction. These symptoms can be seen, or these conditions can be seen. So consideration of the Dhatu, consideration of dosha in the Kaphaja Prameha, it is not the Alpadrava Kapha, it is the Bahudrava, Shleshma is involved here, and Kledaka Kapha is affected, causing the Agni Sadhana, Praseka, Alasya, Gauravata. These lakshanas can be seen. In metabolic alkalosis, due to the excessive exocrine secretions, there will be muscle twitching, nausea, vomiting, weakness, fatigue, tingling sensation, etc. symptoms can be seen. So here, Kapha and Kleda having the similar gunas due to Nidana Sevana, there will be Bahuta of Shleshma and the Kleda. These enter into the Mutravaha Srotas, then Srotravaroda, and Kleda Sanchay in the Basti, causing the Prabhuta Avila Mutrata. Glucose having the similar characteristics, its increase in the blood, causing the hyperglycemia. There will be decreased reabsorption in kidney, then high concentration of glucose in urine, causing the diuresis. So consideration of the Dhatu, Bahuta of the Chala Dhatus and the Abhaddata of the Sthira Dhatus can be seen here. Dushi Visheshas having Madhura Snigdha Drava Guru Saragunas, similar to the Kapha, initially causing the Santarpadajanya Prameha, later due to Avarana and the Vata Dosha involvement affecting the deeper Dhatus, causing the Apatarpaka Prameha. Here Dhatus are in the Shitila Avastha. It can be considered as Anivida Samiyogiya, that is, the compactness of the dhatus are lost. The simile is given. Gap between two threads due to the improperly knitted. So in diabetes mellitus also, in later stages, there will be diabetic neuropathy, dermopathy, and adipose tissue dysfunction. Then bone mineralization disease and sexually dysfunction can be seen. to discuss with Prameha, mainly caused due to the Agnimadhyata, formation of the Ama and the Srota Avaroda, causing Tridosha Vaishamyata and the Dhatu Vaishamyata. It can be correlated with the improper insulin secretions or the other endocrine and exocrine secretions from the pancreas. In modern aspect, they will be prescribing metformin to reduce the glucose production by the liver, and sulfonurins to stimulate the pancreas to produce more insulin, and glitazones to increase the sensitivity to the insulin. In Ayurveda, considering the Ama Lakshana and the doshas involved, Deepana Pachana Srotoshodhana can be given if Ama Lakshanas are seen. It does the Pachana, Dahana, Bheda, Sangata, Tapana, Parinama, that is conversion, then Paravritti, transformation. If Kleda, Kapha Kleda Vriddhi condition seen, where we can adopt Deepana, Pachana, Shodhana and Rukshana. If Pitta Vriddhi Lakshana, later stages, if Pitta Vriddhi Lakshanas are seen, we can adopt for Shamana and the Shodhana. In chronic cases, Vata Vriddhi will can be seen. In those, Brahmana Shamana type of therapies can be adopted. By adopting all these therapies, there would be Agni Samyata, Dosha Shamana and the Dhatu Prakritata, and Srota Shodhaka can be seen, and Kleda Nirharana. To conclude on this, Prameha, mainly Kapha Prameha, is a comprehensive metabolic disorder. Here, intricate interplay of the Agni dosha and that can be seen. So here, pathogenesis mainly starts with the Agni Mandya, involving the three doshas, mainly the Kapha dosha, then damages the dhatus, leading to excessive excretion and the eventual tissue wasting. So clear understanding of Agni Dosha Dhatu is essential for effective treatment and to determine the prognosis of disease. Thank you.
Dr. Soumya, can you put the slide just before the dhatu?
1 second, ma'am. Yes, ma'am.
Hello?
Yes, ma'am.
There is mention of defective insulin level in this slide. What do you mean by defective insulin level?
That means improper level of insulin secretion.
What does that mean?
There is no sufficient secretion of insulin.
Is that so with diabetes mellitus type 2? My second question is,
yes, ma'am.
How can you understand dhatu shithilata? Which dhatu? What type of shithilata? How can you practically visualize them?
In Medo Dhatu, we can see Sthirata Adi Gunas, ma'am.
Which gunas?
There would be Sthirata and Snigdhata in those.
Sthirata? If there is sthirata, why would acharyas talk about shithilata? Thank you. Sir?
Ashwin, sir? Okay, thank you, Dr. Soumya.
Thank you.
Vajreshwari, you can share your slide on our mail and present tomorrow if you want.
Yes.
Okay, doctor. We have come to the end of the session 6. Dr. Ashwin, sir. Okay.
Madam, what about the other person? Amulya?
Amulya, she was not online only, ma'am. She's not there.
Acha, okay.
Yeah.
Amulya?
Hello.
Are you there? Vajreshwari?
Yes,
Okay. Okay, you can present.
Ma'am, is it?
Yes, you start. Go to presentation mode and you can start.
Screen is visible, ma'am.
Yes.
Serial number 6.
Yes, ma'am. Good evening, ma'am. Myself, Vajreshwari, second year PG scholar, Department of Kaya Chikitsa, Sushita Medical College, Bangalore. Today's my topic, presentation topic is Ayurvedic Insight and Management of Metabolic Disorders. So these are the contents. So coming to introduction, metabolic syndrome is a cluster of lifestyle-related disorders, including insulin resistance, central obesity, hypertension, and dyslipidemia. So according to statistics, between 25% and 33% of Indian urban population is affected by mainly by metabolic syndrome. So metabolic disorders have 32% to 40% higher chance of developing either type 2 diabetes or cardiovascular disease or both. So in Ayurvedic, these metabolic disorders we can link to the Medo Pradeshaja Vikara, Santarpanotta Vikaras, and Nama Pradeshaja Vikara. So Santarpanotta Vikaras primarily resulting from a sedentary, stressful lifestyle and unhealthy dietary habits. So these factors exacerbate Kapha dosha along with Ama, Mamsa Dhatu, and Meda Dhatu, leading to Prameha, Atistaulya, Shota, and Dhamani Pratyachaya. So Ayurvedic management of metabolic syndrome emphasizes a holistic approach involving Nidana Parivarjana, Samshodhana, along with proper follow of Dinacharya, Ritucharya, Yogasana. This helps to prevent the disease progression. So Nidanas, we can take here Haraja like Guru, Atisnigdhara Sevana, Atimatra Sevana, Atyashana, and Navina Anna, etc. Coming Viharaja, Vayama, Divasatna, Atinidra, and Achinta, Annaja, Sahajar, Kulaja, and Snigdha Udvartana, and Madhu and Guru Basti Prayogam. So some of the diagnostic criteria for metabolic syndrome. So here are there, if in male, if waist circumference is more than 1 or 2 centimeter, and there will be raised triglycerides more than 150 mg per dl, and low HDL cholesterol less than 40 mg, and hypertension more than 130 by 85, and fasting plasma glucose if it is more than 100. If any in these 5, any of 3 criteria will be present, it is diagnosed as a metabolic syndrome. So coming to Samprapti in Ayurveda, due to all of the Santarpanotta aharas, that is increased Santarpanotta aharas, it causes Ama Utpatti and Kafadosha Avruddhi. It leads to the Dhatvagni Janyama. Dhatu Mala Sanchaya takes place Rasa Rakta Mamsa Medas, and there will be increase in Kledamsha. So if the Kleda is takes Stana Samsha in Basti, it leads to Prameha, and Shotarodha Avana Fayu takes place, and it leads to Agniveshama, causes Staulya, mainly Stanasti Kudara, and Kleda Medo Dhatu, it circulates in the Shrotas, it leads to Dhamani Pratyachaya. Due to Vana Prakopa, it leads to hypertension. So coming to modern pathophysiology, physical inactivity, lack of exercises, and due to some genetic causes, there will be increased visceral obesity. So and along with another, some of the organs will be affected, like liver fat and pancreas fat and muscle fat will be developed, and these condition leads to the hypertension and cardiovascular diseases and obesity. So coming to Chikitsa Siddhanta, for in Nidana Paradina, the first line of treatment told by Rajaras, followed by Samshodhana, Samshamana, Patya, Rasayana. Here Patya plays major role to prevent metabolic disorders. Like Patya mainly drugs which is having Tikta, Kashaya, and Katurasa. These improving the helps to reduce the Meda and improves the Agni. So Viharas, Vyayama, and managing stress, etc. These helps to reduce the excessive fat and improves the overall metabolism. So coming to discussion here, Shodhana treatment like Lekana Basti and Rutu Videchana and other Apakarshan techniques are helpful.
in metabolic disorders, the main pathological factor is disturbance of Agni. First, we have to concept on the, we have to treat the Agni. So, Chitrakati Vati, Rigato Chuna, Pipale Chuna we can use for increase the Agni. So, different yogasanas are helpful because it creates the balance between both nervous and endocrine system. Directly and indirectly influences all systems and organs of the body. So, in some of the Ecommolecular drugs like Guduchi, Amalaki, Haridra can helpful to increase the Dhatu Sara, that is OJS. So Karshana prasanas like Bhallataka, Gugulu, Vardhana Pipali. So these are helpful in disease preventing. So here Lekhana Karma, in Lekhana Basti we can use Lekhana, Triphala, Madhu and Kashaya Tikta Dravya. So these drugs having mainly Lekhana Karma, those reduce the excess fat accumulation and it acts as Agni Deepanam. So by Shodhana, it acts as Shodhana and Dosha Samhita. It reduces the both kapha and vata dosha. Some of the shamanaushadhis like Medohara Gugulu, Punanava Guguli, and in hypertension Sarpagandhavati and some of and Arogyavadini Vati can be used. Rasaushadhis like Basmat, Abhraka Basma, Luha Basma, and Bhotvata Chintamani can be useful. The conclusion, metabolic disorder syndrome is one of the major health hazards. In Ayurveda, the concept of metabolic syndrome can be correlated and taken under the heading of Santarpana Janya Vyadhi. So treatment including Nidana Privarjana, Apatarpana, Shodhana, Shamana and Patya and Karshana Rasayana are beneficial. Shamana therapy, we can use drugs which is having Deepana, Pachana, Lekana property and disease specifying like anti-diabetic, anti-inflammatory, anti-hypertensive, anti-obesity and cardioprotective herbs are beneficial. So overall, these treatments helps to increase the quality of life of people by reducing the inflammation and prevention of disease. So I'd like to express my heartfelt gratitude to Dr. B.B. Ram Reddy, sir, HOD professor, and Dr. Soumya S.P. ma'am, professor, Department of Kaya Chikitsa, Sushita Ayur Medical College, Bangalore. These are the references. Thank you, ma'am. Thank you.
Doctor.
Yes, ma'am.
Metabolic disorder.
Yes, ma'am.
Can you please explain?
Yes.
How you said in Vihara, Achinta is one of the cause for metabolic disorders.
Yes, ma'am.
So can you explain the pathophysiology of that? Your pathophysiology slide did not include anything on that.
Due to Achinta, it is in terms of it leads to the physical inactivity. So your mind is not mind. Here there will be no work for mind, and when there will be like mind is not indulging in any activity, it leads to the like we give more concentrate on like sedentary lifestyle, ma'am. Like
No.
I will refer, ma'am. This. I will refer it.
Sir. Ma'am, are we done?
Yes, madam. Madam.
Yes.
Very big thanks to all our presenters of this session 6 for your high quality presentation and dedication effort. Now I request our esteemed judges to please share your concluding remarks and overall observation about this session. Dr. Ashwin sir, Dr. Kavita and Dr. Sahu sir.
I don't see Ashwin sir here.
Okay.
Yes, ma'am. Hello.
Yes, sir. Yes, sir.
Okay, sir.
Sorry, there was some technical problem, ma'am. Now presentation's over. I have to conclude, ma'am.
Please your concluding remarks, sir.
Okay. Yeah, I thank CCRS, especially the Bangalore Center, for giving me this opportunity. to share my views and judge the presentations. The scholars, PG scholars have made a good attempt. However, I think there are some major concerns which I wanted to highlight. In most of the presentations, I think the concepts were either not clear or they are unable to present in a clear manner, especially related with the metabolic disorders, how they understood the concepts in the Ayurveda. I think they were unable to convey it properly. The second point is about the literature review. So they haven't done their literature review properly. Hopefully they are from this CBDC batch, and exclusively 6 months of research has been taught for them as per the NCSM syllabus. So they are more accomplished to do the literature review and present their findings. So I think most of them have made a half-hearted attempt and in superficial manner, focusing on a single concept and try to elaborate on that. So my humble suggestion will be, actually, if you are taking a concept, then you need to have a holistic approach. Actually, you understand the concept and then try to see what is the knowledge gap. Then how you wanted to actually present it. So that clarity should be there. And I think in most of the presentations, except for a couple of presentations, this is lacking. And always there is a room for improvement. And hopefully with these suggestions in your future presentations, you may incorporate it. Thank you.
Thank you, sir.
Hello. So first of all, congratulations to all the participants who presented their papers nicely. So I just want to mention one thing. When you are putting the slides, the concept you should clear first. So otherwise you are not clear, you are not able to explain these things when the reviewers or research person should ask. So that was one thing. Another thing, maximum participants also should be maintain their time. What is the allotted time? Only 2-3 persons are literally they have taken extra time. That is also one concern. When you presented, you should present in timely manner. That is shows your thing, and within this time you should try to explain all these things. Don't take more time. And this is my observations. And now all the presentations are good. So as Osman sir was telling, to take the things properly in proper way for your future, because long future in there. To try to improve in this way. Otherwise, all the presentations are good, and I am also very much thankful to CCRS and my organization, CCRS, and all the DG, DPG, and himself, and all the mainly to give me an opportunity to be the resource person. And thanks to the all of the resource persons, very colleagues to me, Madam and Osman sir, and all the participants. Thank you very much. Thank you.
Thank you, sir. Dr. Kavita, madam.
Yes, madam. Congratulations to all the presenters. It was a good try, but I agree with Ashwin sir that I felt it was for other except for some 2-3 presentations. Last moment presentation, for the heck of presenting, we are not supposed to present. Whenever we present, especially in a scientific session, we should be acquainted with why, what, how we are presenting. So because you are all PG students, I think this is the time to learn. So I want to suggest that be well prepared. If you are presenting somewhere, be well prepared. You should know word by word why you have put that word, where you have put that word, what is the purpose. And also keep yourself relevant to the topic. There were some papers which I did not feel the relevance to the title. So I suggest all of you to please take it seriously whenever you are presenting, especially in a scientific session, because this will help you to understand the concepts very well. Thank you.
Thank you very much, madam, all our esteemed judges, for all your valuable guidance and inputs. Now we'll move on to our next session.
session 7. I welcome our respected chair, delegates, presenters of session 7 to the pre-conference virtual presentation of the International Conference on Ayurveda and Integrative Approaches to Obesity and Metabolic Syndrome. This is based on the theme Diabetes and Related Subjects. We have total 12 presentations lined up in this session. Our esteemed judges for this session are Dr. Veeraj Hegde, Professor, Department of Swastha Vrutta, Yenapoya Ayurveda Medical College, Bengaluru. Veeraj Hegde sir is a distinguished Ayurveda physician and academician with over 13 years of teaching and clinical experience. He holds the BMS and MD degree in Kaya Chikitsa from SDM College of Ayurveda, Udupi, along with a diploma in acupuncture. Dr. Hegde sir has authored over 12 research papers in peer-reviewed journals. His research portfolio includes a CTRS-sponsored study on dyslipidemia and participation in a Ministry of Health-funded innovation project worth 2 lakhs addressing anemia prevention. He has organized various EME programs and serves as an external examiner for RGHS, GAU and Amrita University. Welcome you, sir. Our next judge is Dr. Bhaskar Rao. He has done his UG from Government Ayurvedic College, Vijayawada, post-graduation from NIE Jaipur, from the Department of Roga Vignana and Vikriti Vignana in the year 2002. Sir is presently working as Associate Professor, SV Ayurvedic College, Tirupati. Welcome you, sir. Dr. Ashok Patil, Principal, BLDE AVS Mahavidyalaya. Sir has done his PhD in Swastha Vrutta from SDM College of Ayurveda, Hassan. He has our 25 paper presentation and handled 9 projects including CCRS. He has received Best Teacher Award at DGM Ayurvedic Medical College, Gadag. He has developed e-Swastha Vrutta record and implemented for third year BMS. He has done his work in one of the component of overall IT technology recognized with Ayush IT Award by the Ministry of Ayush, Government of Karnataka. He is a peer reviewer of AYU, UGC Care and other related research journals. Member Editorial Board of CAHER. He established specialty OPD for obesity and lipid disorders in collaboration with Jeevan Rekha Research Institute. He is a developer of SuSwastha software, customized diet and lifestyle advisory software. Welcome you, sir. Welcome all our esteemed judges. I also welcome all our presenters of the session 7. General instruction to all our participants during presentation. Please ensure that your microphone is unmuted during presentation. Keep your camera on as far as possible during presentation. Maintain a stable internet connection. Strictly adhere to your allotted time. Okay, we'll start with the presentation. I would like to invite Dr. Smita Anekal. She will be presenting on the topic correlating the dual pathogenesis of type 2 diabetic mellitus and Madhumeha, an integrative approach to metabolic dysfunction. Over to Dr. Smita.
Good afternoon, ma'am. Am I audible?
Yes, you are audible.
I'll share my screen. Is my screen visible?
No. Yes, it's visible. You can go to presentation mode and start with your presentation.
Yes, ma'am. Good afternoon, everyone. I'm Dr. Smita Anekal from second year PG scholar from the Department of Roga Nidana, Government Ayurveda Medical College, Bangalore. Today, I'll be discussing about correlating the dual pathogenesis of type 2 diabetes mellitus and Madhumeha, an integrative approach to metabolic dysfunction. So diabetes mellitus is a chronic metabolic disorder which happens due to insufficient insulin production, insulin resistance, or both. This leads to systemic inflammation, and clinically it is expressed as polyphagia, polydipsia, and polyuria, among other symptoms. Why is it very important for Indian doctors to know about this is because India is the capital of diabetes mellitus in the world, and this has caused the epidemic of the century. Long back, our acharyas, they have recognized this and considered Madhumeha as one of Ashtamahagadas. Charakacharya has given 2 sampraptis. One is Avarnyajanya and another one is Dhatukshayajanya Madhumeha Samprapti. In both, the Samanata of Nidana, that is, Parthiva and Apyaguna Pradana Nidana Sevana, leads to Kafadosha Dushti and Kafadosha Prakopa and Medodhatu Dushti. When this takes Stanasamshaya and Basti, it leads with other doshas, it leads to the manifestation of Prameha, eventually developing into Madhumeha. So, Avarnajanya Madhumeha is explained in the 17th chapter of the Sutrasthana, that is Kyantasharisiya Adhyaya. Here, while explaining about Staulya or Santarpanajanya Vyadhi, he says Atisevana of Kafakara Ahara Vihara leads to Vriddhi of Kapha dosha and Pitta dosha, and Mamsa and Medodhatu Dushti, which in turn does the Marga Avarana of Vata, leading to Kashta Sadhya Madhumeha. This Madhumeha so formed is due to not only Vriddhi of Kapha, even Pitta is involved, and Mamsa and Medodhatu Dushti is there in association with Vata Avarodha. So how do we understand this in the context of biochemical research? Is through insulin resistance, which is nothing but reduced responsiveness of tissues, especially muscle, liver, and fat to insulin. Here, defective insulin receptor signaling leads to chronic inflammation and oxidative stress, which causes lipotoxicity and ectopic fat accumulation, especially in the abdominal viscera. Coming to Dhatukshayajanya Madhumeha, this is explained in Prameha Nidana and Prameha Chikitsa chapters, wherein primarily Kafakara Ahara Vihara Sevana leads to Kapha dosha vriddhi. Primary dosha is Kapha dosha vriddhi and Medodhatu dushti. When the rogi or the Vaidya tries to pacify this vriddha kapha, it leads to pitta and vata vriddhi, and sequentially this dosha vaishamya leads to dhatukshaya and ojohani, leading to progressive metabolic dysfunction. Here, this samprapti takes longer duration, and the sadhya kapaja prameha transforms into asadhya vataja madhumeha. So how do we understand this through biomedical lens? Beta cell dysfunction, which is nothing but progressive loss of beta cell mass and decrease in insulin secretion capacity. So here what happens is, due to glucotoxicity and lipotoxicity, there is oxidative stress on the endoplasmic reticulum of the beta cell, leading to apoptosis and decreased insulin synthesis. Not only that, there is decline in the beta cell regeneration also. So how do we integrate the both? In Avarnajanya Madhumeha, we can understand this as hindrance in the binding and signaling of insulin at the receptor level due to fat, oxidative stress, and inflammation. That is Vriddha, Kapha, Pitta, Meda, and Mamsa Dhatu Dushti, leading to Vataja Avarodha, that is metabolic obstruction, which leads to hyperinsulinemia. Coming to Dhatukshayajanya Madhumeha, the beta cell dysfunction due to chronic stress on the pancreas leads to decrease in the insulin production, which culminates in ojokshaya, which can be understood as reduced anabolic capacity and deterioration of the metabolic resilience. Now, when I say two samprapti, there are not two types of madhumeha, rather there are two stages of madhumeha. So first kapha and medo dhatu dushti leads to vata avarodha, which leads to inaction of the insulin. This can be taken as insulin resistance. Due to this, there will be increase in the insulin production, that is hyperinsulinemia. This leads to metabolic strain on the beta cells, which leads to the beta cell exhaustion, which can be taken as dhatukshaya and ojokshaya, leading to beta cell dysfunction. At the end, there will be transformation from the reversible obstruction to irreversible degeneration. This leads to metabolic decompensation. This we can understand as Kashta Sadhya Madhumeha turning into Asadhya Madhumeha, wherein collapse of metabolic hemostasis happens. So why are we doing all these exercises? Is to understand the pathogenesis or samprapti of Madhumeha through the lens of biochemical biochemistry, and to integrate a state-specific integrative medicine using Pratipurusha Viksha Siddhanta to do the Samprapti Vigatana in Madhumeha Rogi. Thank you.
Thank you, Dr. Smita. I request our respected chairs to give your valuable comments on this. Dr. Bhaskar Rao, sir.
Yeah, my question is to the scholar. How to differentiate these
Sir, your voice is breaking. Sir. It's not audible. Mobile is joining that, yeah. Sir, you are not audible, sir. Dr. Ashok, sir, do you want to give any comments on this, sir? Dr. Veeraj, sir?
Am I audible?
Yes, sir, you are audible.
Thank you for the presentation, doctor. My doubt was regarding what was the references. Is it only from Charaka what you have quoted, or are there any other references where all these pathophysiologists or the Samprapti Gatakas can be correlative?
Sir, for this presentation or for beta cell and insulin resistance, I have taken only Charaka reference. I have not taken Sushruta or Ashtanga Hridaya reference.
And you also opine that Madhumeha would be the last stage of diabetes mellitus, the whole syndromatic way.
Sorry, sir. Can you please repeat the question?
Okay. Is it the Madhumeha that would be the last stage of any end stage renal pathology, or is it the beginning stage? Like Madhumeha would be the first stage where you start diagnosing if something has happened with the insulin resistance, or Madhumeha is the stage where already everything has happened and it has led to a stage of a irreversible pathology.
Sir, in Madhumeha, as I told, there are two Sampraptis. So in the first stage, that is the Avarnajanya Samprapti, if we take it, that is the initial stage, sir. If we go to Dhatukshayajanya Samprapti, that will be the end stage wherein renal pathology has also started and chronic renal pathology is there, sir.
Thank you, doctor.
Okay, thank you.
Thank you, sir. We'll move on to our next presentation by Dr. Kaveri on the topic Madhumeha across paradigms and Ayurvedic and modern science perspective. Dr. Kaveri?
Yes, ma'am.
Yes. You share your screen.
Is it visible, ma'am?
Yes, doctor, please.
Hello. Ma'am,
Yes.
is my screen visible, ma'am?
Yes, it's visible. You can
Shall I start, ma'am?
Yes, yes.
Shall I start, ma'am?
Yes, you can start.
Okay. Good afternoon, everyone. My topic of presentation is Madhumeha across paradigms, an Ayurvedic and modern science perspective. Coming to introduction, so I have considered diabetes mellitus as a metabolic disorder where there is a dearrangement in the carbohydrate, lipid, and protein metabolism is seen due to hyperglycemia. What happens when there is hyperglycemia? If I take an example of the nephron, from the efferent arteriole, glucose is absorbed into Bowman's capsule and passes to PCT, where most of the glucose is reabsorbed back into systemic circulation. When there is increased glucose level in the blood, This glucose fails to reabsorb back into systemic circulation. Therefore, it passes along with urine, causing glycosuria. Along with this, there is a passage of luminal fluid causing polyuria. So I have correlated diabetes mellitus type 2 to Madhumeha and hyperglycemia to Tanumadhuryata. As the definition of Madhumeha itself says, according to Vagbhata, Madhuram echa sarvesham prayo madviva mehati, sarve api madhumehakya madhuryacha tanorataha. Due to Sharira Madhuryata, there is excretion of Mutra, which resembles Madhu and which is of Madhurarasa, which is nothing but hyperglycemia is leading to glycosuria. Also, I have considered Madhumeha as a metabolic disorder, where there is a hamperment in the Datvagni, Bhutvagni, and the formation of Ama is seen. So it is of two types. One is Avaranajanya, can be compared to insulin resistance, and Dhatukshaija can be compared to reduced insulin production. These both leading to micro and macrovascular complications, which is nothing but of Avarana pathology. So the circle is never ending. That's why Madhumeha is said to be Mahagada, which is Asadhya. So these are aims and objectives to study and review the pathogenesis of diabetes mellitus type 2 and the Samprapti of Madhumeha and the role of Basti in treating Madhumeha. And materials and methods, I have referred various Ayurvedic and allopathy books to attain this knowledge. So coming to pathogenesis of diabetes mellitus, so if we consider a cell has two receptors. One is for glucose, another one is for insulin. Whenever the glucose enters into the cell, insulin stimulates the enzyme which converts glucose into glucose 6-phosphate. It enters into glycolysis pathway and the formation of pyruvate, then Krebs cycle, then the formation of ATP, thus energy for the cell. If there is no insulin or resistant to insulin, there is no stimulation to the enzyme which converts glucose into glucose 6-phosphate. No glycolysis, no Krebs cycle, and no ATP, thus no energy to the cell. Instead, it stimulates glycogen in the liver to form glucose again, causing hyperglycemia, and excess glucose convert into glycerol, then to triglycerols, which is released in the blood as VLDL and LDL. That's why in diabetic patient, there is altered lipid profile is seen. So coming to Samprapti can be understood in two ways. One is Dhatukshaija, another one is Avaranajanya. So Dhatukshaija goes like this. Due to Vatakara Ahara Vihara, there is Vata Prakopa, Dhatukshaya, Ojakshaya, excretion of Ojas through Mutra leading to Madhumeha. Avaranajanya due to Kafakara Ahara Vihara, Kafa Dushti, Medo Dushti, Avarana to Vata, Vata Prakopa, excretion of Ojas through Mutra leading to Madhumeha. In Avarana pathology, if the person is Stula and Balavan, we can adopt Apatarpana line of treatment, that is Vamana or Virechana. In Dhatukshaija line of Samprapti, so if the person is Prusha and Durbala, we can adopt Santarpana or Brahmana line of treatment. So Basti is said to be Brahmana, so can be adopted in Madhumeha. Also, Madhumeha is a Vata Pradhana Tridoshaja Vyati, so Basti is best treatment. The indicated Basti in Madhumeha is Astapana Basti Swalpa Matra Pramana. So in commentary, he says, so we can adopt Pada Hina Basti, which is nothing but Madhu Tailika Basti. It has gunas like Nati Snigdha Ruksha, that's why it is called as Napumsaka Basti. And also it is Deepana, Brahmana, Balya, and Mehahara and Rasayana properties. So it is an example of a case report of 32-year-old man came with 6 kg weight loss in 6 months and tiredness lasting 6 to 8 months, along with elevated FBS, PPBS, HbA1c, serum C-peptide levels, and altered lipid profile with no other symptoms. We have diagnosed it as a Madhumeha, and 3 courses of Madhu Tailika Basti was given. So before and after treatment, you can see the changes. So coming to discussion, based on previous information, I have correlated few things. That is hyperglycemia to Tanumadhuryata, insulin resistant to Avarana, reduced enzymatic actions due to insulin resistant to Datvagni or Bhutvagni Manya, impaired glycolysis result in reduced ATP production to Dhatukshaya and Ojakshaya, excess lipolysis and proteolysis to formation of AMA. So coming to Madhu Thailika Basti, mainly it contains Madhu and Thaila in equal quantity. So Madhu has 2 properties mainly, Yoga Vahitva Guna, that is enabling catalytic effects, and Sukshma Marga Anusaritva Guna, that is allowing penetration into minute capillaries and cells. When Madhu is mixed with a Thaila, which is having Vatahara property, Vyavahi, Ushna, Snigdha Guna, and blended with the Erandamulak Vata, possessing Tikta, Swadu, Ushna, and Shoshahara, Mehahara and Medahara properties. Due to Madhu's Yogavahi Guna, it assimilates all these qualities, and due to Sukshma Marga Anusaritva Guna, it reaches each and every minute cell and tissues, thereby correcting metabolism and strengthen the cell. So it acts from head to toe. That is Apadatala Murtastan Doshan Pakvashayo Stitaha Viryena Bastiradante Kasto Arko Bhurasaniva. Coming to conclusion, every 5 seconds, 1 person in the worldwide is dying due to acute and chronic complications of diabetes, highlighting the importance of managing the condition effectively. So rather than saying person is dying to MI or CVA, we can directly say person is dying due to complications of diabetes. So our primary goal is to maintain normal blood glucose levels, correct the metabolic imbalances, and prevent complications. So incorporating Basti Karma, which act as Brosha Pratyanika, Vyadhi Pratyanika, and Samprapti Vikatana Chikitsa, individuals with diabetes can better manage their condition and reduce the risk of complications. These are my references. Thank you, one and all.
Thank you, Dr. Kaveri. I request our chair to please share your comments if you have any.
May I?
Yes, sir. Yes, sir.
Thank you for the presentation, Doctor. You have gone across paradigm of other references of Madhumeha. So I ask you, what are the references or what is your insight on Kleda concept in Ayurveda, wherein Madhumeha has an wherein Madhumeha is involved in, where you have Kleda as a concept involved in Madhumeha. What is your insight on it?
Sir, mainly, like if you observe Dusha, so they have mentioned 10 Dushyas now, sir. In that also, Kleda is one of those. And mainly, the affected dosha is the Bahudrava Shleshma, and mainly the dosha is Kleda, sir. So in both, there is Ambuguna, we can see Ambuguna is affected, sir. So Kleda is like Malarupi Kapha we can take, sir.
And what is that you want to see through modern perspective?
Not sure, sir.
Thank you, Doctor. Thank you.
Thank you, sir.
Dr. Kaveri, can you show the conclusion slide? Conclusion slide.
Yes, sir.
Next slide, next time. Where you got this reference for the first sentence?
In one of the article I read, sir, in that I found it.
Which article? Have you quoted that article as a reference here in the reference section?
No, sir.
Usually, while stating the concluded remarks, first it should be related to your topic, and as well as if you are stating anything in a conclusory slide, it should have a valid reference, because it is a statement what you are giving from your end. So that should be there. Okay. Rest of the things are fine. Okay. That's all from my side. Okay.
Thank you, sir.
Thank you, sir. Can we move on to next presentation, sir?
Yes, sir. Yes, ma'am.
Thank you, Dr. Kaveri. Our next presentation is by Dr. Pooja on the topic concept of Dhatu Paka in Santarpanota Vyadhi, pathophysiology linked to modern insulin resistance. Dr. Pooja. Dr. Pooja, you're not audible. Yes.
Ma'am, am I audible?
Yes. Now you're audible. You can start.
Good afternoon, everyone. Myself, Dr. Pooja, final year PG scholar, Department of Kaya Chikitsa, GMC Mysuru. And the title of today's presentation is Ayurvedic Diagnostic Perspective of Prameha. So, introduction, Prameha is...
Dr. Pooja. Hello.
Sir, am I audible?
You are audible, but here in our letter, what we have received, concept of Dhatu Paka in Santarpanota
Sir, actually, Actually, my answer deleted. It was been sent has been also be deleted, sir. So I've changed the topic.
Okay,
Sorry for the inconvenience.
concept of Dhatupaka in Santarpanotya Vyadhi, pathophysiological link to modern insulin resistance.
We go to
Yes, sir.
title page, Dr.
The previous the abstract which has been sent was deleted, and my PPT was also deleted. So I've changed the topic.
Okay, whether it is approved for presentation, considered.
Yes, sir.
Please consider, sir, no issues.
Yes, yes.
We have received a communication also. No.
Okay then. Okay. You continue, Dr. Pooja.
So, introduction. Sir, am I audible? Introduction. Prameya is a metabolic and urinary disorder described in Ayurveda, characterized by Prabhuta Mutrita and Abhidha Mutrita, where entire Vyadhi is explained based on the Mutra Lakshana. From the diagnostic perspective, our Acharyas provides a multidimensional approach encompassing Roga Pariksha and Pariksha with special emphasis on Mutra Pariksha to identify dosha predominance, disease type, and prognosis. Tailabindu Pariksha and observation of urine color, smell, consistency provide valuable qualitative indicators reflecting internal metabolic derangements. Early diagnosis is crucial for prevention of complications like Dhatukshaya, Prameya Pidaka, and to prevent the progress into the Madhumeha.
Pooja?
Hello.
All right. Yes, doctor.
So,
Yes, please continue.
aims and objectives. Aims and objectives to analyze the diagnostic parameters of Prameya from the Ayurvedic viewpoints. So, according to Mutra types, and it's based on the Varna, Sparsha, Swarupa, Gandha, Rasa, Pramana. It has been divided, and the analysis has been done. So, Udaka Miha is Sita Varna, Shita Sparsha, and Acham Udakopamam, and Nirgandha, and Pramana is Bahu. Ikshu is Kande Rikshu Rasa Sankasha. Shita Isha Pichilam, Swarupa is Avilam, and Rasa is Atyartha Maduram. Sandra is Swarupa is Paryushita Sandri Bhavati. Sandra Prasada is Kinchit Samhanante Kinchit Prasidate, and Shukla is Shukla Varnam. So, Shukra is Patikabam, Shukra Mishram, Shita is Shita Sparsha, and Atyartha Maduram Rasa. Sikata is Mutran Mutragatan, Anun Dosha Nehiti, and Nalala is Pichila Sparsha and Tantubatta Talaiba. So, Kshara, among the Pitta Mehas, Kshara is Ksharavani, and Sparsha Ksharavat, and Gandha is Ksharagandhi and Ksharavat Rasa. Kala is Masivarna, the Kala Varna is Masivarna, and Sparsha is Ushna, and Neela is Sakshapakshinibam, which looks like a blue jay bird color, that is dark blue color, and the Rasa is Amlam, and Rakta is Raktavarna, Sparsha is Ushnavarna, then Gandha is Visra, and Lavana Rasa. Then Manjashta is Manjashtodaka Sankasha Varna and Visragandha. Then Haridra Varna is Haridrodaka Sankasha and Katurasa. And among the Vadasa Prameha, Vasabam Varna, Swarupa Vasamishra, and Majja is Swarupa is Mutranasha Majjameheti, and Madhu is Pandu, is said to be Pandu Varna, and Ruksha Sparsha, and Kashaya Madhurasa. I have taken the types of Prameha and with the modern clinical equivalents, that is Udakameha and Astimeha can be compared to diabetes insipidus, and the Ikshuvalika Meha and Madhumeha can be compared to glycosuria, Shukrameha to sparturia, Haridra Meha to uroglynuria, and Manjashta Meha to hemoglobinuria, and Rakta Meha to hematuria. According to Ayurveda, various methods are described for the examination of clinical conditions, and several factors are considered for its assessment, such as Ashtavida and Dashvita Pariksha. So, ordinary purpose of these examinations is to arrive at the appropriate diagnosis to treat the condition accurately. Diagnosis of Prameha in its Purvarupa stage will helpful in prevention of the disease as well as its complication. Mutra Pariksha, one of the Ashtavida Pariksha, crucial for its Prameha diagnosis and prognosis as it is eliminates the Dravadhatu from Sharira, causing significant changes in physical constitution, chemical contents, and the biochemical parameters. So, Mutra Pariksha can be done in terms of Darshana and Prashna Pariksha. Hello.
Hello, you continue, Doctor.
Hello, am I audible?
Continue, Doctor Pooja. You can continue.
Dr. Pooja? Doctor, continue.
Based on the Lakshanas and the modern diagnostic tools, that is Prabhuta Mutrita is increased amount and frequency. The frequency volume chart it can be assessed through the frequency volume chart, and Avila Mutra, turbidity of urine. So it is diagnosed based on turbidity meter, and the Rupa Fena Mutra is Otex mixer or cyclomixer. Through this can assess through the Fena Mutra, and then Sandra Samhanante Kruta Mutra. So multiple reagent tests like specific gravity, centrifuge, and the sample check after 24 hours. So Madhura and Lavanda Rasa can be assessed through the dipstick test, that is multiple reagent strip test glucose and electrolytes in the urine. Sparsha is Shita, that is strip thermometer temperature just after voiding of urine. Snigdha Pechulam Ratsna through the parchment paper. Conclusion. Prameya is a Santarpanota Vyadhi closely correlates with the type 2 diabetes mellitus. The Ayurvedic diagnostic approaches with emphasis on Mutra Pariksha provides a detailed qualitative assessment on metabolic and urinary changes that reflect internal dosha, imbalance, and disease progression. Traditional methods such as Thailabindu Pariksha and observation of urine characters like Varna, Gandha, Sparsha Pramana offer valuable insights into the type of prognosis of Prameha. When integrated with a modern diagnostic tool like biochemical urine analysis, these classical approaches enable a comprehensive and individualized understanding of the disease. This combined Ayurvedic and modern diagnostic framework not only facilitates early detection and accurate assessment, but also helps in effective prevention and holistic management of Prameha. Thank you.
Thank you, Doctor.
Hello.
Yes, sir. Hello, sir.
Thank you for the presentation, Doctor. I would ask you about the differential diagnosis that you will be taking in terms of only Ashtasthana Pariksha and Prameha. What all other diseases you can consider for the urine analysis?
Sorry, sir. I'm not audible. Hello.
Is it now?
Hello.
Is it audible now?
Hi, sir. Audible.
Yeah. What all differential diagnosis that can be considered in case of the urine analysis other than your different types of Prameha? And is it only that you see by the physical appearance and get to a conclusion?
Sir, by glucosuria, by passing of glucosuria and other parameters. So in that we've also we can be considered, and not just the physical parameters. Passing of glycosuria also, and so in that way also it is diagnosed. Prameha can be diagnosed. Madhumeha.
Thank you for that. Are there any your analysis on Mutra Krichra, Mutra Gata, and urine presentations?
So, sir, it is done for only for the Prameha, not for Mutra Krichra Gata.
Thank you.
Hello, Dr. Pooja. Hello.
Sir.
Pooja, what
Ha,
is
sir.
meant by Prashna Pariksha? How to understand Prashna Pariksha in Mutra Pariksha? Prashna.
So in the Mutra Pariksha, we can ask the number of frequency that the patient passes. From that, we can assess the either the number of times and nocturia if the patient have the just to pass the urine at the night. So we can ask the number of frequency and if any of the color changes or frothy changes in the urine. So in the Prashna Pariksha, we can assess all this. We can ask all this to the patient.
No, you mentioned only frequency in your answer. What about color changes and all are darshana, isn't it? What are the
Sir, but
questions
as
which are
a
to be? What are the questions which are to be asked in terms of Mutra Pariksha? Frequency is okay. Frequency. What are the other components which are to be asked as a question?
Hello, sir.
What are the other questions in terms of Prashna Pariksha of Mutra Pariksha?
Sir, apart from that, there is frothy color changes and any of yes, sir, color changes if it is of complete white or in such way we can
Color
ask
changes is
question.
darshana, no? Once again.
Sir,
Change of the color
regarding the
identified darshana. What sort of a question? It's okay, it's okay. Okay, Dr. Pooja. Shall we go to the next presentation?
Yes, sir. Yes, sir. We move on to our next presentation by Dr. Rajata on the topic on clinical research and evidence in Ayurvedic treatment of diabetes mellitus. Dr. Rajata.
Yes, ma'am. Is my screen visible now?
Yes, yes, visible. Make it full screen.
Yes, ma'am. Is it full screen now?
Yes. You start with your presentation.
Good afternoon. I'm Dr. Rajata Ara from Dravya Guna Department, GMC Bengaluru. I'll be presenting on a review on clinical research and evidence in Ayurvedic treatment of diabetes mellitus. Introduction. As we all know, diabetes mellitus can be loosely correlated to Prameha in Ayurveda. It is the most affected disorder affecting the humankind worldwide due to sedentary lifestyle, improper dietary habits, and psychological stress. In Ayurveda, Prameha is considered as a Mahagata. It is a chronic and obstinate disease. Ayurveda views Prameha not merely as a single disease, but as a spectrum of metabolic disorders, resulting from impaired Agni, accumulation of Ama, leading to disruption of normal tissue metabolism. Modern science also interprets diabetes as a multifactorial metabolic disorder characterized by chronic hyperglycemia and associated with long-term complications affecting the eyes, kidneys, etc. In Ayurveda, different upadrava like Hrinetra, Jihva, Shramanopadeha is also mentioned. I'll be taking some cases as evidence-based medicine is gaining popularity. I'll be dealing with few cases in which Shodhana is done along with Shamana. This is Stula Prameha case, management of obesity-induced type 2 diabetes mellitus through Ayurveda case study. In this, a 53-year-old female with uncontrolled diabetes was treated with Virechana Karma followed by Palatrikadi Ganavati and Vidangadi Loha for 3 months. As you can see in the table, there is evident result. That is, FBS was 396 before treatment. It became 113, PPBS 544 to 124, HbA1c 13 to 5.4. Deepana Pachana was done with Nagaramurta Churna, Snehapana with Murchita Tilataila, Svedana with Dashamula Bashpa Sveda, Virechana with Rivratadi Yoga. This is also a case in which Shodhana was done. That is, it is a 55-year-old male patient with the diabetes mellitus and dyslipidemia with the classical symptoms like Prabhuta Mutrata, Ati Pipasa, and Daurbalya. He was given Virechana with Rivritleha followed by Nishamalaki 5 gram twice daily with Shilajithu Rasayana for 90 days. After 3 months, FBS came down to 112 from 198. PPBS came to 156 from 287. HbA1c reduced to 6.3 from 8.2. And clinically also the patient reported significant relief in thirst, fatigue and excessive urination. This is a case of Vamana. In this case, Group A received only Shamana Aushadha, that is Varadhiganavati. In Group B, Vamana Karma was done, followed by Varadhiganavati. After 60 days, Group B showed marked improvement in glycemic parameters as well as symptomatic relief. Mean reduction in fasting blood sugar was 35 to 40% in Group B, whereas 20 to 25 in Group A. HbA1c 1.2% reduction was seen in Group B, whereas 0.6% was seen in Group A. This is a single case report in which only Shamana Aushadha was given. 67-year-old male with Kafaja Prameha achieved complete reversal of diabetes with Kataka Kadiradi Kashayam and Chandra Prabhavati, reducing HbA1c from 14.8 to 6.0. The patient had classical symptoms like excessive thirst, fatigue, and frequent urination, which were also reduced. And this is a case of Vata Pradhana Prameha. In this case, treatment should be more of Rasayana and Brahmana. Hence, this patient was given Darvyadi Gruta for 60 days. This helped in restoring Dhatu Bala and Agni. After the follow-up period, Amalaki Churna and Nisha Katakadi Kwarta was also given. In this, we can see a difference in BMI. That is, there was a slight weight gain, which is due to Dhatu Bala. This is a case in which Triphala Darwadi Kwata was used as an add-on therapy with metformin. Group A were given only metformin and Group B were given metformin along with Triphala Darwadi Kwata for 90 days. In this, qualitative parameters like Prabhuta Mutrata, Avila Mutrata, Kshudadikya, Karapadadaha, etc. significantly reduced in Group B. And control group having diagnosis Madhumeha, total global count reduced by 52.9%. Whereas in add-on, that is Triphala Darwadi Kwata along with the metformin, total global count reduced by 70.52%. Discussion. The compiled clinical evidences and case analysis collectively demonstrate the holistic and multidimensional role of Ayurveda in the management of Prameha. Ayurveda therapy not only addresses hyperglycemia, but also the underlying metabolic disturbances, that is Agni Mandya, Kapha Meda Dushti, and Ama Sanchaya, offering a comprehensive model for disease reversal. Understanding all these cases, we can divide it into subheadings, that is integration of Shodhana Shamana. In some cases, Shodhana along with Shamana was done. In these cases, Shodhana cleanses the body and enhances the metabolism, thereby correcting the Agni and helping in increased absorption of Shamana Aushadhi. A role of individualized treatment. As we all know, you can't prescribe the same medicine to all patients. Ayurveda's success lies in individualized treatment based on Prakriti, Dosha, Pradhanya. For example, the Vata Pradhana Prameha, you can't give Nishamalaki or Hasanadi Kwata Churna. Hence, Darvyadi Gruta was given to increase the Agni Bala and Dhatu Bala. In metabolic correction and mechanistic correlation, the reduction in biochemical markers, that is FPS, PPBS, was seen across cases, can be linked to restoration of Agni and correction of Srotorodha. Comparison with modern integrative paradigm, we always have a doubt whether it can be given as an add-on therapy. As we can see in this case study, it gave a superior result compared to metformin alone, indicating the potential for safe Ayurveda modern integration. Conclusion, it can be noted that in most of the cases, the diabetes with Ayurveda intervention not only gave laboratory changes, it also gave symptomatic relief, which highlights Ayurveda's potential to improve the quality of life of diabetic patients through a multifaceted approach involving Aushadha, Ahara, and Vihara. Thank you.
Thank you, Doctor. I request our respected judges to share any comments if you have.
Shall I?
Yes, sir. Yes.
Thank you for the
Hello.
presentation, Doctor. Sir.
Thank you, sir.
Hello. Can you hear me?
Yes, sir. Yes, sir. I can hear you.
Yeah. I have a question for the presenter. After
Yes.
the treatment, how many days later you have taken blood reports?
Sir, I have done a
Immediately
review.
after the
Virechana?
It differs in various case studies, sir. In one case
No, no, no.
study, it was given
In case one, case two. Let me know case one, case two.
case 1, case 2, it was done after 30 days, sir.
After 30 days, no? Right.
Yes, sir.
So you said HbA1c has drastically came down from 13 to 5. So is it true? Because the HbA1c is an average glucose level of minimum 90 to 120 days. How
Sir,
can you say that after 30 days?
The treatment was done for 90 days, sir. And after that, in the follow-up period of 30 days later, the tests were done, sir.
That's what. After treatment, you have taken it, no?
Yes, sir.
After the meanwhile, in the mid treatment area, have you checked the blood values?
No,
Blood
sir.
sugar,
No, sir.
HbA1c.
No, sir.
It is absolutely impossible that HbA1c will drastically come down from 13 to 4.5, 5.5 because it is an average blood glucose which is there in the RBC, right? So before presenting such kind of laboratory reports, please have some kind of respect to the reports. See, this is absolutely not possible, right? See, symptomatically, I can understand. Until unless if you won't give insulin, even if you inject insulin also, that HbA1c levels will not come down. It takes almost 6 to 8 months. Okay?
Yes. Yes, sir.
You carry on.
Okay, sir.
Shall I?
Yes, sir.
Doctor, with the presentation you have made with an review, and there is no
Yes,
proper filter for it, like what you want to say at the end. You have given some conclusion about it will be acting on different stages, different paradigms and all. But a review article, it is better you put some methodology barriers, like I'll be focusing on only comparative studies, that too with one such treatment protocol itself, or anything that would have a particular type of filter which would come to some conclusion at the end, that you can say, okay, this type of treatment is good from when I see through 15 articles, when I go and review 15 or 20 articles. So that would be a last concluding remark. Now, when you see all these papers, you only get to know that it acts, and it acts in different way. What other thing would you directly opine after seeing it? Like there should be some essence that you have given, not like every other person has seen these and you have been just narrating it. It should be something that you have reviewed, and one or two concept that you have taken out of these all papers. What is that you find it?
Sir, I wanted to include different kinds of studies, that is only single case studies and comparative study add-on therapy, like that I wanted to do, sir. Yeah, but it got a little bit confused.
Thank you, doctor.
Thank you, doctor. Now we move on to our next presentation by Dr. Abdul. His topic is on role of diet and lifestyle in prevention and control of Madhumeha. Sir, do you want to give any comments, sir? Dr. Ashok, sir?
No, madam, no.
Okay, sir.
Carry on, carry on. Okay.
Dr. Abdul? Dr. Abdul, you are not audible. Dr. Abdul, you unmute yourself.
Is it audible?
Yes, you are audible now.
Slides are showing.
Yes.
Good afternoon. Myself, Dr. Abdul Rao, second year PG scholar, Department of Rachana Sharira, Government Ayurvedic Medical College, Bangalore. My topic of presentation is role of food and lifestyle in the management of Madhumeha, diabetes mellitus. Introduction. It is one among the Vataja Prameha. Vagpata used Madhumeha, whereas Sushruta used it has Kshaudra. References: Charaka Nidhana 4th chapter, Chikitsa 6th chapter, Sushruta Nidhana 6th chapter, and Sushruta Chikitsa 11th chapter, Ashtanga Sangraha Nidhana 10th chapter. Madhumeha is the lifestyle disorders arises mainly from the improper food habits and a sedentary lifestyle and internal genetic changes. Ayurveda states that excessive intake of the sweet, sour, salty, heavy, and cold foods leads to increasing of the kapha dosha, that root cause of Madhumeha. Food items like curd, milk, jaggery products, new rice, and meat of land and aquatic animals aggravates the kapha and promote excessive urine formation, causing prameha. Lack of exercise, improper daily regimens, and kapha increasing diet contributes significant to the development of the Madhumeha. Overall, continuous consumption of the kapha promoting foods that without balanced activity disturb the metabolism and initiate prameha. Role of management of Madhumeha. A proper diet with the regular exercises should be planned according to the patient's strength. Meals must be taken at regular timings. Avoid eating between the meals and follow the breakfast, lunch, and light dinner pattern. Snacks and juices may be taken only once or twice a day. Delayed meals or skipping food should be avoided. As per Acharya Charaka, fill the stomach half with the food, quarter with the water, and quarter left empty for the air. 1 Anjali is considered as the ideal quantity. Prefer food that is bitter, pungent, or astringent, and start the day with the bitter substances to boost metabolism. Commonly advised food includes neem leaves, coriander leaves, bitter gourds, triphala, and jambu, etc. Food to be limited in the Madhumeha. Avoid kapha and may the increasing foods such as sweet, new rice, jaggery, sugarcane products, and refined sugars. Limit high fat or heavy solids like aquatic meat, black grams, Bengal grams, cheese, paneer, butter, and other milk product. Reduce starchy vegetables such as potato, sweet potato with high glycemic fruits like banana. Minimize consumption of processed items including bread, pasta, fried food, stock food, and sweetened breakfast cereals. Restrict calorie-rich liquids like milk, curd, milkshakes, fruit juices, sugarcane juice, sugar beverages, alcohol, and adulterant honey. Avoid excessive water intake and unnecessary snacking that may aggravate the kapha and disturb metabolism. Preferred diet for the balancing of the doshas. A regular diet should focus on balancing doshas and reduce kapha and the medha using the light, wholesomeness, and metabolic supportive food. Prefer cereals like barley, broken wheat, unpolished old rices, red or black rices, maize, and occasional millets such as ragi and bajra. Include nutritional rich seeds and pulses such as sesamums, horse gram, green gram, soya, and sunflower seeds and mustard. Use digestion enhancing spices like ginger, garlic, bay leaf, pepper, coriander, dry ginger, and coriander leaves. Choose light and kapha reducing vegetables like bitter gourd, snake gourd, green leafy vegetables, capsicum, cucumber, drumstick, onion, radish, etc. Prefer low glycemic digestive friendly fruits includes guava, haritaki, vibhitaki, amalaki, kiwi, berries, oranges, and sapitta. Role of lifestyle in the managing Madhumeha. Ayurveda emphasizes on dinacharya, daily regimen for the restoring balance, making lifestyle correction essential in Madhumeha. Shift from immobility to mobility. That is, avoid sedentary habits and engage in the regular physical activities to reduces the blood glucose. Physical activities helps the body utilize glucose effectively, making it the key component in the Madhumeha management. Ensure sound night sleep 5 to 8 hours and complete. Avoid the day sleep as it increases the kapha aggravation and aggravates the condition. Walk 100 steps after every meal and avoid lying down or sleeping immediately after food intake. Next, Dinacharya practices for the Madhumeha. Wake up before 6 a.m. to prevent the kapha and the medha vriddhi and to maintain the body in natural biological rhythm. Maintain bowel regulation through early morning evacuation, that is Shaucha Vidhi, to prevent accumulation of the toxin, that is Mala Sanchaya. Follow good and hygienic oral hygiene with neem twing chewing, brushing, and weekly Rasanjana application to avoid eye-related complications like diabetic retinopathy. Practice Nasya using Anutaila or Kshirabala Taila to clear the nasal passage and balancing doshas. Use Dhumapana by initiating herbal medicated smokes prepared with the Grutta, turmeric, and Triphala powder for the cleaning of kapha from the head and neck region. Gandusha, the Gandusha supports the oral cleansing and stimulates the digestion beginning in the oral cavity with the salivary amylase. Tambula Sevana aids the Urdhvakaya and Indriya Shodhana, helping clear the kapha from its primary sites. Abhyanga or Udvartana strengthens the body by improving the firmness and compactness, helping prevent neuropathy and atherosclerosis in Madhumeha. Medha Vilepana, the regular bath enhances the circulation, boosts digestion, maintains hygiene, and prevents the Prameha Pidakas when done twice daily. Vyayama exercise brings the lightness to the body, preventing the kapha from becoming overall fluid, stabilizing medha and the balancing doshas. Recommended activities include brisk walk, 500 meters, jogging, swimming, cycling, skipping warms up, household works, and outdoor games for 30 to 40 minutes daily, preferably with morning exposure. Pranayama yoga in the Madhumeha management. Pranayama and the yoga brings the harmony between the body and the mind. Breath regulates the mental stability and improves overall well-being. Daily practice of Surya Namaskara, basic yogasana, and Sudarshana Kriyas and meditation for the 15 to 20 minutes helps to control the Madhumeha. Following Yama and the Niyama strengthens the discipline, enhances mental clarity, and maintains the long-term physical and an emotional balance. Pranayama improves the oxygenation, reduces the peripheral insulin resistance, and enhances the glucose utilization at the cellular level. Stress, a major contribution factors to the Madhumeha, is effectively managed through regular breathing patterns and meditation. Conclusion: Madhumeha is the progressive metabolic lifestyle disorders resulting from the improper diet, inactivity, and stress. Balancing food, proper sleep, regular activity, yoga, and the pranayama helps to regulate the kapha, prevent the disease's progression, and improves the glucose metabolism by enhancing the hepatic glucose uptake. Thank you.
Thank you, Dr. Abdul.
Hello.
Yes.
Hello, Dr. Abdul.
Yes, sir.
Yeah, I think it would have been nice if you would have mentioned about fasting or upavasa, which is a major component of lifestyle management of Madhumeha. Because the whole point here is excessive accumulation of fat, either it is viscerally or externally. So somehow we have to burn it, right? That's the only principle that will work. So all other are not directly related. So only we have to deal with the excess fat
inside the blood vessels, inside the visceral organ, somewhere we have to burn the fat due to vyayama, maybe controlling the carbohydrate portion, maybe sometimes frequent fasting, upavasa. So it would have been more accomplished.
Sir.
Okay, in addition to my teacher, Dr. Bhaskar Rao sir's opinion, what I wanted to tell you is, Abdul, this is all about healthy practices for apparently healthy person, what you have mentioned, this food and lifestyle. But you have mentioned in the title itself, it is mentioned that it is prevention and control of Madhumeha. So you need to concentrate on etiological factors of Madhumeha and how best these Dinacharya practices, what component of Dinacharya, what component of Ritucharya, what component of specific Vyayama, specific Pranayama, which can prevent the further progressions of Madhumeha. Like that, it would have been done. Now, the throughout presentation, these are the food and lifestyle for apparently healthy person, which are mentioned in the classics. Okay, not to the specific for the management of Madhumeha. What I felt, it is generalized. It can be generalized to role of food and lifestyle in the management of any metabolic disorder. Like that also you can quote it out. That means what I wanted to tell you is it should be very specific to the etiology of Madhumeha and how this etiology can be, how the pathology can be, further progressions of pathology can be curtailed by means of adopting some specific Dinacharya procedure, some specific pranayama, specific yoga, like that. It would have been highlighted. Okay, sir. Next presentation.
Thank you, sir. Thank you, Dr. Abdul. Our next presentation is by Dr. Megha M. Our presentation is on topic trimethylaminiuria as Sahaja Datvagni Mandya, Ayurvedic understanding and management strategies.
Am I audible, ma'am?
Yes, you are audible.
Is my screen visible, ma'am?
Yes.
Good afternoon, everyone. Myself, Dr. Megha Pujari, second year PG scholar, Department of Kaya Chikitsa from JMC Mysuru. Today, I am going to present on the topic trimethylaminiuria as Sahaja Datvagni Mandya, Ayurvedic understanding and management strategies. Coming to the introduction, trimethylaminiuria is also known as the fish odor syndrome. It is a rare genetic metabolic disorder which is mainly characterized by accumulation of trimethylamine. It is a volatile compound responsible for strong fish-like odor. This odor can be seen in person's sweat, breath, and urine. This occurs mainly due to deficiency of hepatic enzyme called flavin-containing monooxygenase 3, which normally converts the trimethylamine into odorless form. Along with the biochemical presentation, it also affects the person's psychological and social well-being. This concept in Ayurveda framework, we can understand it as Bija Dushti leading to the Sahaja Datvagni Mandya. We can also take help of the concepts like Agni, Ama, and Srotas. Coming to the pathogenesis, the primary cause for this disease is genetic deficiency of the enzyme, that is hepatic microsomal flavin-containing monooxygenase 3. When a person consumes the food which are containing L-carnitine and choline components, the gut bacteria will convert these components into trimethylamine. If a person's gene expression of FMO3 is normal, his liver will be producing the enzyme called FMO3, and the conversion of trimethylamine into trimethylamine oxides takes place, which is in a odorless form. So this is a normal function. But in case of there is a mutation in the FMO3 gene expression, the liver cells will not produce this gene FMO3. Then leading to the no conversion of trimethylamine into trimethylamine oxides, leading to accumulation of this toxic material trimethylamine and cause the disease trimethylaminiuria. Coming to the Ayurvedic understanding, we can say that Roga Sarvepi Mandagno. The root cause for each and every disease in Ayurveda can be considered as Mandagni. With the help of modern concept, I have tried to correlate it in the Ayurveda. Like the disease is mainly due to the mutation in the FMO3 gene, which can be understood as Bija Dushti, and that is leading to hepatic metabolism defect, which can be understood as Ekrit Srota Shodhana, leading to the enzyme deficiency, which can be understood as Agni Manda at Dhatu level, causing the trimethylamine accumulation, which can be understood as Ama accumulation, leading to fishy body odor, that is Daurgandhyata. Along with this, the person is also having psychological distress, that is Manasika Vyadhi. The doshas involved here are all the three doshas, predominantly Pitta, which is mainly involved in the metabolism, and Kapha, which helps in accumulation of the morbid materials, whereas Vata, which helps in the transmission of this Ama into all parts of the body, causing the Daurgandhyata. In the Vata, mainly Vyana and Udana Vata are adding on. Coming to the Ayurveda management strategies, as we know, it is a genetic disorder, so complete cure is not possible. So the thing we can do here is my screen visible, ma'am?
Visible.
Okay. As we know, it is a genetic disorder, and complete cure for this disease is not possible. So the thing we can do is we can maintain the Agni Mandya at Dhatu level and enhance the hepatic metabolism and maintain the quality of life of the person. So in broader aspect, the treatment strategies we can apply here are Deepana, Pachana, Shodhana, Shamana, Rasayana, and also maintain the Patya and Apatya. In Deepana Pachana, the main function will be to enhances the Agni and also helps in the liver function improvement. The Deepana drugs we can use here are, for example, Trikatu Churna, Chitrakadivati, Panchakula Churna, and in Amapachana we can use Nagakeshara, Guruchi, Mustaka like ingredients. Coming to the Shodhana aspect, I have chosen here Virechana because in this disease, as I've told earlier, all the three doshas are being involving, and Virechana would be the best treatment to maintain to balance all the three doshas. It also helps in maintaining the Agni at Dhatu level. It does the Srota Sodhana, regulates the Mala Pravruti. It improves the Rasa Raktadi Dhatu nourishment, which could reduce the systemic accumulation of the trimethylamine. The drugs I have chosen for Virechana here is Nimbamrutadi Eranda Thaila and Guduchi with Eranda Thaila. I have chosen this because along with the Rechaka property, these drugs are also having liver protective functions. Coming to Shamana Chikitsa, I have selected the drugs like Manjishtadi Kashaya, Navakarshika Churna, Gandhaka Rasayana, Kaishara Gugulu. All these drugs mainly having the properties like Rakta Prasadana, Rakta Shodhana, Pitta Kapha Shamana, Agni Deepana, Amapachana, and also act as antioxidants, antimicrobial activity. And for external application, Nimba Taila can be used, which is Kledahara, Rakta Prasadaka, Tvacha, and Daurgandha Nashaka. Coming to Patya and Apatya, in Ahara, we can consume the Patya Aharas like Mudga, Puranashali, Kattutumbi, Koshataki, Dhanyaka, Dadima, Takra, Trikatu, Ushnajala, Sukoshnajala. In Apatya, we should avoid all the foods which are having the choline and carnitine component rich. Coming to Vihara, we can go for in Dinacharya aspects like daily we can go for Abhyanga with Chandanadi Taila and Ubbartan with Tripala Churna, which helps to remove the morbid odor from the surface of the skin. Along with that, to maintain the stress of the person, pranayama and meditation can also be advised. In discussion point, I would like to discuss the challenges about this disease in Ayurveda, as it is a genetic in nature. So we don't have the complete reversal of the disease. So long-term management is required rather than complete cure. And there are limited classical references are there to this disease. So this will be a challenging, and we have to ask the patient to follow strict Patya and Apatya. So this will also be a challenging factor, and it is a psychological burden and a stigma. There is lack of standardized herbal dosage and clinical trial evidence. By this, I like to conclude my topic by saying that at present, this is a unknown topic in Ayurveda system. So the scope is limited for the treatment aspect. So further research should be done on this topic to know the better treatment and to efficiently treat the disease. Thank you.
Comments
Thank you, doctor. Any comments by our judges?
Shall I?
Yes, sir. Yes, sir.
Thank you for the presentation, doctor.
Thank you, sir.
The disease which you have taken is, I think there is no any case reports or any single cases which have been treated or diagnosed in terms of Ayurveda or in Ayurvedic lines so far. I have not gone through any case studies. Were there any case studies that have been published?
Sir, actually, this disease is very rare in nature. In Ayurveda, there are no articles have been published on this disease or any treatment strategies, but there is some pharmacies which are producing a kit named trimethylaminiuria kit. They have been using. In that, they included the drugs like Manjishtadi, tablets, capsules, like this medicines they are having, but as such proper research work has been not done. So I have explained it in a conclusion that we need research on such type of diseases.
Are there any other similar mode of action that can be seen? Like if it is only based on the signs and symptoms, see the same drug can be used in many different other rasagata, doshagata, dushagata diseases. So is it the similar mode of actions? Are there any, like you have already confronted that it is then a new disease and a new pathway which we are now yet to find? But still, if you have any plans on that, like at the end of your conclusion, you have come up with that new the mode of actions that can be seen, that you give Virechana or any other Shodhana karmas, and you find that in a longer period of time there might be changes. What type of changes you expect that can happen? Is it the
Sir,
genetical changes that will happen after
no, sir.
giving your...
No, so genetical changes can't be done, sir. But we can maintain the quality of life. Like the major thing here will be playing role is the pathya and apatya. If the person is not consuming the food which are rich in the components like choline and carnitine, then this condition may be avoided by doing our Shodhana and Shamana Chikitsa. Whatever already, if the person has been manifested with the symptoms, symptoms can be reduced in a faster way. For that purpose, we have to go with this treatment management.
Thank you, doctor. And the drug which you said, no, that they actually have come up without any proper clinical evidence, or how they are, what are the backups they have on it?
I don't have much idea about that, sir.
Thank you, doctor.
Thank you.
What is the prognosis of this disease?
The prognosis in Ayurveda aspect, we can consider it as the Yapya Vyadhi, sir.
In Ayurveda,
It is not a life-threatening, but it is...
Not in Ayurveda, it's a trimethyl aminuria. So what happens at the final stage? If a patient goes like this, at some point, will there be any complications related to liver functions?
Yes, sir. There may be it may lead to cardiac related disorders or liver related disorders in future, sir.
Actually,
and it is also a psychology.
Trimethyl alamine is one part of amino acid.
Yes, sir.
If this amino acid is excessively going out, then some kind of protein related disorders in future he may get. I think you have taken this case. I think you should come up with what are the complications, what will happen if patient is left untreated, so that the treatment will be having that much of importance. If the patient is like this forever, there is no point in treating such kind of rare cases. If it is not fatal anymore, if the patient is not dying, except that fishy smell of urine, if any other complications are there, then it is worth
mentioning this kind of rare cases. Otherwise, I don't find any point you presenting without a proper literature or a proper study. So you should have referred something, some kind of complications related to this disease. It would have been more complete. But anyway, I appreciate your like out of the box thinking.
Thank you, sir.
Thank you very much, sir. Thank you, Dr. Megha. We move on to our next presentation, Dr. Vaishnavi, on the topic therapeutic efficacy of Vangabhasma and Nagabhasma in Prameha, a differential pharmacological insight. Dr. Vaishnavi?
Yes, ma'am.
Yes.
Is my presentation visible?
Yes, now visible.
Good evening. The topic of my presentation is therapeutic efficacy of Vangabhasma and Nagabhasma in one second. In Prameha, a differential pharmacological insight, guided by Dr. Vikram. So coming to the introduction, our acharyas have very well mentioned about the Nirukti, the Nidana, as well as the Samprapti of Prameha, where here they have also mentioned 10 Sadhya Kafaja Prameha and 6 Yapya Pittaja, as well as Asadhya Vataja Prameha. Moving on to the yogas which are taken here in this presentation, we have Vanga and Naga. Both of them, they belong to the Putiloha category, where Samanya Shodhana for both of them is mentioned, where we do Dalana with Taila Takra, Kavamudra, Aranala and Kulataja. And for Vishesha Shodhana, especially if we are using it in the Prameha Vyadhi, Dalana along with Haridra Churna and Nirgundi Swarasa can be done. And for the Marana, that is Bhasmikarana procedure, Haratala and Palashamula Swarasa can be done, Bhavana can be done and made into Chakrikas, and further Putas can be given for the Bhasma. Even for the Naga also, Shuddha Gandhaka and Nimbu Swarasa can be taken for the procedure. Moving on to the Rasa Panchaka of both Nagabhasma and Vanga Bhasma. I would like to highlight the Rasa of Vanga. It has Tikta Kashaya, Amla Katuk Kshara Lavana Rasa, while Naga has Tikta Lavana Katuk Kshara and Madhura. Here they have difference in Virya, where Vanga Bhasma has Shita Virya and Naga Bhasma has Ushna Virya. Moving on to the effect of dosha, Vanga has effect on Kapha Pitta Dosha, while Naga has mainly Vatahara, also action on Kapha Vata. If we consider the karma mentioned for Vanga Bhasma as such, we have Sarva Prameha Hara mentioned for Vanga Bhasma and Sarva Prameha Vranapaha also. They differ in dosage. That is, for Vanga, 1 to 2 rati is usually given, while Naga, 1/4 rati to 1 rati is given. Also, it has action on Prameha, Kledahara property, and also in Sarva Prameha. These are the Amayika Prayogas which are mentioned in Rasatarangini, where Vanga Bhasma, as such, Bhasmas cannot be used individually, so they are usually given along with the proper Anupana. For Prameha, Vanga Bhasma we can give with Tulasi Patra Swarasa, Guruchi Sattva and Madhu, Shuddha Shilajatu and Madhu, Rasa Sindura, Haridra Swarasa. Naga Bhasma can be given along with Haridra, Madhu and Amalaki Churna, Guruchi Sattva and Madhu. In the formulation, we can see in Trivanga Bhasma, we have both Vanga and Naga Bhasma. In Vangeshwara Rasa, we have more of Vanga Bhasma, while in Vasanta Kusumakara, we have both Vanga and Naga Bhasma. Moving on to the discussion here, the selection of the Shodhana Dravya as well as the Marana Dravya matters. Since it is taken in Prameha, Haridra and Nirgundi Swarasa, which has the Tikta Katurasa, Laghuruksha Guna and Kafavatahara properties, as well as Medohara and Vranaropana can be taken. Palasha has Tikta, Kashayarasa, Ushnavirya and Vata Kafahara properties, while Haratala has Ushnavirya and Vranaropana action also. So as I mentioned, in Vangeshwara Rasa, Vanga Bhisma is used, and Vasanta Kusumakara, we have both Vanga and Naga. In the Amayika Prayoga, mentioned in Rasatarangini, Tulasi Patra Swarasa has the action of Kafa Medahara, Mutrala and Agni Deepana, while Guruchi Sattva and Madhu has Meda Kledahara property, Lekhana and Pramehagna. Shuddha Shilajatu has Meda Kleda Shoshana and Shroto Shodhana. Rasa Sindura has Shroto Shodhana, Agni Deepana, Dhatu Pushtikara, Meda Kafa Shamana. Haridra has Kafahara and Pramehagna properties, and Amalaki also has Pramehagna, Kleda Medahara properties, and also Vranaropaka. So I would like to conclude that we have to use proper Shodhana and Marana procedures, and the medias which are used should be selected on the basis of in which Vyadhi we are going to use. Based on that, the medias can be selected. And also here, Vanga and Nagabhasma are mostly used in Prameha, but they differ in the dose of administration. The Anupanas mentioned in Rasatarangini also. That is, Vanga Bhasma has more action on Kapha Pittaja dosha, while Naga has on Vata Kapha. So further research, animal studies or clinical studies should be made to know the proper mode of action of both of them, so that we can understand what exactly is the difference. These are the references. Thank you.
Thank you, Dr. Vaishnavi. Any comments from judges? Okay, we'll move on to our next presentation. Dr. Ekta. Dr. Ekta.
Yes, ma'am. Am I audible?
Yes. Your topic is on integrative analysis of glycosuria in relation to Shuvalika Rasameha, Shitameha, a conceptual study. Share your
Yes, ma'am. Yes, ma'am. I'll share my screen. Ma'am, is my screen visible?
No, not visible. Dr. Vaishnavi? She is,
Yes, ma'am.
You stop sharing your screen.
Yes.
Okay. Okay, Dr. Ekta, you go to presentation mode and you start with your presentation.
Yes, ma'am. Is it visible now?
Yes.
Ma'am, is it visible?
It's visible.
Yes.
Yeah, okay. Good evening. So I'm Dr. Ekta, and the title of my presentation is Integrative Analysis of Ikshuvalika Rasameha, Shitameha in relation to glycosuria, a conceptual study. This presentation is guided by Dr. Kirti ma'am and Dr. Sri Nagesh sir. So coming to the introduction, Prameha is one among the Santarpanajanya Vikaras, and according to the doshas, it is divided into 3 types, and there are subtypes of each doshic divisions. And when we see that Ikshuvalika Rasameha and Shitameha, the characteristics, one common feature is the sweetness of urine, that is Atyartha Madhura of the Mutra has been explained. And when we see the definition of glycosuria, it is also often described as a sign of metabolic disorder, which is characterized by the presence of glucose or its derivatives in the urine. So that is why these two can actually be brought under one umbrella. Coming to the relation, when we see, as I told you, Atyartha Madhura has been told under both the types of subtypes of Kapaja Prameha, and presence of the glucose or its derivatives in the urine is called as the glycosuria. So why there is another question that will come up, that is Madhumeha, which also has Madhuratva of the urine. Why can't that be considered as glycosuria? But then when we see the definition or the characteristics of Madhumeha, we can see that along with the Madhura Rasa, there is also the presence of Kashaya Rasa, which has been explained. So that is why probably a more better correlation would be glycosuria along with the Ikshvalika Rasameha and Shita Meha, where only Atyartha Madhuratva has been explained. So emphasis is given on the only Madhurata, same like how it is seen in glycosuria, that is the presence of glucose or its derivatives. So next, when we see the Nidanas as well, Kapaja Nidanas, we have Navadhanya, Sarpish Matam, Anupa, Audaka Mamsa, and so many other Nidanas, like the intake of dairy products, by those who have a sedentary habit or a sedentary lifestyle. So when we compare it with that of the causes of glycosuria, which is caused because of a metabolic disorder, there also the Nidanas get tallied. That is a sedentary lifestyle, obesity, high sugar or carbohydrate containing food, beverages, stress, and sleeping during the daytime. So this is what is the relation between the Nidanas of the two disorders. So when we see the dosha and the dosha vishesha in prameha, dosha vishesha is bahu drava shleshma, and then dosha vishesha is bahu abhaddata of mamsa, medas, vasa, and majja, whereas bahutva is seen in rasa, oja, sharira, kleda, and shukra, shonita. So because of this abhaddata or asamhata, or what we say is aghanata of the medo dhatu and mamsa dhatu, the sharira becomes shitila or shaitilyata is seen, which acts as a substratum for the Dushita kapha to spread quickly in the sharira, causing the prameha. So when we see the pathogenesis of glycosuria, the specific nidanas, as I told before, they reduce a cell response to insulin, which causes insulin resistance. So this will lead to increased glucose in the blood, which when the nidanas are continued, it can actually lead to reduction in the threshold of the glomerular apparatus, which can help, which actually aids in seeping down of the glucose molecules into the urine. So that is because the body wants to get rid of the glucose, there is increased loss of fluid as well through mutra. So the same thing almost happens in Kapaja Prameha. So that is Nidana Sevana will lead to Shleshma Prakopa, and Guna of Shleshma, that is specifically Madhurata, Shitata, Pichilata, Avilata, such things will be aggravated. And this Prakupita Shleshma will do Dushana of the Bahu and Abadha Medas, and which further leads to the Dushana of the Sharira Kleda. So we have Dushita Kapha along with the Dushita Medas and Dushita Kleda. So how is it actually seen in the urine? It is because of Dushita Kleda will be seen by excessive loss of fluid through mutra. Dushita Medas and Kapha will be seen in the form of its guna in the mutra, that is Madhurata, Pichilata, and Avilata. So when we see about as I told you before, there is a reduction in the threshold of the glomerular apparatus. And we know that Medovaha Sroto Mula is Vrikka. And when we see Vrikka, it is Rakta Meda Prasadajau. So Dushana of Medas is a main factor that is happening in the Samprapti of Prameha. So this Dushana of Medas is continuously happening. It means there is Abhaddhata of the Medas. So this Abhaddhata can be understood as loss of integrity, which is nothing but which can be roughly correlated to the reduction in the threshold of the glomerular apparatus. So this is causing the seeping down of glucose molecules or the madhuratva of the kapha into the mutra. So how to actually differentiate if a patient comes to us with glycosuria, whether it is Shita Meha or Ikshvalika Rasameha? A very thin line differentiation is the color of the mutra is specifically mentioned in Ikshvalika Rasameha, which is Kanda Ikshurasa Sankasha, and Bhrisham mutra, that is when mutra is excreted in large quantity, that is specifically seen or mentioned in Shita Meha. So that is a major differentiating factor. And why this is important is to understand the guna involvement and base our treatment based on the guna analysis. So coming to the conclusion, glycosuria can be understood under the lens of Ikshvalika Rasameha and Shita Meha when urine sugar is considered as a parameter, and loss of integrity of Medo Dhatu can roughly be correlated to the reduction in the renal threshold. And this thin line difference between Ikshvalika Rasameha and Shita Meha will actually help us understand the guna involvement in the pathogenesis. And Madhumeha also has Madhurata in it. But then along with Madhurata, there's also Kashaya Rasa involved. So that is why taking it alone as glycosuria would not be a good thing to do. So thank you.
Hello, doctor.
Yes, sir.
Can glycosuria be seen without diabetes mellitus?
No, sir. It cannot be seen without diabetes mellitus. Most of the times,
Sure.
hello, sir.
See, there is a condition, proximal and distal convoluted tubule, there is a loss of basement membrane, then glucose will be excreted.
Yes, sir.
Even though it is below the 180 mm of Hg pressure, right?
Yes, sir.
So
Yes, sir.
if 180 mg per dl, the sugar is excreted. That
Yes,
is
sir.
why these patients, they are not diabetic, but they go into hypoglycemic condition. Why? Because the blood glucose is being unnecessarily excreted by urine because of the damaged proximal and distal convoluted tubule where sugar has to be reabsorbed. That is not
Yes, sir.
happening
Yes, sir.
because there is a loss of basement membrane. This basement membrane is making the pores bigger, and so that sugar molecules are getting out.
Yes, sir. Yes, sir.
So all glycosuria conditions cannot be correlated with diabetes mellitus or any kind of a madhumeha or what you're saying, the prameha. Okay. So before presenting one clinical condition, just go through any other similar conditions there. It is quite possible. Just like proteinuria, how proteinuria is seen, because the permeability of glomeruli will be more, so that proteins are lost. Similarly, glucose also can be lost without the background pathogenesis or pathology of diabetes mellitus.
Yes,
So I
sir.
just want to add certain things, because when you are presenting in front of this audience or in international conferences, so some solid background should be studied first.
Yes, sir.
Otherwise the comparison is good. Good work.
Yes, sir. Sir, actually, I had a question.
Yeah.
Sir, when glycosuria, actually, I wanted to intend as a glycosuria as a cause of metabolic disorders. Can it be considered as Ikshvalika and Shita Meha, sir? Like apart from the kidney disorders, like the anatomical structures or any other genetic disorders, apart from that, if glycosuria is happening because of as a result of metabolic syndrome, then can it be considered as Ikshvalika and Shita Meha?
Yeah. Just because of the background is there any metabolic disturbances, metabolic errors? Then only we should consider as a Shita Meha or Ikshvalika Meha.
Okay. Yes, sir. Thank you, sir. Thank you.
See, when glucose is going out, it's a lot of sodium also will be excreted. Sodium, calcium also will be excreted. So it's not only sugar.
Sugars.
As
Yes,
you
sir.
as you rightly mentioned, sugar and other derivatives, metabolic derivatives are
Yes.
eliminated.
Yes, sir. Yes, sir. Thank you,
Okay,
sir.
right.
Yes, sir. Thank you, sir.
Thank you, Dr. Ekta.
Thank you, ma'am.
We'll move on to our next presentation by Dr. Soumya B. on the topic Ayurvedic Insights to Metabolic Disorders, Whole System Ayurveda Approach in the Management of Prameha.
Yes, ma'am.
Doctor, please, you can start. Share your screen.
Yeah, go ahead.
Yes, sir. Sir, is the screen visible?
Yes, visible.
Okay. Good evening, everyone. Myself, Dr. Soumya Bashetti. I am talking on the topic Whole System Ayurveda Approach in the Management of Prameha, that is Type 2 Diabetes Mellitus, with the case series. Mentored by Dr. Pramod Katti, Professor in the Department of Kaya Chikitsa, Ayurveda Mahavidyalaya and Hospital, Hubli. So starting with the introduction, we were talking about the metabolic disorders, including obesity, diabetes mellitus, dyslipidemia, and metabolic syndromes. These are the health concerns which are associated with the lifestyle changes, in which type 2 diabetes mellitus is the most common form of diabetes, affecting 90 to 95% of the diabetic population worldwide. And it is characterized by hyperglycemia, insulin resistance, and insulin deficiency, which is mainly caused by beta cell dysfunction or insulin resistance, or even both. In Ayurvedic classical texts, Acharyas have mentioned mainly 20 types of pramehas, whereas Acharya Sushruta mentions 2 types, which is Sahaja Prameha and Apatya Nimittaja Prameha. Mainly, Sahaja Prameha can be correlated to genetic predisposition, that is type 1 diabetes mellitus, and Apatya Nimittaja Prameha can be correlated to acquired type, which is type 2 diabetes mellitus. And whereas Thula Prameha, there is dominance of Meda, Kleda Dushti, and needs systemic approach by the application of Chikitsa Sutra mentioned by Acharya Sushruta, saying Sthulam Apatarpana Yuktibihi, which can be considered as Rukshana, Amapachana, Pramehapatyas, Vyayama, Pramehagnaushadis, and also Shodhana. So I am presenting with some Prameha cases treated with whole system Ayurveda protocol. Mainly the patients were selected on the common criterias, which included freshly detected and untreated cases of diabetes, and subjects presenting with clinical features of Prameha, presenting with minimum half of the subjective parameters, which are Prabhuta Mutrata, Avila Mutrata, Karapadadaha, Gurugatrata, Atisweda, Pipasa, Bahuashi, Shayasana Swapna Sukhirati. And the objective parameters included were fasting blood sugar, postprandial blood sugar, and HbA1c. So the treatment plan, considering the whole system Ayurveda approach in Prameha, was Rukshana and Amapachana given with Shadharanavati, with the Anupana Ushna Jala, with the dosage of 500 mg twice daily before food, till this Rukshana and Samyak Nirama Lakshanas appeared, and followed by Pramehagna Ushidi, which is Jambadi Ghanavati, with the Anupana Ushna Jala, 500 mg twice a day before food for 90 days. And simultaneously, the patient is asked to follow the Prameha Patyas and Vyayama, which are provided to them with a chart. This is Ayurveda Patya Kalpana and Prameha for Prameha and Vyayama chart, which was provided to the patient. And looking into the cases of Prameha, firstly, a female patient of age 47 years came with the FBS, PPBS, and HbA1c of 143 mg per dl, 205 mg per dl, and 7.82% before the treatment, which has been changed to 122 mg per dl, 198 mg per dl, and 7.43% respectively after treatment. And the second case, a male patient of 44 years, came with FBS, PPBS, and HbA1c 201 mg per dl, 345 mg per dl, and 8.99% respectively before treatment, has been changed to 80 mg per dl, 151 mg per dl, and 5.96% respectively after treatment. And in case 3, a male patient with of 57 years with FBS, PPBS, and HbA1c 177 mg per dl, 285 mg per dl, and 10.6% before treatment, has been changed to 238 mg per dl, 232 mg per dl, and 9.7% after the treatment. And in case 4, a male patient of 58 years came with 100 mg per dl, 198 mg per dl, and 6.5% respectively before treatment, and changed to 97 mg per dl, 197 mg per dl, and 5.7% after the treatment. So these are the lab reports of the patient. So next, coming to the discussion and the conclusion part, mainly whole system Ayurveda protocol, it treats the disease from the root by adopting the stage and stage-wise application of the Chikitsa Siddhanta. So Acharya Sushruta mentions Apatarpana Chikitsa in the Prameha Chikitsa Siddhanta for Sthula Pramehi, and further Acharya Dalhana elaborates it as the combination of Langhana, Rukshana, Vyayama, Shodhana, and Tiktakatu Kashaya Dravyas, etc. And in these cases, Langhana in Prameha would be considered as following the Prameha Patyas, and Shodhana was avoided considering the Alpa Roga Rogi Bala and Alpakala Prakarsha. So hence, application of whole system Ayurveda protocol in this Siddhanta included Amapachana and Rukshana Chikitsa with Shadharanavati,
Vyayama, Prameha Pathya Kalpana, and followed by Pramehagna Tikta Kashaya Shamanoshadis, that is Jamvadi Ghanavati. Thank you. Thank you for giving me this opportunity.
Thank you for the presentation, Doctor. You have taken the topic as the whole system Ayurveda approach. So would you also explain about how AMA can be understood in the pathophysiology formation of different disorders in metabolic syndrome, and also how it can be understood in treating?
Sir, mainly AMA can be considered like the lakshanas of alasya, madhurasyata, and less kshudha. So this can be treated by application of ama chikitsa and rukshana chikitsa mainly, where nirharana of ama should be done with the dravyas like chitraka, haritaki, saptaparna, etc.
Thank you,
And
Doctor.
also some shodhana can be adopted like udvartana. Yes.
How Shodhana is helpful in diabetes mellitus?
Sir,
What are the target organs where the treatment, the benefit of treatment is going to which tissue?
So mainly it helps in improvising the agni of the patient, where it helps in uptaking of the glucose into the cells and more production of insulin by a pancreas.
Okay, there is already insulin resistance, no?
Yes, so it helps in fat.
Then what is the point? What is the point if insulin is more also? Again, insulin is a fat storing hormone. If you have more insulin, more fat will be stored.
Yes, actually the resistance happens due to more fat present in the body. So if
Yes.
with the help of Shodhana, we can combat that fat, and so which indirectly helps in reducing the insulin resistance.
That means you mean to say increasing the metabolic activity of the body.
Yes, yes, we try to increase the metabolic activity.
Okay. Okay, good.
Thank you, sir.
Thank you, judges. Our next presentation is by Dr. Anjala on topic Translational Insights on Hemigraphy Colorata, Bridging Ayurveda and Experimental Science in Diabetic Wound Healing. Over to Dr. Anjala.
Yes, ma'am.
Dr. Soumya, you can stop sharing. Yes, sir. Dr. Anjala, you can start.
Good afternoon. Am I audible, ma'am?
Yes, you are audible.
Okay, ma'am. Good afternoon, everyone. Myself, Dr. Anjala Jabin, third year PG scholar from Shalidandra Department of STMH Bangalore. Under guidance of Dr. Parvati S, I'm dealing with the topic Translational Insights on Hemigraphis Colorata, Bridging Ayurveda and Experimental Science in Diabetic Wound Healing. So these are my contents. So as we go into diabetes mellitus and diabetic foot ulcer, diabetes mellitus is a chronic hyperglycemic oxidative stress and poor wound healing, which will lead to the diabetic foot ulcers, which will end up with the morbidity or infection and amputation in later stages. As the conventional medicines are either like systematic healing or local healing effect, we need a dual acting agent, both systematically and locally healing capacity. That's why we have selected Hemigraphis colorata, which has a very good wound healing capacity, which is comparable to soframycin ointment as per some studies. And it also possesses the anti-diabetic properties too. So, as we know, the diabetic foot ulcer is the most significant complication of diabetes mellitus, where it shows the peripheral neuropathy and foot deformities, and the patient may end up with a motor neuropathy or autonomic neuropathy, and patient will not get to know if the patient is getting any crack in the skin or any foreign body entered into the food part, and the patient will end up with the Rasa-Raktadi vitiation, and it will later in stages, it will get into the Shofadi Robas, and Puya will be formed, and the Dushta Prana will be formed in the patient. So as per Ayurveda, Shodhana and Dopana Chikitsa is the most two important treatment principle for the Dushta Prana. Why we have to go with the Hemigraphis colorata? Hemigraphis colorata is the usually the folklore medicine usually used for the cut wounds or bleeding type of ulcers, and the extract studies has shown the very good result with the phytochemical constituent like terpenoids has very good angiogenesis properties, and the saponins and alkaloids possess the anti-diabetic property which will help for the systematic healing of the DFUs, and the flavonoids and phenols will help for the antibacterial properties. So these all has been considered with the experimental evidences. Like in vitro studies, the enhanced fibroblast and endothelial cell migration has been seen, which will help for the faster wound closure, and increase in the transforming growth factor beta 1 and plasminogen activator inhibitor gene expression has been help for the promotion of extracellular matrix synthesis, and the human arachnosid access a faster closure with the increase in the transforming growth factor beta secretion also. So when we are going to in vivo studies, the Vista has shown very good result with the Hemigraphis colorata with the faster epithelialization, angiogenesis, and it also shows the good collagen deposition too. So the mechanistic pathway has shown a very like granulation tissue formation, reepithelialization, along with the angiogenesis and collagen maturation. So if we are seeing the diabetic wound ulcer models, the mimicking type 2 diabetic rats, Vista rats with the encountered with the Hemigraphis colorata ML or ointment, it has shown a very good result, like 80 to 90% of wound closure has been seen by day 14, and there is a drastic reduction in the inflammatory markers like interleukin 6 and tumor necrosing factors. And there is an increase in the vascular endothelial growth factor, which will lead to the angiogenesis, and the better collagen deposition has been seen. And there is also a good hypoglycemic control too. So all in all, the reduction in the MD and the increase in the superoxide dismutase, along with the catalyzing increase and glutathione, will enhance the antioxidant defense, which will enhance the tissue repair and matrix remodeling in later stages too. So if we are seeing in the Ayurvedic perspective, the Pranarobhana action of Hemigraphis colorata and the diabetic quality also can be considered for the formulation, like ointment, Kalpana, Malahara Kalpana. The base can be selected as and this can be taken for the consideration of Brenner treatment. So active oxygen species reduction and the anti-inflammatory action of hemigraphis colorata will help for the faster change from the inflammatory changes stage to proliferatory change, and angiogenesis will enhance the new blood vessels and will help for the blood circulation, and it will faster the wound closure, and fibroblast activation will help for the collagen deposition, and the wound will be happening very fast. So the glycemic control improvement will be attained, and the systemic control will be attained in DFUs. So these studies and these proofs are concluding with the hemigraphis colorata is having the dual benefit in DFU management, both systematically and locally, and the future directions has shown it's like a standardization of extract squalene or flavonoid markers for the further antibacterial and antimicrobial activities can be studied, or toxicity and validation of DFU patients can be done, or integration with modern dressing technologies can be done. These are my few references I have referred. Thank you.
Thank you, Dr. Angela.
Hello.
Any comments by our
Hello.
judges? Thank you. Yes,
Hello, ma'am. Hello, ma'am.
Hello, doctor.
Hello, ma'am.
Hello.
Hello, ma'am.
You're
Am I
audible,
audible?
doctor. I'm requesting for any comments from our judges.
Hello, ma'am. I'm audible.
Yes, yes, sir. You are audible. Sir, any comments?
Hello,
sir?
ma'am.
Can we move on to next presentation?
Yes, madam.
Okay, sir. Thank you, doctor.
Thank you.
Next
Ma'am.
presentation is Dr. Pooja.
Yeah, I can hear, ma'am. But
No, you are audible. You are
now
audible.
I can.
Okay, we move on to our next presentation by Dr. Pooja.
Yeah, okay.
Presentation is on dosha dynamics in
Okay,
the
okay. Thank you.
and management of Madhumeha. A conceptual review. Dr. Pooja.
Yes, ma'am. Am I audible?
Yes, yes. Dr. Angela, please stop sharing. Okay, Dr. Pooja, you can start. You can share your screen and start with your presentation. Pooja, yeah?
Yes, ma'am. Pooja, I.
Okay, okay. Dr. Pooja?
Hello, ma'am. Is my
No.
presentation visible?
Screen is not visible. Presentation. Share your screen.
Is it visible now, ma'am?
Slides or not? Now it's visible.
Good evening, everyone. I'm Dr. Pooja I, and I'm here to present my paper on dosha dynamics in the pathogenesis and management of Madhumeha, a conceptual review. Madhumeha, a subtype, is described and characterized by Avila Mudrata. Acharya Madhavakara defines Madhumeha as a condition in which the patient's entire tanu becomes Madhura and the mutra is as sweet as Madhu. It affects those who are Atisthula, Atisnigdha, Mahashana, Mandotsahi and progresses relentlessly like a bird returning to its nest tree, that is Nidadruma Ivandaja. Nidana includes Asa Sukha, Swapna Sukha, Mruja Vyama Varjana, etc. Coming to Samprapti, Nidana Sevana leads to Vriddhi of Bahudrava Shleshma and Abadha Medas, leading to Kafaplana Tridosha Prakopa and Dushti of 10 Dravya Sangraha. It causes Shitilata in the body, leading to Atipramana Vriddhi of Sharira, Kleda and Meda, leading to Avarodha in Mutrabha Srotas and Basti, causing Prameha. So that condition, which is initially kapha predominant, in later stages becomes vata predominant. This reflects a shift from anabolic to catabolic state. Therefore, understanding this is very important for deciding the proper therapeutics. Materials and methods. Brihatrayi, Laghutrayi and various contemporary articles and textbooks were reviewed for this. Coming to discussion, Madhumeha is a complex metabolic disorder arising from the derangement of kapha and medas, leading to Tridosha Prakopa and Dosha Sammochana. So in order to decide the proper therapeutics, first we need to understand the stages and types of Prameha Rogi. Acharya Charaka has told two types, that is Krisha and Stula Pramehi, and Acharya Sushruta has told Sahaja and Apatya Nimittaja. Sahaja can be taken under the spectrum of Krisha Pramehi and Apatya Nimittaja can be taken under the spectrum of Stula Pramehi. And while going to the therapeutics, first we have to observe whether the patient is fit for Shodhana or not. If the person is fit for Shodhana, then Snehapana with Priyangvadi Gana Taila is advised, followed by Vamana and Pragada Virechana, and Astapana Basti with Surasadi Gana Kashaya. Acharyas have not told Svedana in this condition because Svedana is Nishiddha for all Prameha Rogis. Also, they have advised Pragada Virechana because a Madhumehi patient has excess of Meda in the koshta, making the person Durvirecha. Therefore, Tikshna Virechana should be employed. If the person is not fit for Shodhana, then Shamana Aushadhi and proper Annapana is advised, and Mrudu treatment protocols like Nirapada Basti, like Madhutailika Basti can be employed. After Shodhana, patient should be advised with Santarpana rather than continuing with Apatarpana because this can lead to Dhatukshaya and cause various complications. Now coming to the disease progression, we know all Prameha, if not managed on time, leads to Madhumeha, which is the terminal and irreversible stage of the Prameha. And our acharyas have told Kapha, Pitta and Vataja type of Prameha, and each has subtypes. So each subtypes reflects a condition that is becoming more progressive and severe in condition. Example, in Kaphaja Prameha, if we take Udaka Meha, it is characterized by excessive urination like clear water. And Shukra Meha is a more advanced stage characterized by spermatouria. And Lala Meha is a chronic cystitis-like stage. Pittaja Prameha can be correlated to hematuria and diabetic syndrome with inflammatory urinary symptoms. And Vataja Prameha can be compared with uncontrolled diabetes with nephropathy, severe UTI, and with or without obstruction. Next, management. So we have to see which dosha is predominant. As we all know, Kaphaja Prameha, in that Vamana can be done. In Pittaja Virechana. And 7 days after Virechana, Astapana Basti Gana is advised. Acharya has told that the early stages where there is Madhuri Bhava is observed, that which we can understand as Kapha predominant, Shodhana is advised, whereas in later stages where Vataja Prameha is seen, where the Mudra becomes Kashaya and Ruksha due to the Upashoshana and Karshana action of Vata, there Basti and Shamana Aushadhi is more beneficial. And there is a condition called as Pramida, which has been explained by Acharya Bhoja, where he has told that there is Prabhuta Mutrata along with Prameha Purva Rupa, and that can be considered as a pre-diabetic stage. When this Pramida presents with Pidaka, it can be called as Madhumeha, representing the fully developed diabetic condition. And in contemporary science, we know the importance of the diet and the exercise. What has been understood now has been told by our acharyas many eons ago. Acharya Sushruta has told Panchavida Kriyashaya, that is from Gamana, Sthana, Asana, Shayana to Swapna, which represents the lifestyle which contributes to Prameha.
And based on the economic condition of the patient also, our Acharya has described various Vyayama. Like in Mahadani, he has advised various exercises like Viyuddha Krida, Gaja Turaga Ratha, and Padati Charya, etc. Whereas in Adani, they have told like living like a Muni, Eka Ratri Grama Vasi, Shilocha Vritti, Jana Vanara. Pada, they have told like Kashyap and Atisi Taila, which have been shown for, and known for lipid regulation, and Purada Dhanya, which provides satiety and energy. Coming to conclusion, the understanding of dosha dynamics in Madhumeha highlights the progressive nature of the disease from Kapha dominance to Vata predominance. Therefore, the therapeutic approach must also be dynamic, beginning from Shodhana in the early stages and shifting to Shamana and Rasayana in the proper Ahara Vihama and Nidana Parivarjana remain the cornerstone of prevention and long-term management. Thank you.
Thank you, Dr. Pooja. Sir, any comments, sir?
No, it's okay. Fine.
We move on, sir. For our last presentation of the day, Dr. Pooja DG. Presentation is on Ayurvedic understanding and innovative management strategies for insulin resistance. Dr. Pooja DG. You are there, na?
Yes, ma'am. Am I audible?
Yes, now you are audible.
Is my slides visible?
Yes. You can proceed. Go to slide presentation mode.
So, metabolic dysfunction through the lens of Ayurveda, strategies for prevention and therapeutic management. Good evening, everyone. This is Dr. Pooja, third year PG scholar from the Department of Kaya Chikitsa, JMC, Mysuru. So, these are the contents of my presentation. I'll be explaining it under three headings, that is 3P, prevention, pathology, and prescription, under which I'll be highlighting on Rutushodhana, Ashtavahara Vidivishesha Ayatana, and role of Manas, concept of Dushi Visha, and highlights on Virechana. Coming to Rutushodhana, in Ayurveda, we say the Prakopita doshas has to be eliminated seasonally. If not, they'll end up in causing a disease. How to understand this? That is, for example, in Sharad Ritu, there will be Pitta Prakopa. What it does biochemically in the body is there will be elevated internal body heat. It has an effect on increased hepatic load and bile activity, which also causes destabilizes the lipid metabolism. This is one fact, and there is one more thing. We can even understand it as seasonal inflammatory rise of state in the body. By advising Virechana, it helps in reducing the taking out the Prakopita Pitta out of the body, thereby reducing the inflammation and hepatobiliary stress, thereby leading to a better and regulated metabolism. And there is one more concept which I could say it is a boon for today's mankind, as faulty food practice is the main nidana or reason for metabolic dysfunction. Ashtavahara Vidivishesha Ayathanani plays a significant role here. Food nature is equals to metabolic nature. That's where the Ahara Prakriti plays an important role in. Processing reprograms metabolism. That is where the samskara is being highlighted upon. Quantity controls the insulin. The Matravat Ahara Ashniyat or Matravat Ahara intake is also holds good. Timing tunes the clock. That is, one has to take the food according to his body circadian rhythm and also according to the seasonal variation. And Desha, one has to take the food according to the Desha he's staying in or living on. Proper combination drives proper metabolism. That's where the Samyoga is being highlighted upon. Body state is equals to diet state. That is Upayukta, the one who is having the food has to have the knowledge of his own body in terms of Agni, that is Ahara Abhyavahana Shakti and Ahara Jana Shakti. Based on that, he has to take the food, and eating behavior is equals to hormonal behavior. That is Upayoga Samstha, the rules which are being explained in Charaka Samhita for the proper intake, that is Matravat Ashniyat, Stigdam Ashniyat, and has to be followed in order to maintain a regulated metabolism. In conclude, I would say mindful bites or mellow hormones. That is how mindful we are about our bites, the same way the body responds with the regulated hormones. And there is one more concept, the same metabolic dysfunction, initial metabolic dysfunction, we can even understand as Rasadusti. Acharyas have highlighted the Rasavah Stoto Rishi Nidana as Chintyanam Chatin Chintanat. That's where the role of Manas is being highlighted. The stress in today's generation, we are living the life with the stress. So how to tackle this? As this is the main cause, we know how it acts upon the cortisol and thereby upon the metabolism. So yoga chitta vritti nirodha, by adopting the yoga and by adopting acharya rasayanam dirgha aishyakaram. That is acharya rasayana is one such concept. I could even say that is a mano rasayana, that is manasa rasayana, said exclusively in Ayurveda. It's a non-pharmacological approach towards the mental health. And if we do not practice these preventive aspects in the life, what happens? Where we are going to land up in? We are going to land up in a state of the body called Dushi Visha, where the constant exposure to the Dushita Desha Kala Anna and Diva Swapna Abhishtashaha Esma Dushayate Dhatuhu. There will be Dushana of Dhatu, as it doesn't cause us the Dushana of Dhatu all of a sudden. It causes it's a constant increase in inflammatory state of the body, which has the ability or the capacity to do the metabolic dysfunction or by causing metabolic disorders, or it has the ability to kindle the autoimmunity. So to tackle this, they have said Doshi Visharta Suspinam Urdvam Adasya Shodhanam. Other Shodhana or Rechana has been indicated here. Before talking to the importance of Virechana, I would like to highlight upon one more body's pathological state, that is post-infection state. If once we are affected with the bacterial or any viral infection in the body, after the infection is gone, after taking the medicine, once the infection is lost, is it completely gone out of the body? No, there will be persistent inflammation and immune dysregulation and remnants of the pathogen and microbiome dysbiosis post-infection. Is any contemporary science are highlighted upon the post-infection case? No. That these pathological state even has a impact upon the body's health. But in Ayurveda, they say Jvarante Rechanam Chastam. So we have to do the Rechana post-infection in order to get rid of persistent inflammation, immune dysregulation, and microbiome dysbiosis. That's where the Virechana is being highlighted upon. So Virechana helps in decreasing the inflammation and by decreasing the autoimmunity and by maintaining the gut microbial integrity. It helps in regulating the metabolic disorder, regulating the metabolism, thereby metabolic disorders. So coming to the aim, that is Vastasya Swasthya Rakshanam Artharasya Vikara Prashamanam, even holds good in metabolic disorders or the dysfunction by following these concepts and the therapeutic measures. Ayurveda, with its holistic lens, it doesn't merely cure the disease, it cultivates metabolic harmony from within. Thank you, one and all. Thank you.
Thank you, Dr. Pooja. I request our judges, if you have any comments, sir.
Nothing from my side.
Okay. As we came to the end of this session 7, I kindly request our respected judges to deliver their concluding remarks.
I request Dr. Ashok Patil.
Yes, sir. Yes, sir. I'm very happy that all the scholars have presented to their level best. I feel very happy that I chaired the sessions with my teacher, Dr. Bhaskar Rao sir, who happened to be my teacher from 2004 to 7 at STM College of Ayurveda, Hassan. Sir, namaste.
Namaste, namaste. Nice to see you.
All the scholars have presented nicely. Now it's a day of integrated approach. Now it's an era of integrated approach, especially whatever the lifestyle disorders are there, metabolic disorders are there. The unique Ayurveda lifestyle and the charyas which are mentioned in the classics play an important role to prevent the progressions of the risk factors. Now, being a PG scholars in the presentations, you need to highlight what component of Dinacharya or what component of Ritacharya. You need to select a specific components where it can halt the progress of the disease by means of destructing the pathology at a particular level. That is to be highlighted. Some of the presentations have highlighted that, but most of the presentations, what I see is in general, for example, lifestyle and diet modifications, what you mentioned, it may not be particularly related to the diabetes mellitus. It can be generalized to all the metabolic disorders, but you need to highlight where the diabetes mellitus, if it is kept as a focused area, then what component can be specifically stressed and how the mode of action can be established by means of giving the special concentration to that. I appreciate all the scholars for their level best presentations. In the future presentations, let them adopt all these specific points. And one more thing is, when you are concluding the presentations, it should be of your own words. That means even though the Shastrakaras have mentioned some of the remarks, but how best those remarks are relevant to your specific presentations. So that point is to be highlighted. Once again, congratulations to all the scholars, and thanks to CRI for giving an opportunity. Thank you, madam.
So, sir, Dr. Bhaskar, sir.
Okay. First of all, thank you for inviting me to chair this session. It's really a nice session to be in. And actually, I was expecting brainstorming presentations, out of the box ideas from the new generation, Gen Z. But unfortunately, they just followed the same conventional methods of, diabetes is a metabolic error. It's not a disease. Errors can be corrected, but no one has concentrated on corrective measures. Everybody trying to give Vasti, Virechana, Vamana and all. We all know that they are bullshit. They are not going to work. They are going to work just transiently, temporarily, right? See, one thing is, we need to get convinced that this is a metabolic error. Somewhere the metabolism is not going the right way. Just we have to show right path. So no one has discussed about ketogenesis, ketoacidosis, such a wonderful topic in diabetes or metabolic error. So hypertriglyceridemia is one important topic. Fasting, intermittent fasting, that is one important area where entire world is concentrating on that. You simply present from textual point of view, the world will not listen. The world requires not textual references. It is a scientific references, clinical references. Okay. So only thing is, I would have been so happy if some of the scholars might have thought they have given the role of liver in the metabolic disorders, the role of insulin in the metabolic disorders, the role of insulin sensitivity metabolic disorders, the role of lack of insulin receptors on the cells in these metabolic disorders. No one has gone through such kind of things. Simply they are going through that all the Nidana, Pururupa. That is not going to work here. So we have entered into the next generation of medicine. See, we have to think a practical way. So no one of all of these presenters, no one will give Vasti for a diabetic patient who is having 13 or 14 HbA1c. So that is not practical. So we have to alter some metabolic chain, metabolic path. So stop eating carbohydrates, switch on to fats, switch on to protein diet, protein and fat ratio. So, and along with the exercise, along with some kind of a seasonal Rithucharya, Dinacharya, some of the medicines, Guduchi, especially wonderful drug, if it is given a person who is fasting, the Guduchi will increase metabolism like anything. So such kind of ideas the student should come up with, not simple old references, old thing that is not going to help. Since This is conducted by CCRAS. If it is conducted by any institution, I don't have any problem. But CCRS is apex body of research, new thoughts, new ideas. Okay, so in such cases, the young minds, young generation should come up with out of the box ideas so that the future generation will get benefited out of it. But apart from that, all of the students, like PG scholars, they have worked very well. But the only thing is, they have worked in a simply conventional way. They have to come out of it. They have to come out of it. Then only they will find some good research articles, research papers. Thank you for giving me this opportunity.
Thank you, sir. Dr. Veerad, sir.
Good afternoon, sir. Good afternoon, madam, and thank you for this opportunity from CCRAs. And I congratulate everyone for these their presentations. And as far as I have seen, all have tried to do their best in their fields. But only thing is, they have tried only most of them they have tried to just present the respective topics rather going on in an holistic approach. They have not tried to club it up and see what all other fields can also be included in this. But still, though they are in their first and second years of their PG, I think these are in their initial stages itself. If they get to start with these lines in future courses of their research fields, they might get improved with that. And there are no special what your comments on anything. I feel everyone has given their best of it, and a bit of it is to be organized. And because it is moreover the conceptual review and the narrative reviews and all, they should be more outcome oriented. That is what I felt, like Bhaskar sir and Ashok sir said about. It should be more outcome oriented, because something what is continued from the outcome of these reviews will be implemented either in the preclinical or clinical levels. So that is at least one thing that they have to search on and contribute on. And most of the time what happens is these are not converted into papers. They just put it for the sake of finishing and presentations. And some of the good titles are there which they will be wasting on just presenting. It is better if they continue with and go for full-fledged papers. And once again, thanks for an opportunity. Thank you, madam, and thank you, sir.
Thank you, sir. As we come to the close of today's session, I extend my heartfelt gratitude to our respected DDG sir, in charge Madam Bengaluru, for their constant support, and the organizing committee, especially Dr. Raghavendra for his conceptualization for this webinar, and then Dr. Ramana sir for his coordination, Dr. Rajendra for his technical support. I also express my sincere thanks to our distinguished judges, especially of session 7, for their patience hearing, cooperation as we ran short of time, for all your insightful evaluation and constant encouragement to our students, sir. Special appreciation to all the participants and presenters for their dedicated efforts and high quality presentations, which has contributed and added immense value to the themes of our today's discussions. I also extend my thanks to Mr. Rahul for his technical team throughout this virtual presentation, and also others who contributed to the smooth conduct of these sessions. Thank you one and all. Thank you so much.
The recording